All right, strap in, everyone. Today, we're diving headfirst into a world that most of us only see on TV trauma care. You've given us a mountain of material about this motorcycle accident, so it's like we're right there with the first responders, medical reports, charts, the works.
Absolutely. You've got enough here to make us feel like we're part of the team. We'll see how all the pieces of the puzzle fit together when every second counts.
Okay, so picture this. It's 2:30 p.m. on Highway 69. Our patient has had a motorcycle accident. Apparently, he swerved to avoid a raccoon.
Oh no, those critters can be trouble.
Yeah, and he ended up hitting a rock.
Ouch, that sounds rough. Now, you are the paramedic arriving at the scene. First things first, what's the initial assessment?
Okay, let's see. The report says he's conscious, which is a good sign. Breathing, but it's labored, and there's blood around his mouth, which is concerning. He also has a bunch of abrasions and lacerations.
Yeah, you'd expect that kind of thing with a motorcycle accident, unfortunately.
Definitely. And there's something else. They found medications in his pocket. Digoxin and Slow-K.
Medications. What can those tell us? Well, digoxin is often prescribed for heart conditions, and Slow-K is, as the name suggests, a potassium supplement. So those are things we're going to want to keep in mind as we go through this scenario.
Absolutely. We're already starting to build a picture of this patient, even just from these initial details. But right now, the immediate priority is stabilizing him.
Right. This is where that golden hour concept comes in. Those first 60 minutes after a traumatic injury are absolutely crucial.
Can you tell us why that first hour is so critical?
Well, think about it. In those first minutes, you're dealing with potentially life-threatening issues, uncontrolled bleeding, maybe a collapsed lung, a spinal injury. Prompt medical intervention can dramatically increase the chances of survival. We're talking controlling bleeding, stabilizing fractures, maybe even emergency surgery if needed. Every minute saved can make a huge difference.
Wow, so it's not just about getting to the hospital, it's about doing the right things in those first few moments.
Exactly. Time is literally of the essence.
So let's talk about that initial examination. What does it reveal? What are we seeing here?
All right, let's go through the details. The report describes a large contusion on his chest. There are abrasions over his body, indicating he's taken a tumble. He has an unstable pelvis, which is always a red flag. And this is a significant detail. His left leg is shortened and externally rotated.
Oof, that sounds serious.
It is. That leg position strongly suggests a possible hip dislocation or a fracture in the pelvis.
Yeah.
Both of those need immediate attention.
Right. And the report lists his vitals as blood pressure 98/60, a weak pulse, pupils that are slow to react, pale, dry skin as well. So for someone who's not a medical professional, what are the red flags here? What's the big picture?
So these are all classic signs of shock. That low blood pressure, weak pulse, pale skin, they're all pointing to the body struggling to maintain blood flow to the vital organs.
That's already intense, but it gets more complicated because on the way to the hospital, his condition worsens.
Things are escalating.
Yeah. The second cardiac monitor reading figure 1.3 for those following along shows a slower, weaker rhythm. What's happening here?
This deteriorating rhythm is a serious concern. It indicates worsening cardiac output. Essentially, the heart isn't pumping blood effectively.
So it's like the engine is sputtering.
In a way, yes. And this could be progressing towards a state called pulseless electrical activity, or PEA.
PEA. Now, I'm picturing that flatlining heart rate from medical dramas. Is it the same thing?
Not exactly. Think of it this way. Imagine a car with a working engine but a broken transmission. The engine's running, but the car isn't going anywhere.
Okay, I get it. So even though there's electrical activity, it doesn't mean the patient is stable.
Right. It's a life-threatening condition.
So what's next? How do we treat him? What needs to happen right away?
Okay, so the report outlines some initial steps. Immobilization. We want to prevent any further injury. 5E fluids. We've got to combat that shock. And oxygen.
Makes sense. We need to support his breathing. But this is where things get even more interesting because even with treatment, he becomes more lethargic.
Oh, that's not good.
Yeah, so now it's time to play medical detective. If you had to guess, based on everything we've seen so far, what are the most likely diagnoses we're dealing with?
Okay, based on everything we've seen so far, I'd say the top contenders are a fractured pelvis, a dislocated arm, and possibly internal injuries to the spleen or liver.
Okay, so those are our prime suspects, but let's break it down why those specific injuries. How do they connect with what we're seeing?
Sure, the fractured pelvis fits with that leg shortening and rotation we talked about earlier, plus the unstable pelvis during the assessment. The dislocated arm explains the deformity mentioned in the report.
Makes sense.
And then those possible spleen or liver injuries, that's always a big concern with blunt trauma to the abdomen, especially when you see signs of shock,
Why are the spleen and liver such big concerns?
because they're highly vascular organs, which means they have a rich blood supply. Damage to either one can lead to a lot of internal bleeding, which obviously contributes to shock.
It's fascinating how it all ties together.
Absolutely. Trauma affects the whole body, not just the point of impact.
There's this term in the source material, periorbital ecchymosis. It sounds intense. What exactly are we talking about?
Periorbital ecchymosis, also known as raccoon eyes, is bruising around the eyes. It's often associated with a basilar skull fracture, a break in the bone at the base of the skull.
Raccoon eyes. So we're thinking possible skull fracture.
Well, not necessarily. Raccoon eyes can also be caused by direct trauma to the face, which, given the motorcycle accident, is probably what happened here.
So it's a clue, but not a definitive one.
Exactly. Context is everything in medicine.
All right, this is where I need some help. One of the sources asks about the pathophysiology behind that leg shortening and rotation.
Pathophysiology, huh? You want to get technical?
Well, maybe just a little. Can you break it down for us non-medical folks?
Sure. Basically, pathophysiology is the study of how disease or injury affects the body's functions. In this case, the leg shortening and external rotation are likely due to the forces acting on the hip joint during the accident. With a fractured pelvis, the muscles attached to the hip can pull the leg upwards, causing it to appear shorter. And the external rotation often happens when the head of the femur, the thigh bone, is partially or completely dislocated from the hip socket.
Wow, it's incredible how those anatomical details can reveal so much.
The body speaks volumes if you know how to listen.
Now, remember those medications we talked about earlier, digoxin and Slow-K? Could they be playing a role in how this patient is responding to the trauma?
It's a great question, and it's something medical professionals always have to consider: the potential impact of medications, especially in trauma situations.
Because they could make things worse.
Exactly. So digoxin, as we mentioned, is used to treat certain heart rhythm disorders and heart failure. It can significantly affect the heart's electrical activity and its ability to contract.
So could digoxin make him more vulnerable to those heart rhythm problems we discussed earlier?
It's definitely possible. Trauma puts a strain on the heart anyway, and digoxin might complicate things further. Plus, digoxin can interact with potassium levels in the body. And remember, he was also carrying Slow-K, a potassium supplement. An imbalance in potassium can affect heart rhythm and make him more susceptible to arrhythmias.
Wow, it's amazing how one event can have such a ripple effect throughout the body.
It really is. The body is an incredibly complex and interconnected system.
Speaking of systems, the report mentions his breathing is labored. Is that just from the pain of the chest contusion?
Well, it could be, but we also have to consider the possibility of a pneumothorax.
A pneumothorax, that sounds scary.
It can be. Basically, it's when air leaks into the space between the lungs and the chest wall, causing the lung to collapse.
So we've got a lot going on here. Potential internal bleeding, a possible pneumothorax, heart rhythm abnormalities, and those medications adding another layer of complexity. Where do we even begin to untangle all of this?
That's the challenge in the art of trauma care. You have to take all these pieces of information, symptoms, vital signs, medical history, and fit them together to form a complete picture. It's like solving a puzzle, but the stakes are incredibly high.
Well, this deep dive has already opened my eyes to how complex and intense trauma care can be. It's so much more than just treating injuries. It's about understanding how all the body's systems work together and how they respond when things go wrong.
Exactly. And there's still more to uncover as we continue to analyze his condition and explore those potential complications.
I'm ready to keep digging. Stay tuned for part 2 of our deep dive, where we'll go even deeper into this fascinating case.
Welcome back. It's really fascinating how each new piece of information we get adds another layer to this case. Kind of like a medical detective novel, wouldn't you say?
I'm still trying to wrap my head around everything. Shock, PEA, potential internal bleeding, those medications he was taking, all those systems involved. It's like a medical jigsaw puzzle where the pieces keep changing shape.
That's a great way to put it. It really highlights the need for medical professionals to consider the whole patient, not just the immediate injury, but also how it might interact with any pre-existing conditions or medications they might have. Can make all the difference. In fact, one of the sources asks a really interesting question about our patient. What about his age? How could that be a factor?
That's a good point. We haven't really talked about his age yet. Does that play a role in how someone responds to trauma?
Absolutely. As we age, our bodies don't bounce back as easily. our physiological reserves, that buffer we have to withstand stress, it tends to decline.
So an older person might be more likely to go into shock and have a harder time recovering.
It's a definite possibility. Their cardiovascular system might not be as efficient at compensating for blood loss, for example. Blood vessels might not constrict as well. It all adds up.
Okay, so age is another piece of the puzzle. One of the sources also points out his low blood pressure, but mentions that his heart rate is increased. Isn't that the body trying to compensate?
It is. But the question is, how effective is that compensation in someone who already has a heart condition and is taking medication like digoxin? His baseline cardiovascular function might already be compromised.
So it's like his body is trying to do the right thing, but it's working with a handicap because of his heart condition and the medication.
Exactly. It really underscores the importance of knowing a patient's full medical history when you're treating trauma. You can't just focus on the injury itself.
Speaking of trying to put all the pieces together, the report mentions a distended abdomen. What does that tell us?
A distended abdomen, especially in a trauma case like this. That could be a sign of internal bleeding.
So which organs are we most concerned about when we see that?
In this scenario, with the mechanism of injury and everything else we've seen, I'd say the spleen and liver are the top of the list. They're both highly vascular, located in the upper abdomen, and prone to injury and blunt trauma. Damage to either one can cause a lot of bleeding into the abdominal cavity, which would lead to that distension.
Okay, spleen and liver, those are our main suspects. But could other organs be involved?
It's possible, though less likely in this case. We can't completely rule out injuries to the kidneys, intestines, or even the pancreas. A thorough assessment and some imaging studies, like a CT scan, would be needed to get the full picture.
This deep dive is really making me appreciate how much goes into diagnosing and treating trauma. It's like a medical detective story, isn't it? There's a question in one of the sources about treatment for attention pneumothorax and whether it might actually be contraindicated in this case.
Yes, the tension pneumothorax. That's a very important point.
Can you remind us what attention pneumothorax is and why we wouldn't want to treat it? It sounds pretty serious.
Of course. Attention pneumothorax is a life-threatening condition where air gets trapped in the pleural space. That's the area between the lung and the chest wall. And it keeps building up. This puts pressure on the heart and lungs, causing a rapid drop in blood pressure. It can lead to circulatory collapse if it's not treated.
So basically the lung collapses and then keeps getting squeezed.
Essentially, yes, it's a very serious situation. Normally, you'd treat it immediately with needle decompression. That's where a needle is inserted into the chest to release the trapped air.
Okay, so it's a serious situation, but why wouldn't we treat it in this case?
Here's the dilemma. The patient's already in a state of shock, remember. Low blood pressure, and we're worried about internal bleeding. The needle decompression procedure, while necessary to relieve the pressure on the heart and lungs, can actually further lower blood pressure.
So it's a tough call. You need to relieve the pressure on the lungs and heart, but you can't risk making the circulatory system worse.
Right. It's a judgment call based on the patient's overall condition and what resources are available.
Sounds incredibly complex, like every decision has a potential downside. There's also a question about the patient's Glasgow Coma Scale score, or GCS, and how it changes throughout the scenario.
The GCS, yes, that's a very important tool.
Can you remind us what it is?
Of course. The GCS, or Glasgow Coma Scale, is a numerical scale used to assess a person's level of consciousness. It looks at things like eye-opening, verbal response, and motor response to help determine the severity of a brain injury.
So what happened with his GCS score in this case?
Initially, he was conscious and responsive, which would give him a relatively high GCS score. But as his condition worsened, he became more lethargic and eventually slipped into unconsciousness. This indicates a worsening neurological status, which could be due to shock, a head injury, or both.
It's amazing how quickly things can change in trauma care. It really keeps you on your toes, doesn't it?
Absolutely. It underscores the importance of constant monitoring and early detection of any changes.
Yeah.
Every detail matters.
This deep dive has been a real eye-opener. I had no idea how much goes into trauma care, all the decisions that need to be made, the constant balancing act. It's fascinating and incredibly complex.
And we're not done yet. There are still a few loose ends to tie up and some challenging questions to consider.
I can't wait to see where this deep dive takes us next. Stay tuned for the final part of our exploration of this complex trauma scenario. Welcome back, everyone, for the final part of our deep dive into this trauma scenario. It's been quite a journey, hasn't it? We've covered so much ground shock, potential internal bleeding, Those split-second decisions that can make all the difference.
It really highlights how trauma care is like a high-stakes game of chess, wouldn't you say?
Mm-hmm.
Every move you make has consequences, and you have to be thinking several steps ahead.
Exactly. And speaking of thinking ahead, one of the sources brings up a really interesting point about why treatment for attention pneumothorax might actually be risky in this specific case.
Ah, yes. The tension pneumothorax dilemma. It's a fascinating point.
Can you remind us what attention pneumothorax is again and why we would even consider not treating it? Because it sounds pretty serious.
You're right to be concerned. It is serious. It's a life-threatening condition where air gets trapped in the pleural space. That's the area between the lung and the chest wall. And this buildup of air, it puts pressure on the heart and the lungs, causing a rapid drop in blood pressure. And it can lead to circulatory collapse if it's not treated.
So basically the lung collapses and then keeps getting squeezed.
Essentially, yeah.
Yeah.
It's a very serious situation. Normally, you'd treat it right away with needle decompression. That's a procedure where a needle is inserted into the chest to release that trapped air.
Okay, so that's attention pneumothorax. Bad news. But why would we hesitate to treat it in this particular case? What's the catch?
Well, here's the dilemma. The patient is already in shock, remember. Low blood pressure, possible internal bleeding. The needle decompression procedure, while it's necessary to relieve that pressure on the heart and lungs, it can actually lower blood pressure even further.
So it's like a delicate balancing act. You have to weigh the risks and benefits very carefully.
Precisely. It's a judgment call that the medical team would have to make based on the patient's specific presentation and what resources they have available.
It really makes you realize that trauma care is so much more than just treating individual injuries. It's about managing this whole complex web of interconnected systems.
Absolutely. You have to see the whole picture and anticipate how each intervention might affect the patient's overall condition.
There's also a question in the source material about the changes in the patient's Glasgow Coma Scale score, or GCS, throughout the scenario.
The GCS, yes, that's an important one.
Can you remind us what that is?
Sure. The GCS, or a Glasgow Coma Scale, is a numerical scale that's used to assess a person's level of consciousness. It looks at things like eye-opening, verbal response, and motor response. It helps us to determine the severity of a brain injury.
So what happened to our patient's GCS score in this case?
Initially, he was conscious and able to respond, which would give him a relatively high GCS score. But as his condition worsened, he became more lethargic and eventually slipped into unconsciousness. This indicates a worsening neurological status, which could be due to shock, a head injury, or a combination of both.
It's scary how quickly things can change in these situations. You really have to stay on top of things.
Absolutely. That's why constant monitoring is so crucial. You have to be able to detect those subtle changes and adjust the treatment plan accordingly.
It's amazing how much we've been able to learn about trauma care just by analyzing these reports and charts. It's been like a masterclass in medical detective work.
It has been a fascinating exploration, hasn't it? And it really shows how every detail, every symptom, every vital sign tells a story.
It's like piecing together a puzzle, but with incredibly high stakes.
That's a great analogy. It really highlights the intellectual challenge and the immense responsibility that comes with working in trauma care.
Well, this deep dive has certainly given me a whole new perspective on what it takes to be a trauma care professional. The knowledge, the quick thinking, the constant decision-making, it's really impressive.
It is a demanding field, no doubt.
Uh-huh.
But it's also incredibly rewarding to be able to make a difference in those critical moments, when someone's life hangs in the balance.
I think we've covered a lot of ground today. We've explored the complexities of trauma care, the interconnectedness of all the body's systems, and the importance of those split-second decisions.
It's been a really great discussion, and hopefully our listeners have come away with a deeper understanding of this fascinating and vital field.
Well, on that note, I think it's time to wrap up this deep dive. Thank you so much for joining me today and sharing your expertise. It's been an incredible learning experience.
The pleasure was all mine. And to all our listeners out there, remember, knowledge is power. Keep asking questions, keep learning, and never stop exploring the world around you.
Until next time, stay curious and stay well informed.
Hey everyone, and welcome to another deep dive just for you.
Yeah, always fun to dig into these.
Right. So tonight, we're stepping into the shoes of first responders.
Oh, cool.
For a case that's definitely not your run-of-the-mill call.
All right, lay it on me.
So picture this. It's a quiet Sunday night in June.
Okay, peaceful.
You're an EMT, and you get called out to a motor vehicle accident.
Seems pretty standard so far.
Yeah, but here's the twist. This accident involves a moose.
Oh, wow. Okay, that's not what I was expecting.
I know, right? To help us figure this out, we've got some sources.
Okay, cool.
We've got excerpts from a paramedic training manual
That's always helpful.
and some patient assessment notes.
So we're like medical detectives piecing together the story.
Exactly. So let's start with the scene.
All right, paint me a picture.
Okay, so we're on a rural road.
Okay.
There's a lone car with some serious damage to the front end.
Oof, sounds like a pretty bad impact.
Oh yeah, it definitely wasn't a fender bender.
I'm guessing the moose didn't walk away from this one.
Definitely not. So our sources say the moose, which was estimated to be about 450 kilograms.
Whoa, that's a big moose.
Yeah, almost 1,000 pounds.
Like a small horse.
Right. And this moose was actually knocked over the car.
Wow, I mean, that gives you an idea of the force involved here.
Right.
Now, what about the driver?
So inside the car is our patient.
Okay.
She's a woman 36 weeks pregnant.
Oh, wow. 36 weeks.
Yeah, talk about high stakes.
Things just got a lot more complicated.
I know, right? But thankfully, she was able to drive off the road after hitting the moose.
Okay, good. At least she's out of immediate danger.
Yeah, now let's take a look at the initial patient assessment.
All right, this is where it gets interesting.
Yeah, these notes are like a snapshot of what those first responders are dealing with when they arrive.
Gives you a real appreciation for their quick thinking, you know?
Absolutely. So our patient is conscious,
Okay, that's good.
but a little confused.
Uh-huh.
And she's complaining of leg pain, which isn't surprising.
Right. Given the impact.
Her vitals are a bit concerning, though.
Okay, what are we looking at?
Her blood pressure's 8868.
Ooh, that's a little low.
Her pulse is 150, respirations are 26, and her oxygen saturation is 96%.
Okay, so that low blood pressure and the rapid heart rate, those are already suggesting early signs of shock?
Yeah, there are definitely some red flags there.
For sure.
So continuing with the assessment, she has some mild neck pain.
Which you always got to watch out for after any collision.
Absolutely.
Okay, and what else?
And she's got an abrasion on her abdomen, probably from the seatbelt or the steering wheel.
Makes sense.
But here's the big one.
Okay, hit me.
Bilateral femur fractures.
So both thigh bones are broken.
Yep, and a deformed right angle.
Whoa, that's a lot of trauma.
Yeah, and the notes also mention delayed capillary refill.
Which further supports that possibility of shock.
Right, so definitely a lot to process for the paramedics at this point.
Absolutely, they've got to act fast.
Yeah, what would be the next steps?
Well, based on this initial assessment, they got to stabilize her spine, make sure she's getting enough oxygen,
Right,
and get her out of that car safely and quickly.
which is exactly what they do.
Yeah.
They gave her oxygen right away, immobilized her spine with a C-collar, and went for a rapid extrication.
All standard procedure in a situation like this?
Right, oxygen's crucial, especially with the baby.
Yep, for both of them.
And immobilizing the spine protects against further injury.
And the rapid extrication, that's all about getting her out of that potentially dangerous situation fast.
Exactly. They also established 5E access,
Oh, yeah, critical.
so they could administer fluids and medications.
Yep, that IV access lets them address that potential shock quickly.
By replenishing fluids and maybe giving her meds to stabilize her blood pressure.
Exactly.
Now, the source material actually poses a question for us here.
Oh, okay, I like a good challenge.
They ask, how much blood do you think she might have lost at this point?
That's a tough one to answer.
Right.
You know, highlights the challenges these first responders face, having to make decisions with limited information.
Yeah, they're relying on their experience and judgment.
Exactly.
And then they hit us with another question.
All right, what is it?
Why might the signs of shock be delayed in a pregnant patient?
Oh, that's a good one.
Yeah, what do you make of that?
Well, you got to remember that pregnant women have a higher blood volume than non-pregnant women.
Oh, right, of course.
So their bodies can compensate for blood loss for a longer time before showing those classic signs of shock.
So it's like a hidden danger.
Yeah, exactly. So even though those initial vitals are concerning,
Right.
the full extent of her blood loss might not be obvious right away.
So those paramedics really have to be on high alert.
Yeah, especially with a pregnant patient. They got to keep reassessing the situation.
So far, it seems pretty straightforward.
You mean a traumatic accident, potential shock, serious injuries?
Yeah, but trust me, things are about to take a bit of an unexpected turn.
Oh, really? Tell me more.
So about 25 minutes after arriving at the scene,
Okay.
the notes mention a wall being lifted.
A wall.
Yeah, and secured before they can finally remove the patient from the car.
A wall. That's strange.
Right.
Why was there a delay?
And that's where it gets really interesting.
Okay, hooked.
The source material starts talking about crush injuries
Crush injuries, okay.
and this thing called compartment syndrome.
Compartment syndrome.
Honestly, it sounds kind of terrifying.
It can be a serious condition,
Yeah.
but maybe we should break it down for our listeners.
Yeah, good idea.
So imagine a garden hose, right?
Okay, with water flowing through it.
Exactly. Now imagine someone steps on that hose, restricting that water flow.
Okay, I get it.
That's kind of what happens in compartment syndrome.
So what's being crushed in this analogy?
So inside your muscles, there are these tight compartments.
Uh-huh.
And when pressure builds up in one of those compartments,
Hmm.
it can restrict blood flow, leading to tissue damage.
So like the muscles being squeezed from the inside.
Yeah, good way to put it.
But the moose didn't exactly sit on her legs, did it?
No, but remember those bilateral femur fractures?
Oh, right, of course.
Severe fractures like that, they can disrupt the muscles and blood vessels within those compartments.
Ah, leading to that dangerous pressure increase.
Exactly.
So even though it wasn't a direct crush injury,
Right.
those fractures themselves could create that compartment syndrome scenario.
Precisely.
And maybe that 25-minute delay
Yeah,
was because they were dealing with this really complicated extrication
trying to safely remove whatever was causing that compression.
without making her injuries worse.
It's a tricky situation.
Right. They're always having to think one step ahead, anticipate those potential problems.
That's what makes this case so interesting. It's not just about treating the obvious injuries.
Right.
It's about understanding the underlying physiology.
And recognizing those patterns.
Hey.
Okay, so we've covered a lot in this first part. The initial impact, the signs of shock, and this potential compartment syndrome.
Yeah, we've definitely got our work cut out for us.
But there's still a lot to unpack.
Definitely. I'm ready for more. What else do we need to dive into?
Well, we got to understand the signs and symptoms of compartment syndrome
Right, so we can see how those paramedics would even recognize it.
in a patient who's already in a lot of pain.
And dealing with multiple injuries.
Exactly.
Sounds like a challenge.
It is, but we'll tackle it head on.
All right, let's do it. All right, so let's talk about those signs and symptoms of compartment syndrome.
Yeah, because it can be tricky, right?
It can, especially when you've got a trauma patient.
Who's already in pain from other injuries.
Exactly. So those paramedics, they really have to rely on their training.
To look for those subtle clues.
The things that suggest something more serious might be going on.
Like, what kind of clues should they be looking for?
Well, one of the key signs is pain.
Okay, pain makes sense.
Huh. But it's pain that seems way worse than what you'd expect.
Oh, so like out of proportion to the injury.
Exactly. So in this case, she
Yeah.
might have leg pain that's just way more intense.
Than what you'd expect from just those fractures.
Exactly.
Okay, so that's one red flag.
Yeah.
Excruciating pain. What else?
Swelling.
Okay, swelling. That seems pretty obvious.
It is, the affected limb might look swollen and tense.
Let's got it. Extreme pain, swelling, anything else.
They'd also check for changes in sensation,
Oh. Yeah.
like numbness, tingle.
Oh, like pins and needles.
Yeah, exactly.
And is that because the pressure is cutting off blood flow to the nerves?
That's right. Affects the nerves.
Okay, got it.
And finally, they'd be checking for weakness.
Weakness. How would they assess that?
Well, the patient might have trouble moving their toes or foot,
Okay.
or they might have a really weak pulse in the injured limb.
So we're talking pain, swelling, numbness, and weakness.
Right.
Those seem like pretty subtle signs, especially considering everything else she's going through.
They are subtle, and that's why it takes a really skilled eye.
And a deep understanding of these complications.
To catch them early on, that's why those initial assessments are so crucial.
It's like laying the foundation.
Yeah.
Checking those vital signs, stabilizing the spine, making sure she's getting oxygen.
All those steps are so important.
Yeah, and it's not just a one-time thing.
Right. They have to keep reassessing, looking for changes.
That might point to a new problem.
Exactly.
Now, remember those thought-provoking questions from the source material?
You mean the ones about blood loss and the delayed signs of shock?
Yeah, exactly. They also ask what the paramedics might anticipate based on the mechanism of injury.
Okay, so they're asking us to think like a paramedic, right?
Right. Like, what would stand out to you?
Considering the moose, the speed, the damage to the car.
Exactly.
Well, the first thing that comes to mind is internal injuries
Oh, yeah.
beyond the obvious fractures.
Right. And she's 36 weeks pregnant,
Don't forget about that.
which adds a whole other layer of complexity.
Absolutely. You got to think about complications for both the mother and the baby.
Like, what kind of complication?
Oh, things like placental abruption.
Placental abruption.
Yeah, where the placenta detaches from the uterine wall.
Wow.
Uterine rupture, fetal distress. These are all serious possibilities.
It's like a chain reaction of potential problems.
It is a lot to think about.
And then they ask another question.
Okay, lay it on me.
Given her presentation and injuries,
Yeah.
How much blood do you think she might have lost?
Ooh, that's tough. There's no way to know for sure.
It's not like they can just measure it out on scene.
Nope. It comes down to experience, clinical judgment.
And understanding those typical blood loss patterns.
Right, with different injuries.
So considering her vitals, the mechanism of injury,
And those bilateral femur fractures.
which we know can bleed a lot.
Yeah, it wouldn't be surprising if she'd lost at least 1 to 2 liters of blood.
That's a lot.
It
Then we
is.
talked about how pregnancy can mask those early signs of shock.
Exactly. So even if her vitals aren't screaming hemorrhage,
Right.
they got to be really tuned in to those subtle cues.
And consider that hidden blood loss
Absolutely. It all comes back to those ongoing assessments.
and that high index of suspicion.
Always got to be thinking, reevaluating.
Now, the last question focuses on the pregnancy.
Okay, what does it say?
Although this patient is presenting with symptoms of shock, why might the signs be delayed?
Okay, we touched on the higher blood volume,
Right.
but there's more to it, isn't there?
Right. It's not just about having more blood to lose.
No.
What other changes during pregnancy could be at play here?
Well, their heart rate's naturally higher during pregnancy.
Oh, right, of course.
So that tachycardia,
That rapid heart rate,
yeah, that might not be as alarming.
as it would be in a non-pregnant patient.
Exactly. Their baseline is different.
So it makes interpreting those vital signs trickier.
It does.
And their blood pressure is usually lower too, right?
Yeah, so it's harder to spot hypotension.
That low blood pressure.
In those early stages of shock.
It's like pregnancy's almost creating a camouflage effect,
Yeah, you could say that.
making those warning signs harder to see.
Right. And on top of that,
Oh, there's more.
yeah, pregnancy hormones, they can actually affect how the body responds to blood loss.
Oh, wow. How so?
They cause blood vessels to relax, which further masks the signs of hypovolemia.
Hypovolemia, that's the low blood volume, right?
That's right.
So paramedics really have their work cut out for them
They do. It's a whole other level of complexity.
when you're dealing with a pregnant trauma patient,
Yeah, and it shows why specialized training is so important.
right? Because you can't just rely on those standard signs and
You
symptoms.
gotta factor in all those physiological differences.
Absolutely. This deep dive's really opening my eyes
Yeah, it's fascinating.
to just how much goes into those decisions paramedics make at the scene.
They have to consider so many factors.
It's like a high-stakes puzzle
It is.
where they have to piece together all this information
And make those life-saving decisions.
based on what they find.
And often with very limited time.
Right,
It's
exactly.
a real testament to their skill and training.
Absolutely. Okay, so we've talked about the signs of compartment syndrome.
Uh-huh.
We revisited those key questions and explored the challenges of treating a pregnant trauma patient.
We've covered a lot of ground.
What else does the source material want us to think about?
Well, it talks about the management of compartment syndrome,
Okay.
emphasizing how important early recognition and treatment are.
Right, makes sense.
But before we get into that,
Yeah.
let's go back to that mysterious wall
Oh, yeah, that's been bugging me.
and that 25-minute delay in getting her out of the car.
Because we talked about how it might have been a complicated extrication,
Right.
but why delay getting her out when there's a potential for shock and other complications?
That's a great question, and it really highlights the challenges these first responders face.
In what way?
Well, they're not just treating the patient.
Right.
They're also responsible for scene safety.
Oh, of course, for themselves and everyone else there.
Exactly. So during those 25 minutes, they're assessing the situation.
Trying to figure out the safest way to get her out
Right. How to remove that wall or whatever's pinning her legs.
without causing more injury.
Exactly. They got to think about the stability of the vehicle.
Right, could it shift or collapse during extrication?
Exactly. And they got to consider the risk of making her existing injuries worse.
It's like a delicate balancing act,
It is. They want to get her out fast.
but safely.
Right. And don't forget about that potential crush injury.
Oh, right, if they move that wall the wrong way.
It could make things a lot worse.
It sounds incredibly stressful.
It is. They're making these split-second decisions
With limited information.
and knowing that every choice could have big consequences.
It really highlights the importance of training and experience.
Absolutely. And clear communication between everyone on scene.
It's teamwork.
It is. This deep dive's really showing me
Yeah, me too.
how complex their work really is.
It's so much more than just bandages and ambulances.
Yeah, it's a blend of science, skill, and compassion.
And it requires constant learning.
And mapping to new situations.
All right, so we talked about the extrication delay,
Uh-huh.
the potential for crush injuries, the challenges of managing a pregnant trauma patient.
What's next on our agenda?
Well, now that we understand compartment syndrome.
Right. What it is, why it's a concern in this case.
Exactly.
We need to explore how it's diagnosed and treated.
Because recognizing those subtle signs early on.
That can make all the difference.
Absolutely. Lead the way. I'm all ears. Okay, so how do they actually diagnose compartment syndrome?
It's not always easy.
Right, because it's not just about looking for those signs and symptoms.
Exactly, especially when you've got a trauma patient.
Who might be in pain from a bunch of different injuries.
Right, it can be tough to tell what's causing what.
So what else can they do to figure it out?
Well, they can measure the pressure.
The pressure.
Yeah, inside those muscle compartments.
Oh, wow, they can actually measure that.
Yeah, they use a special device,
What's it called?
a pressure monitor.
Okay.
It's basically a small needle
Okay.
that they insert into the muscle compartment.
And that tells them the pressure inside.
Exactly.
So if the pressure's high,
then that's a pretty clear sign of compartment syndrome.
and I'm guessing that helps them decide what to do next.
Absolutely, it guides their treatment decisions.
So what kind of treatment are we talking about here?
The most effective treatment is surgery.
Surgery. Oh, wow.
Yeah, it's called a fasciotomy.
A fasciotomy.
Yeah, basically they make an incision
An incision. Where
in the fascia.
the fascia, remind me what that is again?
It's that tough membrane that surrounds the muscle compartment.
Right, okay.
And that relieves the pressure.
So it's like opening up that garden hose we talked about.
Exactly.
Letting the blood flow freely again.
Precisely. And that can prevent more tissue damage.
And potentially save the limb.
That's the goal.
Wow, this case is really showing just how important quick thinking is in these situations.
It's crucial. Got to be able to make decisions under pressure.
And how important that initial assessment is.
Absolutely. Got to recognize those subtle signs, know when to call for help.
It can make all the difference.
It really can.
Now, the source material doesn't actually say
Mm-hmm.
if our patient ended up developing compartment syndrome,
Right.
but they do leave us with something to think about.
Oh, I like a good challenge. What is it?
They revisit those questions about blood loss and shock in pregnant patients.
Right.
But then they add a new one.
Okay, I'm listening.
They ask, what other injuries might the paramedics anticipate
Okay.
based on the fact that a wall had to be removed before they could get her out of the car?
Interesting.
So they're asking us to think beyond those obvious injuries, the fractures, and the potential shock,
And consider what else might be going on?
based on that detail about the wall.
Right. Got to put our detective hats on.
Exactly. What other injuries could that wall have caused?
Well, it's possible the wall was putting direct pressure on her pelvis.
Oh, so on top of everything else, we could be dealing with pelvic fractures.
Exactly. And those can be really serious.
Yeah, I imagine so.
Often a lot of blood loss, and they can make the pregnancy even more complicated.
So even after they deal with the femur fractures, the potential shock,
They still got to be on the lookout for other injuries.
those hidden dangers that might not be obvious right away,
Exactly. That's why those ongoing assessments are so important.
they can't just assume that what they see initially is the whole story.
Nope. Got to keep looking for clues.
This whole case has really been a deep dive
It has.
into the world of trauma care
The complexities, the challenges.
and how much those paramedics have to juggle.
They have to be quick thinkers
Skilled clinicians,
and compassionate caregivers.
all while working under immense pressure.
It's impressive.
It really is, and they're doing it all with limited information.
Often in really chaotic environments.
It's inspiring, honestly.
Absolutely testament to their dedication and expertise.
Well, I think we've covered it all.
Yeah, I think so.
The initial assessment, the potential for shock, compartment syndrome, managing a pregnant trauma patient.
And all those hidden injuries.
It's been quite a journey,
It has a real deep dive.
and I hope you, our listener, have learned something new
Yeah, I gained a new appreciation for those first responders.
and the amazing work they do.
They're true heroes.
So until our next deep dive,
Stay curious.
and keep those brains engaged.
There's always more to learn.
We'll see you next time. All right, get ready for this one. Today we're diving deep into emergency medical services training,
EMS? Yeah.
and we've got our hands on Scenario Book version 15.
Oh, wow.
It's the playbook they use to train paramedics and EMTs.
Yeah, I've seen these before.
Have you?
Yeah, it's really cool.
What I love about this is it's not just like dry textbook stuff.
Right.
It's like they throw you right into the action.
It's scenarios. Right?
It is. And they're all over the map. We've got someone with hives spreading like crazy,
Oh, wow.
another person having seizures, but their family's like, I don't know what meds they take.
Oh, gee.
Even a landlord finding, well, let's just say it's not a happy discovery.
Oh, no.
But what I find really valuable is they don't just describe the what of the situation.
Yeah.
They walk you through the thought process.
Okay.
Like, okay, what are the vital signs telling you? What actions do you take first?
Yeah.
And WHY, are those more important than others?
That's the key.
Okay, so let's jump right in with scenario #3. This one starts out seemingly simple. A 45-year-old guy, suddenly covered in hives.
Hives, okay.
No clue what's causing it.
Oh,
You're the EMS on scene. What's the first thing going through your mind?
I mean, right away you got to figure out, are we dealing with just a simple allergic reaction or...
Or is it anaphylaxis?
Yeah, exactly.
Because that's a whole different ballgame.
Absolutely.
He's got the hives, sure, but he's also wheezing a little bit.
Okay.
And he's getting anxious, which can be a sign things are escalating.
Yeah, for sure.
And get this, the guy swears he has NO known allergies.
Oh, wow.
He mentions he tried a new laundry detergent,
Yeah.
used his inhaler a few hours ago. Could those be it?
It's possible, right?
Like a delayed reaction.
Definitely. Sometimes it takes a while.
So you've got to be thinking about all these possibilities while also...
Those are those vitals.
Yes. His heart rate is 108, breathing shallow at 24 breaths a minute.
That's elevated.
And you've got the hives spreading, the wheezing. It's all pointing towards,
Anaphylaxis.
even though his airway seems okay at the moment.
Right, but that can change fast.
That's scary.
It is.
So they give him diphenhydramine, 50 milligrams.
Okay.
But here's the thing. They do it intramuscularly?
I am.
Why not just a pill?
Speed, speed, speed. You want that medicine to get into the system as fast as possible.
Right, because with a pill,
It's got to go through the whole digestive process.
takes too long.
Way too long in this situation.
Okay, this is where I got a little confused.
Okay.
The scenario also mentions epinephrine
Epi.
as a possible treatment.
Uh-huh.
But his airway seems... Okay, why jump to something that intense? Isn't that more for when someone's really struggling to breathe?
So here's the thing about anaphylaxis.
Okay.
It's unpredictable.
Oh.
His airway might be fine, NOW.
Right.
But 5 minutes from now, who knows?
That's a good point.
Epinephrine, it's powerful stuff.
Oh, yeah.
Opens the airway, constricts blood vessels, raises blood pressure. It's basically buying you time.
Wow, I
Yeah.
didn't realize it did all that.
It's a lifesaver.
Okay, so they give the diphenhydramine, and a few minutes later, things DO seem to improve.
That's good.
He's breathing easier, oxygen levels are up.
Excellent.
You'd think crisis averted, right?
You'd hope so.
Well,
But one thing this scenario really drives home is that with anaphylaxis,
yeah.
you can't let your guard down.
Oh, no.
Nope, those symptoms can come back.
Really?
Sometimes even worse.
Oh, gosh.
That's why they really emphasize constant reassessment.
Okay.
Got to be checking those vital signs every few minutes.
So you're not really out of the woods for a while.
Not at all.
All right, next up, we've got part 2 of scenario #3.
Okay.
This time, it's a 60-year-old woman found seizing by her daughter.
Seizures. Okay.
Immediately,
Well-
what are the red flags?
Well, first off, the scene is chaotic, right?
Oh, yeah.
You've got a panicked family member, very little information,
Right.
and a patient who's clearly in distress.
Yeah.
She's responsive to pain, airways clear, but breathing shallow, and she's pale, clammy.
Those are all.
Classic signs that something's seriously wrong.
And to make matters worse, the daughter's saying her mom's meds were recently changed,
Oh, that's not good.
but she can't remember which ones or how. Talk about a challenge.
It's like trying to solve a puzzle with half the pieces missing.
Ugh, I hate those puzzles.
Me too.
You're trying to figure out what caused the seizure,
Right.
but you're also trying to manage her current condition.
At the same time.
Right. It's like multitasking on hard mode.
Exactly.
And her vitals are all over the place.
Oh, no.
Low blood pressure, slow heart rate, low blood sugar.
Does that point to something specific?
That's what they're trying to figure out.
Right.
It definitely raises concerns about a potential underlying medical issue
Yeah.
that could be contributing to the seizures.
Makes sense.
And the low blood sugar especially. Could this be a diabetic reaction on top of everything else?
Oh, that adds another layer of complexity.
And then, as if things weren't bad enough,
What?
5 minutes later, she becomes unresponsive.
Oh, jeez.
Her oxygen levels are dropping, even with you helping her breathe.
That's not good.
It's intense, right?
It really highlights how quickly a situation can deteriorate.
Yeah.
That drop in responsiveness,
Right.
the need for ventilations,
Uh-huh.
those are all signs that her brain's not getting enough oxygen
Oh, no.
and things are getting critical.
So what do you do?
Well, you got to keep working, keep trying to figure out what's going on, and
Good.
hope for a breakthrough.
And luckily, they get one.
How good.
The daughter finally remembers a crucial detail.
What is it?
The doctor had been changing her mom's Dilantin,
Dilantin, okay.
and she also has a history of epilepsy, hypertension, AD, hypoglycemia.
Wow, that's a lot.
It's like suddenly the light bulb goes off.
Right.
Dilantin is an anti-seizure medication.
Oh, I see.
So any changes to its dosage could absolutely trigger a seizure.
That makes sense.
And the fact that she's also hypoglycemic
Right.
adds a whole other layer of complexity to this situation.
It's like a puzzle within a puzzle.
Exactly.
Yeah.
This scenario really shows how important clear communication is between doctors, patients, and EMS.
Absolutely.
We don't always have that luxury of complete information, though, right?
No, unfortunately not.
It must be a constant challenge in the field,
It is.
trying to piece together the puzzle with whatever information you can get.
And then making life-saving decisions based on that.
Wow.
That's why these training scenarios are so crucial.
They really make you think on your feet.
For sure.
Well, after that one, I need a break.
Me too.
But we've got one more part of scenario #3 to tackle.
Okay, hit me.
And it's a completely different kind of situation.
All right.
This is one that EMS encounters, but hopefully not too often.
What is it?
Obvious death.
Oh, wow.
This one's interesting
How so?
because in some ways it's more straightforward medically,
Okay.
but the emotional and procedural aspects are complex.
I can see that.
The scenario. A 57-year-old man found unresponsive on his couch by his landlord.
All right.
What are the immediate signs that this is not a typical rescue situation?
Well, even before you get to the patient, there's that smell,
The smell, yeah.
that strong smell of decomposition.
It's unmistakable.
It is, and then you see him,
Oh, no.
and it's clear, extreme pallor, cyanosis, lividity.
Those are not signs of someone who just fainted.
No, not at all.
I imagine there's almost a sense of relief in a way.
Relief.
Like at least there's no frantic rush to save them.
I guess so, yeah.
But then why does the scenario still tell you to do certain things?
Like what?
Like gather information from the landlord.
Because even though this person's life can't be saved,
Right.
there's still a duty to the deceased, to the family, to the legal process.
I hadn't thought of that.
It's important.
So the landlord mentions financial struggles, drug and alcohol abuse.
That's sad.
It is. But it's not for us to judge.
Yeah.
It's just information to help paint a picture for the coroner or medical examiner later on.
Makes sense.
It's almost like a final act of respect.
It is.
Gathering those details even when it can't change the outcome.
Exactly, and sometimes that information can be helpful.
In what way?
Well, it can help understand patterns, prevent future tragedies,
Right.
or even just provide some closure to those left behind.
That's a good point. Okay, are you ready for a complete 180?
Haha, bring it on.
Let's move on to scenario #4, where
Yeah.
things get a lot more action-packed.
I'm intrigued.
This one takes us to the Redneck Saloon at 2:00 a.m.
Oh boy.
You arrive, it's dark, chaotic,
Yeah.
and you find a young woman lying in the snow behind the bar.
2:80 a.m. at the Redneck Saloon sounds like trouble.
That's what I'm thinking.
You never know what you're going to get with those calls.
Right. It's like those training scenarios where they throw you into the unknown.
Exactly.
The call just said female with unknown injuries, could be anything.
Literally anything.
And as you get closer, it becomes clear this is way beyond a slip and fall.
Oh no.
She's pale, there's blood, and then a sucking chest wound.
A sucking chest wound.
Not just one, but 3 penetrating wounds to her chest.
Oh wow, this is serious.
This is textbook multi-system trauma.
You've got potential internal bleeding, a collapsed lung, who knows what else.
And that sucking chest wound. Every breath she takes is potentially making things worse.
That's scary.
Her vitals are painting a bad picture, too.
What are they?
Heart rate 142 and thready, meaning it's weak.
Oh, geez.
Her breathing shallow and irregular. Blood pressure is plummeting.
Classic signs of shock.
Exactly.
Her body's trying to compensate, but it's losing the battle.
And then 7 minutes in, she goes into VFib.
VFib. Okay.
I know we've talked about this before.
Yeah.
But remind me, it's when the heart's basically just quivering, not pumping properly, right?
That's it. And it's lethal if not treated immediately.
So time is of the essence.
Absolutely. Every second counts.
Luckily, it is a shockable rhythm,
Meaning?
meaning there's a chance defibrillation can jolt it back into a normal beat.
Oh, good.
So they shock her, and success. She's back.
Oh, wow. That's a relief.
But then at 10 minutes, she goes into cardiac arrest again.
oh, no.
But this time it's PEA.
PEA, right? Which is not shockable.
Exactly. So what's the difference?
Think of it this way. VFib is like the electrical system going haywire, sending chaotic signals.
Okay.
A shock can reset that.
Huh.
PEA is more like the electrical part is working, but the heart muscle itself isn't responding.
So like a flatlining car battery.
Exactly. Jump-starting it won't help if the engine's seized up.
So no shock this time.
No shock.
What do you do for PEA then?
That's where it gets even tougher.
Oh no.
You have to play detective. Fast.
What do you mean?
Is it blood loss they haven't controlled yet? Airway problem? Something metabolic?
You're looking for clues.
Exactly, while also doing CPR.
And administering meds.
Right, meds that might support heart function.
The odds are much lower than with VFib, though.
Unfortunately, yes.
Hearing this play-by-play makes those medical dramas on TV seem so simplified.
Oh yeah, they got to keep things moving for entertainment.
But real-life trauma is way messier, less predictable.
For sure.
And even with perfect training, the outcome isn't guaranteed.
That's the truth.
Okay, before my heart rate gets too high, let's switch gears to a scenario that hits closer to home for a lot of us.
Okay, what is it?
Scenario #1, the choking incident at a restaurant.
Oh, this one's stressful just to think about.
You're enjoying a meal, then suddenly someone's clutching their throat, can't breathe.
It's a nightmare.
The scenario describes a 42-year-old woman choking on a piece of steak.
Oh no.
Now, I'm someone who panics easily.
Me too.
If I saw that happening, I'd probably freeze up.
I can relate.
What helps EMS stay calm and focused in those moments?
Training, routine.
And adrenaline, probably.
I weigh a lot of that.
But seriously, having clear protocols
Yeah.
helps.
Right.
In this case, they hear that audible stridor.
That high-pitched sound.
Yeah, meaning airways blocked.
Yeah.
And they immediately go into action.
No time to waste.
And her vitals are reflecting the panic, right?
Absolutely.
Elevated heart rate, blood pressure through the roof, oxygen levels plummeting.
It's like her body's screaming for help.
Every second counts here.
You
Because without oxygen, brain damage starts happening fast.
That's why they act so quickly.
They try abdominal thrusts,
Okay.
but after a minute, she goes unconscious.
Oh, geez.
So now what? Chest compressions. But what about the steak?
Well, first, they lower her to the ground safely,
Right.
which is important for effective CPR.
Makes sense.
Now, here's where the scenario gets really detailed.
Okay.
It walks them through 3 different pulse checks
3 different pulse checks. Why?
because it depends.
On what?
They check for a thready pulse, no pulse, or just apnea, meaning not breathing.
Hold on. Why even bother with a pulse check if someone's clearly not breathing?
It's about tailoring the response.
Okay.
If there's any pulse,
Yeah.
it means the heart's still doing something.
Okay.
So the focus is on assisting with breathing and compressions.
Right.
No pulse means full-on CPR to try and restart it.
So it's a different approach depending on the situation.
Exactly.
Okay.
They're constantly assessing and reassessing.
Did they do their 2 minutes of CPR and bam, she's in VFib?
VFib again, time for the defibrillator, right?
I thought so too, but
Yeah.
the scenario stresses something that surprised me.
What's that?
Before shocking, they have to quickly check the airway again.
Really? Why?
I was wondering the same thing.
You'd think every second matters at that point.
Right.
But think about it, sometimes those chest compressions dislodge the object.
Oh, you're right.
If they shock her and it's clear, they could do more harm than good.
That's a really good point.
It's a reminder that even in a crisis, you can't just blindly follow a checklist.
You have to keep assessing.
Exactly.
So they check and the steak is still there.
Okay, so what do? Reach in and grab it.
That's what I'd assume, but the scenario actually doesn't say.
Really?
It just mentions they need to remove it before the shock.
Oh, interesting.
Maybe they leave that part to the student's imagination.
Could be.
Or maybe it's a skill covered in a different module.
That makes sense.
So they remove the steak, deliver the shock, and what then? Do we find out if she makes it?
I'm on the edge of my seat.
Me too. But nope, that's where this scenario ends.
Oh, come on.
It's all about getting them to that point of the critical decision
Right.
and the actions leading up to it.
I guess in real life, there are too many variables to predict the outcome, for sure.
Yeah, that's true. All right, well, I'm definitely feeling the adrenaline rush after those last 2 scenarios.
Me too. It's incredible to get this inside look at the split-second judgments EMS has to make.
And all while keeping their cool under pressure.
It's amazing.
Speaking of pressure,
Yeah.
you mentioned earlier that these scenarios sometimes throw curveballs at you,
Oh, yeah.
testing your knowledge beyond just the procedures.
Right. They'll often add in little details that force you to think critically.
Like what?
Maybe connecting the dots to something you learned in a previous module.
So it's not just about memorizing steps.
No, it's about really understanding the why behind everything.
It's like the difference between knowing how to drive a car and actually understanding how the engine works.
Exactly. That makes you a much more effective responder,
Absolutely.
especially when things don't go according to plan.
Which, let's face it, is probably most of the time in the EMS world.
Right. It's not like in the movies.
No, not at all.
Okay. Are you ready to tackle another scenario?
Bring it on.
This time, let's revisit that anaphylaxis case, but dive a little deeper into the specifics.
Sounds good to me.
I'm curious to see what other insights we can glean from this book.
Me too. These scenarios are full of surprises. Welcome back to our EMS Deep Dive.
You know, it's like we're right there in the ambulance with them, feeling the pressure.
It is, isn't it?
Last we left off, things were pretty somber with that obvious death case.
Yeah, heavy
It
stuff.
really makes you appreciate what EMS goes through, dealing with life or death every day.
They have a tough job.
Speaking of life or death, let's get back to the action with scenario #4.
All right, hit me.
This one takes us to the Redneck Saloon, 2 a.m.
Oh boy. 2 a.m. at the Redneck Saloon.
You arrive, it's dark, chaotic. Sounds about right.
You find a young woman lying in the snow behind the bar.
I'm already nervous.
These training scenarios, they really put you to the test.
They do.
You have no idea what you're walking into.
That's the point, right?
The call just said, female with unknown injuries.
Could be anything.
And as you get closer, it's clear this is bad.
Oh no.
Way beyond a slip and fall.
What do you see?
She's pale, there's blood,
Okay.
and then you see it, a sucking chest wound.
Oh wow.
And not just one.
More than one.
3 penetrating wounds to her chest.
This is serious.
Multi-system trauma, the works.
Potential internal bleeding, collapsed lung,
Who knows what else?
and the sucking chest wound. Every breath she takes could be making it worse.
Exactly, it's a race against time.
What about her vitals?
Not good.
Oh no.
Heart rate 142, but thready, weak.
Okay.
Breathing's shallow, irregular. Blood pressure's plummeting.
All classic signs of shock.
Her body's trying to fight, but it's losing.
What happens next?
7 minutes in, she goes into VFib.
VFib.
Heart's basically quivering, not pumping.
And that's lethal if you don't act fast.
They shock her success. She's back.
Wow, what a turnaround.
But then at 10 minutes, she crashes again.
Oh no, not again.
Cardiac arrest, but this time it's PEA.
PEA. We talked about this.
Not shockable, remember?
Right, VFib is like the electrical system going haywire.
Uh-huh.
PEA, the electrical is working, but the heart muscle itself isn't responding.
So like a flatlining car battery.
Exactly. Jump-starting it won't do anything.
So what do you do?
It's a tough one.
I bet.
Got to figure out what's causing it.
While doing CPR.
Right. And giving meds, that might help.
But the odds aren't good.
No, not as good as with VFib.
Makes you realize those medical shows, they make it look so easy.
Oh, yeah. They got to keep things exciting.
Real-life trauma is a whole different beast.
It is messier, less predictable.
And even with the best training, there are no guarantees.
That's the truth.
Okay, let's switch gears for a second. To something a little closer to home, maybe.
What's that?
Scenario #1, the choking incident at a restaurant.
Oh, this one always makes me nervous.
You're eating, and suddenly someone can't breathe.
It's a terrifying thought.
This scenario, a 42-year-old woman choking on steak.
Oh, no.
I don't know about you, but I'd probably panic.
I'd probably freeze up.
So how does EMS stay calm in those moments?
Training, I guess.
Routine, adrenaline.
Probably a lot of adrenaline.
But seriously, they have these protocols.
Right.
So they hear that stridor, that sound.
Hand-pitched, right.
Airways blocked. They know what to do.
No hesitation.
Her vitals are going crazy, of course.
Heart rate, blood pressure.
Through the roof, oxygen levels plummeting.
Body's in full panic mode.
Every second matters. Brain damage is a real risk.
So they start with abdominal thrusts?
But after a minute, she passes out.
Oh, jeez.
Now what? Chest compressions. But steak's still there.
They lower her to the ground first.
To CPR.
This scenario gets super specific here.
Ah.
They go through 3 different pulse checks.
Why 3?
Thready pulse, no pulse. Or just apnea, meaning not breathing.
Why even check the pulse if she's not breathing?
It changes the response.
Oh.
Any pulse, you focus on breathing and compressions.
Right.
No pulse, it's full CPR to try and restart the heart.
So it's a different approach depending on what you find.
They're always assessing, reassessing.
So they do CPR for 2 minutes. Neat
So
fib.
time for the defibrillator, right?
You'd think so,
There's
but
the but.
before they shock her,
Yeah.
they have to check the airway again.
Wait, why? I thought every second counted.
Me too, but think about it.
Think about what?
Sometimes those compressions dislodge the object.
Oh, that's true.
If they shock her and the airway's clear,
It could be bad.
you can't just follow a checklist blindly, even in a crisis.
You got to keep thinking.
So they check, the steak is still there.
So what now? They reach in and grab it.
That's what I thought, but the scenario doesn't actually say.
Really? They leave that part out.
It just says they need to remove it before the shock.
Huh. Maybe they want the student to figure that part out.
Or maybe it's in another module.
So they remove the steak, shock her.
And
Do we find out if she lives?
Nope. That's where the scenario ends.
Oh, come on.
It's all about those critical decisions and the actions leading up to them.
I guess in real life, you never know for sure.
Right. Too many variables.
It's not like the movies.
Those last two scenarios, wow, talk about an adrenaline rush.
We know, right? To think that EMS deals with this every day,
They have to make split-second decisions.
under pressure.
And you mentioned those curveballs they throw in
Oh, yeah, they'll add little details.
to make you think critically.
Connecting the dots to something you learned before.
It's not just about memorizing steps,
No, it's about understanding the why.
like knowing how a car works, not just how to drive it,
Makes you a better responder, especially when things go sideways.
which is probably a lot in EMS.
I would imagine.
Ready for another one?
I'm ready.
Let's go back to that anaphylaxis case.
Okay, the guy with the hives.
But this time, we'll dive a little deeper into the details.
Sounds good to me.
Back again for more EMS deep dive action.
I'm ready for more, are you?
You know, after that last scenario, the choking one, I'm kind of glad we're just armchair responders.
Oh, yeah, that one was intense.
Before we wrap this up, though,
Okay.
let's circle back to that 60-year-old woman having seizures.
The one where her daughter couldn't remember the meds.
Exactly. Her vitals were all over the place.
It was a tricky one.
Slow heart rate, shallow breathing, low blood pressure, pull SS low blood sugar.
Yeah, a lot going on.
Did any of those jump out at you as particularly worrying?
I mean, they all pointed to something bigger going on, right? Like
Yeah.
some underlying medical issue contributing to the seizures.
And when multiple systems are affected like that,
It's definitely more serious.
and then bam, 5 minutes later, she's unresponsive.
that rapid deterioration, that's what scares me.
It's scary, right?
Things can change so fast.
Do you think knowing her history beforehand would have helped?
The epilepsy, hypertension, hypoglycemia.
Yeah. Would it have changed their approach?
Knowing those things always gives you more context.
Right.
Helps you understand her baseline, anticipate complications.
But in those first few minutes,
You often don't have that information.
you just got to go with your gut,
And your training.
hope for the best, but prepare for the worst.
Exactly.
And then that aha moment,
when the daughter remembers the Dilantin,
it's like the missing piece of the puzzle.
an anti-seizure med,
So any dosage changes could absolutely trigger a seizure.
it all starts to make sense.
It really highlights how important it is to advocate for yourself
Or your loved ones.
when it comes to meds.
Make sure everyone involved in your care knows what's going on.
It could make a huge difference in an emergency.
It really could.
So, big picture. After all these EMS scenarios,
Yeah,
what's your main takeaway?
the adaptability, for sure.
Adaptability.
These EMS folks, they have to be ready for anything.
Every situation is different.
Exactly. It's not just about knowing the procedures.
It's about thinking on your feet,
Staying calm under pressure.
knowing when to change your approach,
It's like mental chess, you know?
constantly thinking ahead, weighing the risks and benefits.
And all while dealing with the emotional toll, the danger.
It's a lot.
It is. They're incredible.
Well, that about wraps up our EMS deep dive.
I hope everyone enjoyed it.
Hopefully you learned something.
Maybe even a little bit of awe for these amazing folks.
Next time you see an ambulance,
Make a moment to appreciate them.
they're the ones keeping us safe.
True heroes.
That's it for us, folks. Stay curious, stay informed.
And space safe.
We'll see you on the next deep dive.
All right, strap in, everyone. We're going deep today. You know we love to dig into these AEMCA training scenarios.
Real-life medical dramas, that's what these are.
Yep. Today, it's a stack of them hangings, difficult births, someone collapses on a hiking trail, the whole works. And for those who haven't joined us before, we're talking about the Alberta Emergency Medical Technician Association, the folks who train those first responders.
The ones who make the split-second decisions when lives are on the line.
You got it. So let's just dive right in, shall we?
Let's do it.
Scenario number one. Picture this. A classic residential basement, kind of cramped, low ceiling.
Oh, I know the type.
Yeah, and hanging from that low ceiling is a 22-year-old male. The fire department just got him down, but he's unresponsive, no breathing, no pulse.
Time is absolutely critical in a situation like that. Every second that someone is hanging, the damage is increasing.
And the scene itself, that low ceiling, the fire department having to get involved, it kind of tells a story, doesn't it?
It does. It suggests potential difficulties in getting the patient down, maybe a delay in care.
The scenario goes on to say that the patient has cyanosis of the lips and face.
All right, that bluish discoloration.
We've talked about cyanosis before, but for those tuning in for the first time, what's that telling the AEMCA in this particular situation?
Well, it's screaming oxygen deprivation. And in a hanging, it's not just from the rope cutting off airflow, it's also pressure on those blood vessels in the neck.
So basically the blood's not getting to the brain.
Exactly, which reinforces the urgency. They need to get that circulation going again and fast.
There's this other detail that always gets to me. This scenario mentions fixed and dilated pupils.
Ah, yeah, that's like a...
Like, along with the abrasion on the neck from the rope, it's another piece of the puzzle, right?
It is. Fixed and dilated pupils often point to a severe brain injury, likely from that lack of oxygen we were just talking about.
So the AEMCA is not just thinking about cardiac arrest now, they're thinking about brain damage too.
Exactly.
And it gets more complex because we learned this patient has a history of depression
Oh, okay.
and a gambling addiction. He was recently put on antidepressants. His sister, the one who found him, said he'd been withdrawn lately.
That adds a whole other dimension to the situation, doesn't it?
Right, because now the AEMCA has to consider this might not be a simple accident.
Right. There's a psychological layer to this now.
So we've got a high-pressure scene, a patient in really bad shape, and a whole bunch of unknowns. Then they run their analyses and get pulseless electrical activity.
PEA.
Right, then ventricular fibrillation.
VFib.
Then back to PTA. What's going on there?
Well, think of the heart's electrical system, like the wiring in your house.
Mm-hmm.
PEA, that's like the lights are flickering, but none of the appliances are working.
The power's there, but nothing's happening.
Exactly. The heart is showing electrical activity, but it's not translating into a heartbeat. No pumping of blood.
In VFib, that's like the power surge.
More like everything's short-circuiting. It's chaotic. The ventricles are quivering instead of pumping. It's fatal if it's not treated quickly.
And this patient going back and forth.
Tells them this is a very sick heart, yeah.
The scenario actually mentions doing a fifth analysis before transport if no shocks have been given. Why is that?
Well, think of it as one last chance to see if a shockable rhythm has developed. They're buying time, trying every possible intervention.
Makes sense. Okay, let's switch gears. We're going from one extreme to another, childbirth.
Always a joyful occasion until it isn't.
We've actually got two scenarios here, and it's fascinating how the AEMCA has to adapt based not just on the medical situation, but the environment.
We're not in a hospital anymore.
Exactly. So, scenario 2. It's a 28-year-old woman, calls 911, her husband's not home, and she's convinced the baby is coming any second.
Oh, boy.
Her contractions are already 3 minutes apart.
Time is of the essence.
When the AEMCA arrives, they find her crowning.
Meaning the baby's head is starting to appear.
But there's a complication. The baby is turtling.
Turtling.
Yeah, I need you to explain that one.
Basically, the baby's head retracts between contractions, emerges a bit, then goes back in. Makes delivery more difficult.
And to add to the stress, she's only 36 weeks pregnant.
Premature.
So now the AEMCA has to think about potential complications for the baby too. Breathing difficulties, temperature regulation, all that.
A lot to juggle.
Then we've got scenario 3. A 22-year-old, her mom made the call.
No.
This time, the challenge isn't turtling, it's a breech presentation. The baby's feet, or maybe the buttocks, are coming first.
That's like trying to fit a square peg in a round hole. Completely different approach needed.
Right. The student instructions mention this McRoberts maneuver. Can you refresh our memory on that one?
It's a way to help the baby's shoulders navigate the birth canal.
Yeah.
Basically, the mother brings her knees towards her chest, opens things up a bit.
And guarding the uterus, what's that all about?
It's about controlling bleeding after the delivery, applying pressure to help the uterus contract back down, minimizes blood loss.
To prevent postpartum hemorrhage.
That's the one. It can be life-threatening.
It's amazing to me how much the AEMCA has to handle in these situations. They're not just delivering babies, they're anticipating problems left and right.
It's a mobile medical unit, on the fly.
Okay, last scenario for this part. Let's head outdoors. This one's a wilderness rescue.
Oh, I like these.
A 56-year-old male found unresponsive on a hiking trail 3/4 of a kilometer from the trail entrance.
Logistically, that adds a whole new layer of difficulty.
Right. Getting to the patient is the first hurdle.
And you've got to consider terrain, potential hazards, all of that.
So they finally reach him. He's unresponsive, no pulse, skin's pale and cyanotic, and there's mottling.
Modeling.
Yeah, like that patchy discoloration.
That's never a good sign.
It usually means the circulatory system is struggling.
The body's not getting oxygen where it needs to go.
The scenario throws out a bunch of possible cardiac rhythms, PEA, VFib, asystole. Why so many?
Because at this point, it's still a guessing game. They're working with limited information.
But they do know the bystander saw him rolling on the side of the trail before he became unresponsive.
Okay, now that's helpful.
Is it?
Could be a seizure, could be a stroke, could be a heart attack.
Yeah.
Give them something to work with.
And last but not least, that note. extrication from the trail while continuing CPR ventilations.
Now that's a challenge.
It sounds almost impossible.
Trying to maintain CPR, navigating uneven terrain, stabilizing the patient. It's a delicate balance.
You know, listening to this, it's clear that being an AEMCA is about so much more than just medical knowledge. It's problem solving, critical thinking, staying calm under pressure.
It's a unique skill set for sure.
Absolutely. All right, we've got a lot more scenarios to get through, so stay tuned for part 2 of our deep dive into the world of emergency medicine. You won't want to miss it. Back again for more AEMCA action.
You know, it never ceases to amaze me how these scenarios are like little puzzles, each with its own twists and turns. They really are. You've got the medical mystery itself, and then you've got the environmental factors, the human element, all these layers that the AEMCA has to navigate.
Speaking of layers, this next scenario takes us back indoors. It's a 67-year-old male, fell off a ladder putting up Christmas lights. I can practically hear the carols playing in the background. And then, bam, down he goes.
Happens more often than you think. And it's a good reminder that even during the holidays, those emergencies don't take a break.
Nope, they sure don't. In this case, he hit his head on concrete. Initially unresponsive. That's always scary.
Head injuries, they can be tricky. Even if someone seems okay later on, there could be underlying damage.
Right, like a ticking time bomb.
Exactly. So the AEMCA arrives, and he's conscious and alert, but his vital signs are a bit off. Heart rate's up, breathing's fast, skin's pale and clammy.
Classic signs of shock, right?
Yep. Body's definitely under stress. And then they notice a deformed and tender left wrist.
Ouch. So possible fracture on top of the head injury?
That's what they're thinking. And there's a hematoma on his forehead, too.
Hematoma. For those of us who didn't go to med school, what's that in plain English?
Basically a collection of blood outside of the blood vessels. Like a bruise, but potentially more serious depending on the location and size.
Okay, that makes sense. And then we get to his medical history, and it's a doozy. Emphysema, right-sided heart failure, non-insulin dependent diabetes, hyperlipidemia. The list goes on.
Wow, yeah. So now the AEMCA has to think about how this fall might be impacting those existing conditions and vice versa.
Like his heart's already working overtime, now it's got to deal with this trauma on top of it.
Exactly. And then, as if things weren't complicated enough, the patient starts talking about feeling weak and short of breath. Says the oxygen hasn't been helping him as much lately.
Oh, that's concerning.
It is. So they check his vitals again, and despite the oxygen, his breathing's even more labored.
This is where the AEMCA's training really comes into play, right? They have to make quick decisions, prioritize interventions, and make sure they're not missing anything.
Absolutely. It's like a medical chess match, trying to anticipate all the possible moves and countermoves.
Okay, enough with the indoor drama. Let's get back to that restraint scene you teased earlier. Someone's choking, right?
That's right. Picture this. A busy restaurant, people enjoying their meals, and then all of a sudden, a woman starts choking. Not just a little cough, but a full airway obstruction.
Oh man, I hate even thinking about that. It's one of those things that can go from 0 to 60 in a heartbeat.
Exactly. 1 minute you're having a pleasant dinner, the next minute you're fighting for breath.
So what's happening in her body at this point? I mean, beyond the obvious that there's something stuck in her airway.
Well, her body's basically panicking. It's sensing a threat. And that triggers a whole cascade of physiological responses. Her heart rate goes up. Her breathing becomes labored. Her oxygen levels plummet.
The scenario mentions edema to the throat and mouth, swelling around the trachea.
Right. Edema. That's just a fancy word for swelling.
But why is the swelling such a big deal? I mean, isn't that just part of the body's natural response to injury?
It is, but in this case, the swelling itself is making the problem worse. It's constricting the airway even further, making it harder to breathe.
So it's this vicious cycle. The more she struggles to breathe, the more her body fights back, and the worse the obstruction becomes.
Exactly. And that's why the AEMCA's actions are so crucial. They have to break that cycle, and they have to do it fast.
And they jump into action right away. Epinephrine, that seems to be the go-to medication for airway problems.
It's like a magic bullet for this kind of situation. It helps to reduce swelling and relax the muscles in the airways.
But sometimes one dose isn't enough, right? The scenario talks about a possible need for a second dose.
It all depends on how the patient responds. If the first dose doesn't have the desired effect, you might need to hit it again.
And then there's diphenhydramine and salbutamol. What are those doing in this mix?
Think of them as backup singers. They're not the main act, but they provide important support. Diphenhydramine, that's an antihistamine, so it helps to block the allergic reaction that's contributing to the swelling. Salbutamol, that's a bronchodilator, so it helps to open up the airways even more.
So it's a multi-pronged attack on the problem.
Exactly. And it highlights how the AEMCA has to think on multiple levels, addressing not just the immediate symptoms, but the underlying causes as well.
Okay. Ready for round 2 of childbirth drama? You said this one was going to be a doozy.
Get ready for a double dose of high-stakes deliveries because these next 2 scenarios will definitely keep you on the edge of your seat.
All right, hit me with it.
Scenario number 2. We're back in that familiar territory, a woman in labor at home. But this time, things escalate quickly. The husband's not there, contractions are close together, and she's convinced the baby's coming right now.
Oh man, talk about stress.
Yeah, it's a classic labor panic situation. And the AEMCA arrives to find her crowning. Baby's head is starting to emerge.
Okay, so far so good, or so we think.
But there's a twist. The baby is turtling.
Wait, rewind. Turtling. You're going to have to explain that one.
It's kind of like it sounds.
Mm-hmm.
The baby's head emerges a bit during contractions, but then it retracts between them.
Like a game of peekaboo, but with much higher stakes.
Exactly. And to make matters even more complicated, she's only 36 weeks pregnant.
So premature, which adds a whole other level of worry.
Absolutely. Premature babies are more delicate, more susceptible to complications. So now the AEMCA has to factor that into their decision-making.
The student instructions mention McRoberts maneuver again and that guarding the uterus thing. Can you just give us a quick refresher on why those are so important?
Sure. McRoberts maneuver, it's all about creating more space in the birth canal. Having the mother bring her knees towards her chest can really help if the baby's shoulders are getting stuck, which is more common in preterm deliveries.
And guarding the uterus, that's all about minimizing blood loss after the delivery, right?
You got it. Applying gentle pressure to help the uterus contract back down. It's crucial for preventing postpartum hemorrhage.
It's incredible how the AEMCA has to master so many different techniques. They're like medical multitaskers, juggling a million things at once.
And they have to do it all under pressure with 2 lives in their hands. Speaking of pressure, get ready for our second childbirth scenario. This one throws a whole different curveball.
Okay, lay it on me.
Picture this. The AEMCA gets to the house. 22-year-old woman in labor, things are moving fast. But this time, the challenge isn't turtling, it's a breech presentation.
Meaning the baby's feet or buttocks are coming first.
Exactly.
That's a lot more complicated, right?
It's like trying to fit a square peg into a round hole. Requires a whole different approach, a whole different set of skills.
The scenario even mentions something called the somersault maneuver. Sounds a bit acrobatic for a childbirth scenario.
It does, doesn't it? But it's a specific technique for breech deliveries. The AEMCA will carefully guide the baby as it emerges, allowing the body to naturally somersault out. Helps to prevent injury.
So it's about working with the baby's position, not trying to force anything.
That's the key. It's a delicate balance between supporting the natural birthing process and intervening when absolutely necessary.
The student instructions also talk about the importance of managing the umbilical cord in breech births. What's the big deal with that?
Well, with a breech presentation, there's a higher risk of the cord getting compressed, which can cut off the baby's oxygen supply. So the AEMCA has to be constantly monitoring the cord, making sure it stays unobstructed.
Wow, so much to think about. It's amazing how the AEMCA keeps it all straight.
It's a testament to their training, their experience, and their ability to stay focused under pressure.
All right, last scenario for this part. You promised a wilderness rescue. Let's head back to the great outdoors.
All right, lace up your hiking boots because this one takes us deep into the backcountry. A 56-year-old male found unresponsive on a hiking trail. And to make things more interesting, he's 3/4 of a kilometer from the trail entrance.
Okay, right away, we've got logistical challenges. Getting to the patient is going to be half the battle.
Exactly. You're dealing with uneven terrain, potential hazards, and the clock is ticking the whole time.
And when they reach him?
The situation is not good. Unresponsive, no pulse, skin's pale and cyanotic, and there's mottling.
Modeling again, huh? That patchy discoloration.
Yeah, it's a sign of poor circulation. Means the body's struggling to get oxygen where it needs to go.
The scenario lists PEA, VFib, asystole, all those possible heart rhythms. Are they just throwing darts at a board at this point?
Not quite, but they're definitely working with limited information. They need more clues to figure out what's going on with his heart.
Well, luckily, the bystander saw him rolling on the side of the trail before he became unresponsive.
Okay, now that's valuable information.
It is.
Could be a seizure, could be a stroke, could be a heart attack. It gives them a starting point for their investigation.
Like a medical detective story.
Exactly. And then there's that note, extrication from the trail while continuing CPR ventilations.
Sounds like a nightmare.
It's one of those things that's easier said than done. Maintaining CPR, stabilizing the patient, navigating tricky terrain, it's a massive team effort.
These scenarios, they really emphasize the fact that being an AEMCA is about so much more than just knowing your medical stuff.
It's about critical thinking, problem solving, adaptability, and a whole lot of grit.
All right, that's it for this round. Stay tuned for part 3, where we'll tackle even more challenging emergencies and see how the AEMCA rises to the occasion. We're back, ready for the final stretch of our AEMCA deep dive. We've seen some intense situations already, but I have a feeling you've saved the best, or maybe the most challenging, for last.
Well, let's just say these last few scenarios, they really test the AEMCA's ability to think on their feet and adapt to the unexpected.
Okay, I'm intrigued. Hit me with it.
Right.
What's the first emergency we're tackling?
We're going back to a residential setting, but this time there's a chilling element to it. A 22-year-old male found hanging in the basement.
We've talked about hangings before, but each one is unique, right? What makes this particular scenario stand out?
It's the way the details unfold, like layers of a really grim onion. You've got the scene itself, a typical basement, cramped, low ceiling, which immediately adds a sense of claustrophobia. And then there's the fact that the fire department's already there when EMS arrives.
They had to get him down, I'm guessing.
Exactly. They've lowered him to the floor, but he's unresponsive, no breathing, no pulse. Time is absolutely of the essence.
It's a race against the clock in those situations, isn't it? Every second counts.
It really does. You've got potential airway obstruction from the rope, but also that pressure on the blood vessels in the neck, cutting off blood flow to the brain. The longer that pressure continues, the worse the outcome.
The scenario mentions cyanosis of the lips and that purple, blood-backed-up look to the face. It's a visual that sticks with you, and I imagine it's a big red flag for the AEMCA.
Absolutely. Cyanosis in a hanging, that's a sign of severe oxygen deprivation. It tells them they can't waste any time. They need to get circulation going again fast.
There's another detail that always gets to me in these hanging scenarios: the fixed and dilated pupils.
Yeah, that's not a good sign.
Along with the abrasion from the rope on his neck, it just paints a grim picture.
Fixed and dilated pupils. That often indicates a significant brain injury, likely from that lack of oxygen we were talking about.
Yeah.
So now, the AEMCA isn't just dealing with a potential cardiac arrest, they're dealing with the potential neurological crisis on top of it.
And as if things weren't complicated enough, then we get to the patient's history. A history of depression, gambling addiction, recently started on antidepressants.
Oh, wow.
His sister, the one who found him, mentioned he'd been withdrawn lately.
Ah, that adds a whole other layer to the situation, doesn't it?
Right. It's not just a medical emergency anymore. It's a potential mental health crisis as well.
Exactly. The AEMCA has to consider all these factors as they're making their decisions.
It's like trying to solve a puzzle with missing pieces. And then we get to the cardiac rhythms. First, they get pulseless electrical activity, then ventricular fibrillation, then back to PEA again.
Yeah, that's a roller coaster.
What's going on there?
Or remember our house wiring analogy. PEA, that's like the lights are flickering, but none of the appliances are working. The heart is showing electrical activity, but it's not translating into a proper heartbeat.
And VFib, that's like the electrical system's gone haywire.
Exactly. The ventricles are just quivering instead of beating. And the fact that he's bouncing between the two, it suggests a very unstable, very sick heart.
The scenario even mentions doing a fifth analysis before transport if no shocks have been given. Why is that fifth analysis so important?
Think of it as one last chance saloon. They're checking to see if a shockable rhythm has emerged, because in a situation like this, every opportunity to intervene counts.
It's like they're buying time hoping for a miracle.
In a way, yeah.
Okay, let's move on to something a bit more hopeful, or at least we hope it will be. You promised some high-stakes childbirth scenarios.
Well, we got two of them, and trust me, they'll get your heart racing.
All right, I'm ready. Let's hear about the first one.
We're called to a home where a 28-year-old woman is in labor. Her husband's not home, and she's convinced the baby is coming any minute now.
Classic labor panic. I can practically hear her through the phone lines.
When the AEMCA arrives, they find her crowning. Baby's head is starting to emerge. So far, so good.
But I'm sensing a but coming.
But the baby is turtling.
Oh no, not turtling again. Remind us what that means.
It's when the baby's head emerges a bit during contractions, but then retracts between them. makes for a more challenging delivery.
And just to add to the stress, she's only 36 weeks pregnant.
Premature.
So now the AEMCA has to think about potential complications for the baby as well. Breathing difficulties, temperature regulation, all of that.
It's a lot to juggle, especially in a situation that's already high pressure.
The student instructions mention that McRoberts maneuver again and guarding the uterus. Can you give us the quick rundown on why those are so important?
Sure. McRoberts, it's all about creating more space in the birth canal. Having the mother bring her knees towards her chest can really help if the baby's shoulders are getting stuck, which can happen more often with premature babies.
It's like giving the baby a little extra room to maneuver.
Exactly. And then guarding the uterus, that's all about controlling bleeding after the delivery. Applying pressure to help the uterus contract back down is crucial for preventing postpartum hemorrhage, which can be very dangerous.
It's amazing how the AAMCA has to have all these different techniques at their fingertips, ready to go at a moment's notice.
They're like medical ninjas, skilled in the art of childbirth. But speaking of skills, this next childbirth scenario really puts them to the test.
Okay, I'm bracing myself. What have we got?
The AEMCA arrives at a home where a 22-year-old woman is in labor, and it's moving fast. But this time, the challenge isn't turtling. It's a breech presentation.
Okay, we talked about this earlier. The baby's feet or buttocks are coming first. Definitely not ideal.
Not ideal at all. It's like trying to fit a square peg in a round hole. Requires a completely different approach and a much higher level of skill and precision.
The scenario mentions this somersault maneuver. That sounds a bit acrobatic for childbirth, doesn't it?
It does, but it's a specific technique for breech deliveries. The AEMCA will carefully guide the baby as it emerges, allowing the body to naturally somersault out.
So it's about working with the baby's position, not trying to force anything.
Exactly. It's a delicate balance between supporting the natural birthing process and intervening when absolutely necessary to prevent injury.
The student instructions also emphasize the importance of managing the umbilical cord in breech births. Why is that so critical?
Because with a breech presentation, there's a higher risk of the cord getting compressed, which can cut off the baby's oxygen supply. So the AEMCA has to be super vigilant, monitoring the cord constantly and making sure it stays unobstructed.
It's like they're juggling chainsaws while riding a unicycle. The level of skill and concentration required is just phenomenal.
It really is. And these childbirth scenarios, they really highlight how the AEMCA's role goes far beyond just the medical aspects. They're also providing emotional support, reassurance, and guidance to the mother during what can be a very scary and overwhelming experience.
They're like midwives, therapists, and emergency responders all rolled into one.
Exactly.
Okay, ready for our last adventure? You promised us one final wilderness rescue.
All right, let's head back to the great outdoors for one last challenge. A 56-year-old male found unresponsive on a hiking trail, 3/4 of a kilometer from the trail entrance.
Okay, right off the bat, we've got logistical issues. Getting to him is going to be a trek in itself.
You've got that right. Uneven terrain, potential hazards, and of course the clock is ticking the whole time.
So they finally reach him. What's the situation?
They're not good. He's unresponsive, no pulse, pale and cyanotic skin, and that modeling we talked about earlier.
Not a good sign.
Nope. Means the body is struggling to circulate blood and oxygen.
They list a whole bunch of possible heart rhythms. PEA, VFib, asystole. Are they just shooting in the dark at this point?
Well, they're working with limited information, but they're not completely clueless. They're using their assessment skills and diagnostic tools to try and narrow down the possibilities.
The scenario mentions that the bystander saw him rolling on the side of the trail before he became unresponsive.
Okay, now that's helpful.
Is it?
Could be a seizure, a stroke, a heart attack. It gives them a starting point for their investigation.
They're like medical detectives piecing together the clues.
Exactly. And then there's that final note. Extrication from the trail while continuing CPR ventilations.
Oh boy, that sounds like a logistical nightmare.
It's one of the most challenging situations an AEMCA can face.
Yeah.
Maintaining CPR, stabilizing the patient, navigating that rough terrain. It requires incredible teamwork, communication, and a whole lot of stamina.
We've covered a lot of ground in this deep dive, from hangings and choking victims to high-stakes childbirth and wilderness rescues. It's been an eye-opening experience.
It has. And it really just scratches the surface of what AEMCs do on a daily basis. Their work is demanding, unpredictable, and often emotionally draining, but it's also incredibly rewarding.
Absolutely. They're the ones who run towards danger when everyone else is running away. They bring calm to chaos, and they give hope in the face of fear.
They're the unsung heroes of our communities,
Yeah.
and we owe them a huge debt of gratitude.
Well said. And to all our listeners out there, the next time you see an ambulance speeding by, take a moment to think about those AEMCs inside. They're the ones who make the difference between life and death.
They are the ones who make a difference every single day.
That's a perfect note to end on. Thank you for joining us on this incredible journey into the world of emergency medicine. Until next time, stay safe out there. All right, ready to dive deep into some advanced emergency medical care?
Always ready for a challenge.
So we've got some pretty intense training scenarios here, and we're going to break them down, see what's happening, how AEMCA personnel would handle them. It's like a medical drama, but with real-world protocols.
Exactly, except the stakes are way higher.
Right. We're talking life or death decisions here. And to make it even more interesting, we're working with images, not text descriptions.
Visuals can be really powerful, especially when you're trying to imagine yourself in that situation.
So each scenario gives us the patient, the situation, details about assessment and treatment, and what actions they're expected to take. Get ready for some aha moments, though, because we're going to unpack some fascinating details about how medical professionals assess these situations.
Absolutely. We're going to see how they think under pressure, how they make those split-second decisions.
Exactly. All right, let's jump right into our first scenario. A 22-year-old male decided to, jump from a second-story window. Police are already on scene, and the report says he's in obvious discomfort. Understatement of the year, maybe?
Yeah, I'd say so. Especially when you consider the next detail. Mid-shaft femur fracture.
Okay, so for our listeners who aren't, orthopedic surgeons, what exactly does that mean, and what kind of problems does it present for our first responders?
So a mid-shaft femur fracture, that means the long bone in your thigh is broken right in the middle. And it's not a clean break either. We're talking potential damage to muscles, nerves, blood vessels. And you're looking at a lot of blood loss, which, can become a really big problem fast.
Yeah, that's not good. And on top of that, the report mentions possible meth and marijuana use.
Right, so you're dealing with a patient who's in a lot of pain, potentially agitated, maybe even combative. Not exactly a recipe for a smooth scene.
So we've got a serious injury, potential drug use, and a chaotic scene. How do first responders even begin to approach a situation like this? I mean, their own safety has to be a priority, right?
Absolutely. Scene safety is always the first thing. They need to assess the area for any immediate dangers. Broken glass, traffic, potential weapons. If the patient's acting erratically, that adds another layer of risk.
Right, because approaching someone who's already injured and potentially high on meth, that could make things a lot worse.
Exactly. They need to create a safe working environment for themselves and anyone else around. But at the same time, they also need to be quickly assessing the patient's condition.
Oh, okay, so what are they looking for?
Well, the source mentions he's pale, cool to the touch, and breathing rapidly. That's classic shock, which means his body isn't getting enough blood flow where it needs to go, and that's life-threatening.
So shock is a major red flag. What steps are taken to address that while also managing the potential drug use and that femur fracture?
Well, pain management is huge, not just for the patient's comfort, but severe pain can make shock worse. The sources highlight this technique called Sager traction. It's a way to stabilize the fracture and reduce pain by gently pulling the leg.
I can only imagine trying to do that with someone who's freaking out. The source also mentions these things called cravats. What are those and how do they fit in?
Cravats, they're basically triangular bandages.
Yeah.
Super versatile. Think of them like the Swiss Army knives of first aid. Here, they'd probably be used to help secure that Sager splint.
Got it. So it's all about controlling the scene, stabilizing the patient, managing pain, and doing it all as quickly and safely as possible. Heavy stuff. Ready for our next patient.
Hit me with it.
Okay, this one takes us to a garage. We've got a 45-year-old male who's unresponsive. His neighbor found him, and get this, there's a mix of pill bottles nearby. What's going through your head when you hear that?
Overdose. Immediately jumps out. That many pill bottles. Could be a dangerous combination of medications.
And the details aren't exactly promising. No pulse, not breathing, fixed and dilated pupils, cool and dry skin. Grim, to say the least.
Yeah, it emphasizes how important immediate action is. Every second counts in a situation like this.
Now, there's one detail that caught my eye. VFib shock advised. Can you break down what that means, especially for those who aren't medical professionals?
VFib, that stands for ventricular fibrillation. Basically, the heart's electrical system is all messed up. The ventricles, which are the lower chambers, they're just quivering instead of beating effectively.
So his heart's basically short-circuiting?
In a way, yeah.
Oh.
And without proper blood flow, organs start shutting down fast. That's where shock advised comes in. They're talking about defibrillation, that electrical shock to try and reset the heart's rhythm.
It's amazing how quickly you have to think and act. But here's where things get interesting. The scenario includes a post-RSC section. What's that all about?
ROSC. That stands for return of spontaneous circulation. So his heart started beating again after they did CPR.
So there's hope.
There's a chance, yeah. But this post-ROSC part is important because it shows that even when the heart restarts, you're not out of the woods. There's still a high risk of complications.
Okay, so we've gone from no pulse to a heartbeat, but it's still really critical. Ready for our next scene. This time, we're at a bus terminal.
Let's hear it.
All right, picture a busy bus terminal, right? Our patient, 18-year-old male, and the report says he punched through a plate glass window. I'm wincing just reading that.
Ouch. Yeah, and that tells you right away you're probably dealing with someone who's agitated, maybe combative. The source says he's intoxicated too, which makes everything harder.
Yeah, he admitted to drinking heavily and possibly using drugs, and we can't forget the obvious, profuse bleeding from his arm. Before we even talk about treatment, what are the immediate concerns for our first responders?
Scene safety, always. You've got an intoxicated, potentially combative patient in a public space, plus broken glass. They need to assess the scene, control any dangers, and make sure everyone's safe before they even approach the patient.
Because rushing in could make things worse for everyone involved. Now, the source mentions a delayed pulse in the injured arm and a need for a tourniquet. What's that all about?
A delayed pulse, it suggests there might be damage to a major artery, which means you can lose a lot of blood very quickly. A tourniquet, that's a life-saving device. It applies direct pressure to stop that bleeding.
Sounds essential. But how does the alcohol complicate things?
Alcohol can make assessing the patient a real challenge. He might not be able to describe his symptoms accurately, and his perception of pain might be off. And, his behavior could be unpredictable.
So we've got a chaotic scene, uncontrolled bleeding, and an intoxicated patient. And then bam, 9 minutes in, our patient loses consciousness, his vitals plummet. What just happened?
Sounds like he's going into hypovolemic shock. That's when you lose too much blood. Even with a tourniquet, the bleeding could have been too severe, or maybe there are other internal injuries we don't know about yet.
It's crazy how fast things can go downhill in these situations. Let's take a break, catch our breath, and then we'll come back and talk about some of the key takeaways from these scenarios.
It's kind of wild, isn't it? These scenarios, they can get your heart racing, even though you know it's not real.
I know, right? It really makes you appreciate the pressure these EMCA folks are under every day. So let's go back to that 22-year-old, the one who jumped from the window. Fractured femur, possible drugs, a lot of pain. What happens next?
Well, the sources emphasize a thorough scene survey. They can't just jump in and start treat without seeing the whole picture,
So it's more than just looking for dangers like broken glass. What else are they checking for?
Right, exactly. It's about context. Why did he jump? Are there witnesses who can tell us about his behavior before? Is there anything in the environment that's a risk, like traffic or weapons? They're gathering information from everyone, the police too, to build a picture of what they're dealing with.
It's like detective work, almost.
Yeah, you could say that. And of course, they need to assess his injuries, especially that femur fracture.
So checking the pulse below the injury, making sure the leg's not deformed, looking for open wounds, right? I imagine a compound fracture where the bone breaks through the skin, that would complicate things.
Big time. Compound fracture means higher risk of infection, more blood loss. So once they have a handle on the situation, the sources talk about pain management and immobilization as the next steps.
And that's where the Sager traction comes in. I'm still a bit fuzzy on how that works, to be honest.
Okay, so think of it like this. The femur, it's a strong bone. When it breaks, the muscles can spasm and pull those broken ends out of alignment. More pain, more damage. Sager traction uses this system of pulleys and weights to gently pull the leg straight, hold it in place. It's not a permanent fix, but it helps until they can get him to the hospital.
So it's kind of like a temporary splint, and the cravats help secure it.
Exactly. Create a stable environment for that bone while you manage everything else. But even after that, they can't just relax. Ongoing assessment is crucial.
Because things can change fast.
Exactly. Monitoring vital signs, checking for shock, reassessing the injury, making sure the traction's doing its job. It's a dynamic process,
Hmm.
always evaluating and adjusting.
Makes sense. You're always thinking, looking for subtle changes. Right. Okay, let's switch gears. Back to our unresponsive 45-year-old, the one in the garage. He's got a pulse now, but he's still in rough shape. What's the focus?
Well, even with a heartbeat, he's still unconscious, very vulnerable. The sources are big on supportive care during this post-ROSC phase.
What does that look like? What are they doing to support him?
Airway, breathing, circulation, ABCs, always. They're making sure his airway is clear, that he's getting enough oxygen, monitoring his breathing, which is probably shallow and irregular, and of course watching his heart rhythm, blood pressure, all those vital signs.
So even though he's technically alive, there's still so much that could go wrong.
Oh yeah, absolutely.
Yeah.
And the sources mention specific observations that can give us clues about potential complications. Like, well, his pupils are dilated and sluggish, which could be a sign of brain injury from the lack of oxygen. His skin is cool and dry, might mean poor circulation. Red flags, all of them, that need careful management.
ROSC is just the first hurdle, isn't it?
Yeah, it's a long road. Remember, emergency medicine is about giving them the best chance of a good outcome, not just bringing them back. So, ready to head back to the bus terminal.
Let's do it. That 18-year-old with the bleeding, that was a tough one.
Yeah, definitely a case where speed is key. The sources really emphasize controlling that hemorrhage.
They already put on a tourniquet, right? What else can they do?
They're going to be monitoring that tourniquet like a hawk, making sure it's in the right spot, applying enough pressure, checking for any other bleeding too, applying direct pressure. And with him unconscious, airway and breathing become even more critical.
Yeah, he can't tell him if he's having trouble breathing or if something's too tight.
Exactly. And it's not just the medical stuff either. The sources mention contacting the police.
I can see that being important at a bus terminal, crowd control and all, but is there another reason?
Well, remember, he punched through a window. That could suggest he's a danger to others. The police can make sure everyone stays safe, including the medical team.
It's like juggling a dozen things at once. The medical emergency, potential danger, the chaotic environment. What else are they focusing on?
Getting him to a trauma center, and fast. With that much blood loss, he needs to be in a hospital ASAP.
Time is definitely not on their side, but how do they know if there are other injuries if he's unconscious?
They talk to witnesses, check security footage, try to figure out what happened. It's about understanding the whole story so they can anticipate problems and provide the best care.
Emergency medicine is pretty intense. You need the skills, the quick thinking, the ability to handle chaos. It's exhausting just listening to it all.
Tell me about it. These AEMCA personnel are something else. Ready to wrap up with some final thoughts?
Absolutely. Let's head back to the studio and unpack what we've learned. All right, so we've gone through some pretty intense situations today. Fractured femur, possible overdose, that arterial bleed. These cases really show you what AEMCA personnel deal with every day. Those split-second decisions, critical actions, it's a lot.
And they handle it all with such skill and composure. It's really impressive.
Yeah, it makes you think about their training, their expertise. So let's take a minute to think about what we've learned, starting with that 22-year-old, the one who jumped from the window. What really stuck out to you about that scenario?
I think for me, it was the realization that there's so much more to emergency medicine than just, fixing the injury. You're dealing with a person who's scared, in pain, maybe under the influence. So good communication, empathy, those things are just as important as knowing how to put on a splint.
It's about seeing the whole picture, right? Not just the broken bone, but the person.
Absolutely.
Yeah.
And it doesn't stop there. The sources really hammered home the importance of ongoing assessment. Even after you've stabilized the fracture, things change fast, and you got to be ready for complications.
It's like you're always one step ahead, thinking about what might happen next. All right, let's talk about the 45-year-old, the overdose. That one was a real eye-opener about early intervention.
Oh, yeah. When someone's heart stops, every second counts. Knowing CPR, having a defibrillator, that can literally save a life. But what really got me was the emphasis on the post-ROSC phase.
Yeah, you think once the heart's beating again, everything's fine, right? But like we saw, recovery's not that simple.
Not at all. ROSC is just the start. You've got a critically ill patient who needs constant monitoring, high risk of complications, and you don't even know the extent of brain damage yet. It reminds you that emergency medicine isn't just about saving lives, it's about giving them the best chance at a good recovery.
Okay, last but not least, let's go back to that crazy scene at the bus terminal. The 18-year-old, the bleeding. Man, that was intense.
Scene management at its finest, really. Public space, agitated patient, broken glass, blood everywhere. Those first responders did an amazing job getting the situation under control, making sure everyone was safe, and then providing that life-saving care.
And that tourniquet, right. Such a simple thing, but so effective.
It really shows you that sometimes the basics are the most powerful tools.
Mm.
But you got to know how to use them. Putting a tourniquet on wrong can do more harm than good.
What really struck me was how they worked together. It wasn't just one person doing everything. It was a team, working seamlessly.
Teamwork is absolutely essential in emergency medicine. Paramedics, EMTs, police, firefighters, even bystanders sometimes, all working together to save a life. Good communication, respect, knowing your role, that's what makes it work.
So looking back at all these scenarios, what are some things you hope our listeners take away from this?
Well, I think it's important to remember that we all have a role to play in an emergency. Knowing basic first aid, CPR, that can make you a lifesaver. Don't be afraid to step up if you see someone in trouble.
And never, ever hesitate to call for help. If you're not sure, dial 911. The dispatchers, they'll guide you, get the right people there fast.
These scenarios, they're just a glimpse into the world of emergency medicine. It's demanding, but it's also incredibly rewarding. If you're interested in learning more, I encourage you to dig deeper. Look up Sager traction, ventricular fibrillation, tourniquet application. The more you know, the better prepared you'll be.
Well said. Thanks for joining us on this deep dive into emergency medicine. And to our listeners, stay safe and be prepared. All right, so welcome to another deep dive. Today, we're going to be looking at some emergency scenarios, the kind that first responders actually use for training.
It's always interesting to see how those play out because they really emphasize the importance of quick thinking and decisive action when lives are on the line.
Yeah, so we're not just going to be talking about procedures here, but really trying to understand the human element of what happens in those critical moments. We're going to be focusing on the initial assessment, those first few minutes, looking at vital signs, patient history, and the immediate actions taken.
I think it's a good approach because it gives you a chance to really appreciate the thought process that goes into every decision. It's like a puzzle you have to solve under pressure.
Exactly. And like every good puzzle, there are clues everywhere. So are you ready to dive into our first scenario?
Absolutely. Let's do it.
All right, picture this. You're dispatched to a house where a frantic son has called about his 79-year-old mother. He's worried because her breathing has been getting worse, and he's afraid he won't be able to get her to the hospital in time.
So right away, you have that sense of urgency that every second counts.
Exactly. You arrive at the scene and you find the patient sitting in a chair, visibly struggling to breathe.
Classic presentation for respiratory distress.
Her skin is pale, cool, and clammy. She's sweating a lot, and you can see she's using those accessory muscles in her neck and shoulders to try and get air in.
And the scenario mentioned she's been coughing for about a week now. It's been getting progressively worse, and she's bringing up this greenish-brown phlegm.
Yeah, not a good sign. It sounds like whatever's going on has been brewing for a while and is now reaching a critical point.
Right, and that cough with the colored phlegm could be a sign of a respiratory infection, maybe pneumonia.
Her vital signs definitely back that up. Her pulse is racing at 110 beats per minute. She's breathing rapidly at 32 breaths per minute, and her blood pressure is elevated at 150/96. And on top of that, her oxygen saturation is only 88%.
So all those vital signs are basically screaming that her body is not getting enough oxygen.
Exactly. And for anyone who's not familiar, oxygen saturation is basically a measure of how much oxygen is in your blood. A normal reading is typically above 95%, so 88% is definitely cause for concern.
You're in the danger zone at that point, yeah.
In this situation, the first responders immediately administer oxygen through a nasal cannula, that little tube that goes under the nose.
It's such a basic intervention, but it can make a world of difference.
Absolutely. They also consider using a HEPA mask, given her cough, to minimize the risk of spreading any potential infection.
Smart move. Always better to be safe than sorry, especially when dealing with respiratory issues.
And thankfully, the oxygen starts to help. After a few minutes, her heart rate slows down to 106, her breathing improves slightly to 28 breaths per minute, and her oxygen saturation jumps up to 93%.
That's a great sign. It shows that even simple interventions can have a significant impact.
Now, while all this is going on, the first responders are also working on getting a sample history. For our listeners who might not know, that stands for symptoms, allergies, medications, past medical history, last oral intake, and events leading up to the incident.
It's like a medical detective's checklist. You
Yeah.
gather all those clues to try and piece together what's going on.
And then they'll move on to a focused or complete secondary assessment, depending on the situation, ideally during transport to the hospital.
Right, because those assessments can help uncover any underlying conditions or additional injuries that might not have been immediately apparent.
All right, now let's change gears and imagine you're responding to a call at an assisted living facility. The staff are concerned because a 62-year-old resident didn't show up for dinner.
Well,
When they check on her, they find her in her room in respiratory distress.
and has she been feeling unwell leading up to this?
They also mention she's been vomiting throughout the afternoon.
So already you've got two red flags, respiratory distress and vomiting. Not a good combination.
Upon arrival, you find her sitting up in bed, leaning forward and bracing herself with her hands on her knees. That's what we call the tripod position.
Yeah, it's a classic sign that someone's really working hard to breathe.
She is alert but obviously struggling, and you note that her pulse is strong and bounding.
Bounding, huh? That's interesting. Could be a sign of a heart issue or maybe even anxiety.
Your physical assessment reveals crackles throughout all lung fields, and she's still nauseous and vomiting. Her initial vital signs are pretty concerning. Her heart rate is 110 beats per minute, and it's irregular.
Ah, so there's that irregularity you mentioned. That definitely points towards a possible cardiac problem.
Her breathing is also labored and irregular at 36 breaths per minute. Her blood pressure is high at 70s on lower 1 on 10, and her oxygen saturation is down to 77% on room air.
Those are some seriously worrying numbers. The irregular heart rate and the history of vomiting, combined with those other vital signs, make me think we need to get a 12-lead ECG on her as soon as possible.
A 12-lead ECG.
Yeah, it's basically like taking a detailed picture of her heart's electrical activity. It can help us determine if there's a cardiac problem contributing to her symptoms.
So it's like an X-ray, but for the heart?
Exactly. Now, the scenario also provides her medication list, and it's pretty expensive. She's on ASA, Nitro, Lasix, Ramipril, Lipitor, Rabeprazole, and Emi.
Wow, that's a lot of medications.
It is. And her past medical history includes congestive heart failure in 2017, hypertension, hyperlipidemia, and GERD.
Okay, so there's definitely a history of cardiovascular issues here. We need to consider how those past conditions and her current medications might be playing a role in her current state.
Definitely. Each of those medications has its own potential side effects and interactions, so it's like a complex puzzle trying to figure out how they might be influencing her symptoms.
And to make matters worse, her condition deteriorates despite receiving oxygen. Her heart rate climbs to 116, still irregular.
Still irregular, huh? That's concerning.
Her breathing remains labored at 32 breaths per minute, her blood pressure stays elevated at 160/100, and her oxygen saturation only improves to 87%, even with a non-rebreather mask. And most worryingly, her GCS, her level of consciousness, drops to 15.
Oh, that's not good. A drop in GCS means her brain might not be getting enough oxygen, or there could be something else affecting her brain function.
So this scenario highlights how quickly things can change in an emergency and how crucial it is to constantly reassess the patient's condition, even during transport.
Absolutely. You can't just assume that an intervention that worked initially will continue to be effective. You have to stay vigilant and adapt to the changing situation.
All right, are you ready for a scenario that takes us in a totally different direction? One that's a bit more, well, intense.
I think so, yeah. Let's hear it.
You're called to a house where a 22-year-old man has been found hanging in the basement.
Oh, that's tough.
The police and fire department are already on scene, but the caller, his sister, was unable to get him down to start CPR.
Right away, in a situation like this, scene safety becomes paramount. You have to make sure it's safe for you to enter and provide care.
Absolutely. You arrive, and the patient is still hanging, unresponsive, not breathing. His face is purple, cyanosed from lack of oxygen. You can't find a pulse.
Classic signs of asphyxiation. It's a race against time at this point.
A physical assessment reveals cyanosis, an abrasion from the rope around his neck, but no spinal deformity.
No spinal deformity. That's good to know. It might make extrication a bit easier, but time is still of the essence.
His initial vital signs are grim. No heartbeat, no breathing, no blood pressure. The scenario mentions he has a history of depression and a gambling addiction, which just adds a layer of complexity and sadness to this already tragic situation.
It's a reminder that every call you go on, there's a human story behind it.
The scenario then walks us through 5 rhythm analyses from a heart monitor. The first 2 show pulseless electrical activity, or PEA. His heart's not pumping effectively, even though there's some electrical activity.
So it's not a shockable rhythm at this point.
Right. Then we see ventricular fibrillation, or VFib, on the third analysis, which is a life-threatening heart rhythm.
That's where the heart's electrical activity is just completely chaotic. It's essentially quivering instead of beating effectively.
VFib shows up again on the fourth analysis, and then it's back to PCA on the fifth.
So the rhythm is changing, which means we have to constantly reassess and adjust our approach.
Exactly. The scenario emphasizes performing that fifth analysis before attempting defibrillation. And after that fifth analysis, immediate transport is initiated, even though there's no return of spontaneous circulation or ROSC.
In simpler terms, his heart hasn't started beating on its own.
Right. But even without ROSC, continued care during transport is vital.
Absolutely. You never give up hope. There have been cases where people regain circulation on the way to the hospital.
Now, for our final scenario in this part of our deep dive, let's imagine a situation that unfolds like a bit of a medical mystery. You're called to a house where a 55-year-old woman is complaining of severe abdominal pain and palpitations.
Abdominal pain and palpitations. That could be a lot of things.
He says it feels like her heart is racing.
Yeah, palpitations can be really frightening. It's like your heart's suddenly gone rogue.
You arrive and find her sitting on the couch, clearly restless and uncomfortable, sweating a lot. She's alert and talking, but her breathing and pulse are both rapid.
So she's definitely in distress, but it's not immediately clear what's causing it.
Her vital signs are alarming. Her heart rate is an incredibly fast 220 beats per minute.
Whoa, 220. That's seriously high.
Her breathing is rapid at 32 breaths per minute, and her blood pressure is 102/258.
Okay, so the rapid heart rate and the palpitations, combined with that blood pressure, make me think we need to rule out a cardiac event here.
The cardiac monitor shows supraventricular tachycardia, or SVT, which is basically an abnormally fast heart rhythm originating in the upper chambers of the heart.
Yeah, it's like an electrical short circuit in the heart, causing it to beat way too fast. And that can be really dangerous because the heart can't pump blood effectively when it's racing like that.
It sounds incredibly serious.
It can be, yeah. But the good news is she's alert and oriented. Her GCS is 15, which means her brain is still functioning well, despite her heart going crazy.
Her medical history includes hypothyroidism and hyperlipidemia, and she's currently taking levothyroxine and simvastatin.
Okay, so we need to consider whether those medications or her medical history could be contributing to the SVT.
And because of her rapid breathing, the scenario recommends coaching her breathing, encouraging her to take slow, deep breaths, and considering BVM ventilation if her breathing becomes too shallow.
It's like having a backup plan in case things take a turn for the worse.
Unfortunately, that's exactly what happens. At the 10-minute mark, her level of consciousness decreases and she begins vomiting bile, that greenish-yellow fluid.
Oh, that's a bad sign. It could mean that whatever's going on is affecting her liver or gallbladder, or it could be a sign of a serious intestinal blockage.
This sudden decline prompts the first responders to immediately reassess her ABC's airway, breathing, and circulation, and to suction her airway to clear the vomit.
That's crucial to prevent aspiration, which is when vomit gets into the lungs. It can lead to serious complications like pneumonia.
After suctioning her airway, her vital signs show her heart rate is still very high at 220, but now it's beating in a regular rhythm.
That's interesting. The change from an irregular to a regular rhythm could indicate a shift in the underlying cardiac problem. But we need more information to be sure.
Her breathing has slowed down to 12 full breaths per minute. Her blood pressure is up to 800/842, and her GCS has dropped to 124, indicating a significant decrease in her level of consciousness.
That decreased GCS is really concerning. It means we need to expedite transport and consider more aggressive interventions, like advanced airway management.
So as we can see from these first few scenarios, emergency medicine is all about rapid assessment, quick thinking, and a willingness to adapt to ever-changing situations.
And it's not just about the procedures. It's about understanding the human element, recognizing those subtle clues, and advocating for the patient's best interests, even when they can't advocate for themselves.
Well said. Stay tuned for the next part of our deep dive, where we'll explore even more complex and challenging scenarios.
I'm ready when you are. It really is, like trying to solve a puzzle with some of the pieces missing. And the stakes are incredibly high.
Exactly. You have to think fast and make the best decisions with limited information. Like in that last scenario, her heart rate was through the roof, 220 beats per minute.
Yeah, that's incredibly dangerous. The heart can't pump blood effectively when it's beating that fast. And the palpitations, she must have been terrified.
Absolutely. It's like your heart's just going haywire.
Right. And we know she had some underlying medical conditions, hypothyroidism and high cholesterol, and was taking medication for those.
So the first responders have to consider whether those factors could be playing a role.
For sure, it all adds to the complexity of the situation. And then, to make things worse, her condition starts to deteriorate, even with the oxygen.
Her heart rate stays high, her breathing is still labored, and her blood pressure remains elevated.
But the most worrying sign is that her GCS drops to 15.
Right, a drop in GCS means her level of consciousness is decreasing, which is a big red flag. It could mean her brain isn't getting enough oxygen.
Exactly. And then she starts vomiting bile, that greenish-yellow fluid.
Not a good sign.
No, not at all. It could indicate a problem with her liver or gallbladder, or it could even be a sign of a serious intestinal blockage.
So the first responders have to act fast. They reassess her airway, breathing, and circulation, and they suction her airway to clear the vomit.
Absolutely. You want to prevent that vomit from getting into her lungs. Aspiration can lead to all sorts of complications.
And after suctioning her airway, they check her vital signs again.
And what do they find?
Her heart rate is still high at 220, but now it's beating in a regular rhythm. Her breathing has slowed down a bit, her blood pressure has improved slightly, but her GCS has dropped even further to 124.
Wow, that's a significant decrease in her level of consciousness. That's a really worrying sign.
It means she's becoming less responsive, which could indicate a serious problem with her brain function.
Right, it's like her body is shutting down.
So at this point, the first responders know they need to get her to the hospital as quickly as possible. They initiate rapid transport and consider more advanced interventions like intubation to help her breathe.
They're doing everything they can to stabilize her condition and give her the best chance of survival. These scenarios really highlight the importance of staying calm under pressure and thinking critically to make those split-second decisions that can mean the difference between life and death.
Absolutely. It's a testament to the incredible skill and dedication of first responders. Now, let's move on to a case that highlights the importance of thorough assessment and recognizing those subtle clues that can point to a serious underlying condition. Are you ready for this one?
Bring it on.
All right. We're dispatched to a house where a 55-year-old man is complaining of severe pain in his left flank, that area on the side of your body between your ribs and your hip.
Flank pain, huh? That's often associated with kidney problems.
He's also experiencing pain in his lower left abdomen and persistent vomiting.
Vomiting along with flank pain. That could indicate a lot of things. Kidney stones, a urinary tract infection, maybe even something more serious like appendicitis or pancreatitis.
When the first responders arrive, they find him lying in bed, restless and sweating.
So he's clearly uncomfortable. And the sweating suggests his body is working hard to cope with something.
They notice a vomit pail next to the bed filled with bile.
Bile, that's the greenish-yellow fluid that's produced in the liver. Usually helps with digestion. But if someone's vomiting bile, it could mean there's an obstruction in their digestive system.
His breathing is rapid and labored, and his pulse is racing.
Those are all signs that his body is under stress.
During the physical assessment, they find that his breath sounds are clear.
Okay, so that's a good sign. At least his lungs seem to be working okay.
But he has tenderness in the umbilical region, decreased circulation to his feet, and intense pain in his left flank.
Decreased circulation to his feet, that's a bit concerning. It could indicate a problem with his blood vessels, maybe even an aneurysm. We need to rule that out.
His initial vital signs show that his breathing is labored at 24 breaths per minute, his heart rate is elevated at 136 beats per minute, and his blood pressure is 900 to 850.
That blood pressure is a bit low. It could be due to dehydration from the vomiting, or it could be a sign of something more serious.
He tells the first responders that the pain started the day before and has progressively worsened overnight. He says nothing seems to relieve it.
Persistent pain that's unresponsive to typical remedies. That's another red flag.
He describes the pain as sharp, radiating from his left flank towards his umbilicus, and rates it a 10 out of 10.
Wow, a 10 out of 10. That's severe pain. Sounds like something's definitely not right.
So they carefully load him into the ambulance and begin transporting him to the hospital.
And hopefully they're monitoring him closely during transport. Things can change quickly, especially with abdominal pain.
You're right. And unfortunately, that's what happens. As they're en route, he suddenly loses consciousness.
Oh no. That's a major turn for the worse.
They immediately check his pulse and find that he's no longer breathing.
So he's gone into respiratory arrest. They need to start ventilations right away.
They begin bag valve mask ventilations and check his heart rhythm.
What does the monitor show?
The first two rhythm analyses show pulseless electrical activity, or PEA.
PEA. That means there's some electrical activity in the heart, but it's not pumping effectively.
Right. And the next two analyses show asystole, which means there's no electrical activity at all.
Asystole. That's essentially a flat line. It's a very serious situation.
The first responders continue CPR and administer epinephrine, hoping to restart his heart.
They're fighting for his life. Every second counts in a situation like this.
This scenario is a stark reminder that things can change very quickly in emergency medicine, and that even with rapid assessment and intervention, sometimes the outcome isn't what we hope for.
It's a tough reality of the job. But it's also a testament to the incredible resilience and dedication of first responders who face these challenges head-on, always striving to make a difference, even in the most difficult circumstances.
Well said. Now, for our final scenario in this deep dive, we're going to shift gears and explore something a little different. A case that focuses on the importance of communication, empathy, and building trust with patients who might be experiencing a mental health crisis.
Okay, I'm interested to hear this one. Mental health emergencies are becoming increasingly common, and it's essential that first responders are equipped to handle them with compassion and understanding.
Absolutely. So imagine you're dispatched to a call involving a 35-year-old woman who's reportedly acting erratically and making threats to harm herself.
Right away, you know this is a situation that requires a delicate approach.
The caller, a neighbor, says the woman has been pacing back and forth in her apartment, shouting and throwing things.
So she's clearly agitated and distressed.
When you arrive at the scene, you find her sitting on the floor in her living room, surrounded by broken objects.
Okay, so the scene is chaotic and potentially dangerous.
She's crying uncontrollably and talking rapidly. Her thoughts seem disjointed and hard to follow.
It sounds like she's experiencing a severe emotional crisis.
She's wearing a hospital bracelet, which indicates she was recently discharged from a psychiatric facility.
That's important information. It suggests she might have a history of mental illness and could be struggling to cope with her symptoms.
As you approach her, she becomes increasingly agitated and starts yelling at you to leave her alone.
This is where communication and de-escalation techniques become crucial.
Absolutely. The first responders need to establish a rapport with her, speak calmly and reassuringly, and try to gain her trust.
They need to convey that they're there to help, not to judge or harm her.
They also need to be mindful of their own safety and the safety of others, as people in crisis can sometimes be unpredictable.
Right, it's a delicate balance between providing care and ensuring everyone's safety.
The first responders slowly approach her, maintaining a safe distance, and introduce themselves in a calm, non-threatening manner.
They need to avoid any sudden movements or loud noises that could startle her.
They ask her name and try to engage her in conversation, asking open-ended questions to encourage her to express her feelings and thoughts.
It's important to listen actively and validate her emotions, even if her thoughts seem irrational or illogical.
She eventually calms down slightly and tells them that she's been feeling overwhelmed and hopeless since being discharged from the hospital.
It sounds like she's struggling to adjust to life outside the structured environment of a psychiatric facility.
She says she doesn't know where to turn for help and that she feels like a burden to everyone.
Those are common feelings for people struggling with mental illness.
Okay.
It's important to let her know that she's not alone and that there are resources available to support her.
The first responders express empathy and reassure her that they're there to help her get the support she needs.
They might suggest contacting her psychiatrist, a crisis hotline, or a local mental health organization.
They emphasize that seeking help is a sign of strength, not weakness.
Exactly. It takes courage to reach out for help when you're struggling.
They also offer to transport her to the hospital for further evaluation and treatment if she's willing.
It's important to respect her autonomy and give her choices, but also to ensure she receives the care she needs.
She eventually agrees to be transported to the hospital, where she can receive a more comprehensive assessment and develop a plan for her ongoing mental health care.
This scenario highlights the crucial role that first responders play in addressing mental health crises. It's not always about lights and sirens and dramatic interventions. Sometimes it's about listening, empathizing, and connecting people with the resources they need to heal.
Absolutely. It's a reminder that emergency medicine encompasses a wide range of situations, and that the ability to communicate effectively and provide compassionate care is just as important as any technical skill. So as we wrap up this deep dive into emergency scenarios, I want to leave our listeners with a few key takeaways. First, emergency medicine is constantly evolving, with new technologies and treatments emerging all the time. It's an exciting field, but it also demands continuous learning and adaptation. Second, behind every call, there's a human story, a person experiencing a crisis, often in a very vulnerable state. It's essential to approach each situation with empathy, compassion, and a genuine desire to help. And finally, first responders are true heroes. They face unimaginable challenges every day, putting their own lives on the line to protect and care for others. We owe them an immense debt of gratitude for their unwavering dedication and bravery. Thanks for joining us on this deep dive. We'll see you next time. It's amazing to think about how technology is transforming emergency medicine.
It really is.
Yeah.
Like even in the past few years, things have changed so much.
Yeah. It feels like we're on the cusp of a whole new era.
Oh, absolutely. What used to be only possible in a hospital is now becoming available to paramedics right there in the field. It's like having a mini hospital on wheels.
It's incredible. So what are some of the most exciting advancements that you're seeing right now?
Well, portable ultrasound machines have really become game changers. They're so small and lightweight now that paramedics can easily carry them in their kits.
I remember when ultrasounds were those big, bulky machines you only saw in a doctor's office.
Exactly. But now, paramedics can use these portable devices to assess internal injuries, guide 5E placement, even diagnose certain conditions right there on the spot.
So instead of having to wait until the patient gets to the hospital, they can get that critical information right away.
Precisely. It can shave off precious minutes, which could be life-saving in certain situations, especially in trauma cases where time is of the essence.
And it's not just ultrasound, right? There are other point-of-care testing devices that are becoming increasingly common as well.
Oh yeah, absolutely. There are devices that can analyze blood samples for things like blood sugar levels, cardiac enzymes, and other important markers.
So they're getting almost instant feedback on the patient's condition instead of having to wait for lab results from the hospital.
Exactly. It's incredible how technology is bridging that gap between what can be done in the field and what used to be limited to the hospital setting.
It's like having a mini lab right there in the ambulance.
Yeah, it really is. And the beauty of it is that these devices are becoming more and more sophisticated all the time.
So what about the future? What other technological advancements do you think will have a big impact on emergency medicine in the coming years?
Well, artificial intelligence is definitely going to play a huge role.
AI. How so?
Well, imagine AI algorithms that can analyze patient data in real time, helping paramedics predict potential complications or suggest the most effective treatment options.
So AI could basically act as a virtual consultant, providing expert guidance even in the most remote locations.
Exactly. And then there's virtual reality.
VR. How would that be used in emergency medicine?
Well, VR simulations are becoming increasingly sophisticated, offering incredibly realistic training experiences for first responders. Imagine being able to practice responding to a mass casualty incident or a hazardous materials spill in a safe and controlled environment.
So it's like a flight simulator, but for paramedics.
That's a great analogy. It allows them to hone their skills, make decisions under pressure, and receive immediate feedback, all without any risk to real patients.
That's amazing. It sounds like the possibilities are endless.
They really are. And the best part is these technologies are constantly evolving, getting smaller, more affordable, and more powerful.
But it's not all about the technology, right?
Oh, no, definitely not. At the end of the day, it's still about people. The human element is always going to be at the heart of emergency medicine.
So what are some of the challenges of integrating these new technologies into the field?
Well, one of the biggest challenges is ensuring that these technologies are accessible to everyone, regardless of where they live or their socioeconomic status. We don't want to create a healthcare system where only certain people have access to the most advanced care.
That's a really important point. Technology should be a tool to level the playing field, not exacerbate existing disparities.
Exactly. And another challenge is the need for ongoing training and education. It's not enough to just buy a new device. Paramedics and EMTs need to be properly trained on how to use it effectively and interpret the results accurately.
So it's like having a fancy new smartphone, but not knowing how to access all the cool features.
Right. And with the increasing complexity of medical devices and software, that learning curve can be pretty steep. Continuous professional development is going to be essential to ensure that first responders feel confident and competent using these new tools.
It sounds like the future of emergency medicine is a really fascinating blend of cutting-edge technology and good old-fashioned human expertise.
You said it. It's not just about the machines. It's about the people using them.
Well, I think that's a great place to wrap up this deep dive. We've covered a lot of ground today, from the initial assessment to the latest advancements in technology. But most importantly, I think we've gained a deeper appreciation for the incredible work that first responders do every day, putting their lives on the line to protect and care for others.
I couldn't agree more. It's been a privilege to explore these scenarios with you and to really delve into the complexities and challenges of this demanding but incredibly rewarding profession.
So to all the first responders out there, thank you for everything you do. Your courage, compassion, and unwavering dedication are an inspiration to us all. And to our listeners, thanks for joining us on this deep dive into the world of emergency medicine. We hope you found it informative and engaging. Until next time, stay safe and stay curious. Okay, so you handed us these medical scenarios.
Yeah.
And
Oh, yeah.
let me tell you,
They're intense.
they're intense. It's like a crash course in emergency medicine, but like for real, you know?
Right.
We're talking about the kind of situations EMTs face every single day.
Every day, yeah.
And some of these details, I gotta say, they're pretty intense.
It's fascinating to me how much detail they provide in these scenarios.
Right.
You get like not just the medical emergency itself,
Right.
like the whole process
Yeah.
of assessment, vital signs, the patient's history.
You get the whole picture.
Yeah, it's wild.
Yeah. And that's what we're here to do today.
Yeah.
You're gonna kind of unpack these scenarios,
Yeah.
pull out those little nuggets of insight
That gets
that might not be obvious at first glance if
Yeah.
you were just, reading through them.
right.
So think of it kind of like we're shadowing an experienced EMT
Yeah,
and we're learning the ropes right alongside them.
absolutely. And we'll be looking for, those things that stand out. What's surprising.
Yeah, what can we learn from this?
Yeah.
Even if we ourselves are not medical professionals.
Right.
So
Exactly.
let's just jump right in
Okay.
with scenario number 6.
Right.
This one starts with a potential suicide.
Okay.
22-year-old male found hanging in a basement.
Oh, wow.
Code 4 dispatch.
Right away.
That's serious.
Yeah.
Right off the bat.
Absolutely.
And then the details get even more intense.
Yeah. They talk about cyanosis in this one,
Yeah.
which is that bluish discoloration of the skin,
Oh.
especially like around the lips and the face.
Okay.
That's actually a really key indicator in hanging scenarios.
Now, why is that?
Well, it's all about the lack of oxygen in the blood.
Okay.
So in a hanging, it develops because the airway is constricted
Right.
and blood flow to the head is compromised.
Mm-hmm.
And actually, the extent of the cyanosis can give EMTs some idea of how long the person's been hanging.
Oh, so it's not just about the presence of cyanosis. It's also about the degree of it.
Exactly. It's like a little
Correct.
subtle clue.
I wouldn't have thought of that.
Yeah.
That's interesting.
Uh-huh.
Speaking of clues, the scene in this scenario
Okay.
is described as a typical residential basement.
Right.
Patient is found near a chair, unresponsive, no pulse.
Okay.
His sister, who found him, said she couldn't get him down to start CPR,
Right.
and there's no indication of how long he's been there.
Oh, wow. So that unknown time frame adds a whole other layer of...
Yeah, it's like a race against time.
Right.
But you don't even know when the clock started.
Exactly. And then you layer on his history.
Right?
Gambling addiction, depression,
Yeah.
recently started new antidepressants.
Wow.
His sister even mentions that he had talked about suicide with a friend recently.
So you've got this intense medical emergency,
Yeah.
but then there's this whole human element to it as well.
Absolutely.
Makes you realize how much EMTs are really dealing with,
Yeah.
not just physically, but emotionally too.
For sure, they're having to process all this information,
Right.
make these critical decisions,
Yeah.
and still provide compassionate care.
And still, do their job.
Yeah.
So in this case, the scenario says the patient is asystole,
Okay.
which means no electrical activity in the heart
Right.
for 3 analyses.
Oh, wow.
And it goes on to say that termination of resuscitation, or TOR, is granted if called for.
Mm-hmm.
That's got to be one of the toughest calls
It is.
an EMT ever has to make.
Yeah. And it really highlights, the gravity
Yeah.
of these situations,
Yeah.
where sometimes, despite everyone's best efforts,
Right.
it's just not possible to save a life.
All right, let's shift gears now to something a little different.
Right.
Scenario number 1.
All right.
Picture this. You're watching the finale of The Bachelor,
Okay.
totally engrossed in the drama,
Right.
and suddenly you start experiencing chest tightness.
Oh, no.
That's what's happening to our 72-year-old female patient in this scenario. Code 4 dispatch again.
So right away, serious.
It's serious
Yeah.
right from the get-go.
Mm-hmm.
And it's just a great illustration, I think,
Yeah.
of how medical emergencies
They can happen
can strike anyone, anywhere,
anywhere, yeah.
even during like the most mundane activities.
Especially, it's almost ironic, you
Yeah.
know?
And that contrast,
Like watching The Bachelor.
right, between like the lightheartedness of The Bachelor
Yeah.
and the seriousness of a potential cardiac event,
Totally.
it's pretty striking.
Yeah, it's very striking.
So when EMS arrives,
Okay.
they find her on the couch,
Right.
alert,
Mm-hmm.
but uncomfortable.
Okay.
Her skin is pale, cool, and clammy.
Those are all classic signs
Yeah,
of decreased blood flow,
right,
which could indicate like a heart attack.
right. So
Easily.
she describes the pain as mild chest tightness
Okay.
with some nausea.
Hmm.
And her medical history includes episodes of chest tightness in the past. And she's currently taking several medications,
All right.
including nitroglycerin,
Nitroglycerin or nitro?
or nitro for short.
Yeah.
So the fact that she's already on nitro,
Yeah, that suggests a history
what does that tell us?
of heart problems,
Okay,
likely angina,
okay.
which is really vital information for the EMTs
Yeah,
because it helps them understand the potential severity
yeah,
of what they're seeing
Yeah.
right then and there.
okay.
So really important.
So she says the pain came on suddenly
Okay.
while watching TV.
While watching The Bachelor.
While watching The Bachelor, yeah.
Yeah.
She took some nitro, which made it better,
Okay.
but didn't completely relieve it.
So that's a common presentation for
Right.
angina.
All right.
The nitro helps dilate the blood vessels
Right.
and improve blood flow to the heart muscle.
Okay.
So it makes sense.
So her initial vitals show an elevated heart rate,
Okay.
full and regular respirations,
Good.
and slightly elevated blood pressure. After another dose of nitro,
Right.
her heart rate and blood pressure come down,
Okay, good.
and she says the pain is gone.
So it seems like the nitro is doing its job,
So far, so good.
at least for now.
But the scenario really emphasizes that.
Yeah.
Even though the pain has subsided,
Uh-huh.
it's crucial to continue monitoring her closely
Absolutely.
and outline some expected actions for the EMTs.
Okay.
Things like obtaining a 12-lead EKG,
Right.
administering aspirin,
Mhm.
and expediting transport to the hospital.
So those are all standard procedures for suspected cardiac events.
Right.
The 12-lead EKG will help determine if there's any damage to the heart muscle,
Okay.
and the aspirin can help prevent further clotting.
So it's not just about treating those immediate symptoms, it's
Mhm.
also about taking steps
That's about thinking ahead.
to prevent further complications.
Yeah.
All right, let's go from a reality TV medical drama
Okay.
to a holiday mishap.
All right.
Scenario number 8 takes us to Christmas time. 67-year-old male is putting up Christmas lights,
Oh, no.
takes a tumble from a 10-foot ladder,
Ooh.
and lands head first on the concrete.
That's,
Good.
here's where it gets interesting.
Okay.
Initially, he was unresponsive.
Okay.
Then he regained consciousness
Oh.
and then became unresponsive again.
That fluctuating level of consciousness is
Yeah.
a major red flag.
What does that tell us?
It suggests a possible concussion
Okay.
or even a brain bleed.
Oh, wow.
Yeah.
So when EMS arrives,
Okay.
they find him conscious and alert,
Okay.
which seems like a good sign, right?
Right.
But his skin is pale, cool, and clammy.
That could indicate shock,
Okay.
which can be a complication of internal bleeding.
Right.
Which means the body's not getting enough blood flow to the vital organs.
Oh, wow.
Yeah.
Okay, so he's got a hematoma on his forehead,
Okay.
blood on his lip, pain when his head is palpating,
Mm-hmm.
and a deformed and tender left wrist.
So those are
A
all
lot going on.
significant findings. Yeah.
The hematoma and the blood suggest a head injury.
Right.
The wrist deformity points to a possible fracture,
Okay.
and the tenderness on palpation could indicate some internal injuries as well.
Right. So his medical history is
Right.
pretty significant.
Right.
He takes warfarin, which is a blood thinner,
Okay.
and has a history of TIA,
TI.
or transient ischemic attack,
Okay.
hypertension, and high cholesterol.
There's a lot to consider.
A lot to consider.
Yeah.
The warfarin increases the risk of bleeding,
Right.
which is particularly worrisome
Especially with a head injury.
with a suspected head injury.
Yeah.
And his history of TIA suggests
Okay.
previous problems with blood flow to the brain.
Oh, wow.
So yeah,
Okay.
a lot going on.
His initial vitals show an elevated heart rate,
Okay.
full respirations,
Mm-hmm.
and elevated blood pressure.
Okay.
But then at the 7-minute mark,
Right.
he becomes unresponsive again
Oh.
and exhibits something called decorticate posturing.
Now, what exactly does that mean?
So decorticate posturing is an involuntary movement
Okay.
where the arms are flexed and held close to the body,
Okay.
while the legs are extended and internally rotated,
Okay.
and it's a sign of damage to the nerve pathways
Oh, wow.
between the brain and the spinal cord.
So it's a neurological sign
It is.
that indicates a serious problem.
Absolutely.
And the fact that it appeared after a period of consciousness
Right.
suggests a worsening condition.
Yeah, things are going downhill.
Okay.
Yeah.
So his vitals are rechecked,
Okay.
and now his heart rate is irregular and weak.
Right.
His blood pressure is even higher.
Uh-oh.
His respirations are rapid and irregular,
Okay.
and his pupils are unequal
Oh.
and react differently to light.
So all of those changes point towards a serious brain injury.
Okay.
The irregular heart rate and breathing,
Right.
the elevated blood pressure,
Yeah.
the unequal pupils,
Yeah.
all signs of increased pressure inside the skull,
Oh, wow.
which can be life-threatening.
And the scenario lists a whole bunch of actions for EMTs
Right.
in this situation.
Yeah.
Things like immobilizing his spine,
Yep.
assessing his injuries,
Mm-hmm.
and getting him to the hospital as quickly and safely as possible.
It's a classic example
Yeah.
of a multi-system trauma case
Right.
where time is of the essence.
Yeah.
So the EMTs have to act quickly
Yeah.
and decisively
Absolutely.
to stabilize the patient
Right.
and minimize further damage.
Yeah, it really drives home the point that
Yeah.
even seemingly simple accidents like falling off a ladder
Right.
can have devastating consequences.
They can.
You know? Absolutely.
And it highlights the importance of
Yeah.
taking precautions,
Like wearing a helmet
like wearing a helmet. Yeah.
when working at heights
Right.
and making sure your ladders are properly secured.
Yeah, those little things can make a big difference.
They can?
Now let's move from a dramatic fall
Okay.
to a situation that might feel a little more familiar.
Right. Scenario number 7 takes us to an assisted living facility
Okay.
where a 62-year-old female resident
Mm-hmm.
is experiencing shortness of breath.
Shortness of breath can have many causes,
Right.
ranging from relatively benign to life-threatening.
Yeah.
It's a common complaint, especially in older adults,
Right.
but it always warrants careful assessment.
It's another code 4 dispatch.
Okay.
So clearly something is seriously wrong.
Yeah.
When EMS arrives, they find her in respiratory distress.
Okay.
Diaphoretic, meaning sweating heavily,
Mm-hmm.
and sitting in a tripod position.
Oh, the tripod position is a classic sign.
Yeah.
Respiratory distress.
What is it about that position?
Well, it's a way for the patient to use their accessory muscles
Okay.
to help them breathe.
Help them breathe. Okay.
Yeah.
So she's alert.
Okay.
Her airway is clear,
Good.
but her breathing is labored,
Okay.
and she has a bounding pulse.
Right.
Her skin is pale, cool, and clammy.
Mm-hmm.
And when they listen to her lungs, they hear crackles in all fields.
So crackles, also known as rails,
Okay.
are those clicking or rattling sounds that you hear
Yeah.
when there's fluid in the lungs.
Okay.
So this, along with her other symptoms,
Yeah.
suggests a problem with her heart or lungs.
Okay. So it could be a lot of things.
It could be.
Yeah. She's trying to speak,
Okay.
but she can only get out 1 or 2 words at a time because of her difficulty breathing.
Mm-hmm.
She shakes her head no when asked about chest pain.
Okay.
She's anxious
Mm.
and vomits twice.
Oh.
And the vomit contains frothy sputum.
So frothy sputum,
Yeah.
especially in someone with these other symptoms,
Yeah.
can be a sign of pulmonary edema,
Okay.
which is a buildup of fluid in the lungs.
Right.
This can be caused by heart failure where the heart isn't pumping effectively,
Oh, wow.
or by other conditions that affect the lungs' ability to exchange oxygen.
Right.
So
Okay.
lots of possibility.
Her initial vitals show a bounding and irregular heart rate, labored and irregular respirations, and elevated blood pressure.
All right.
Her second and third set of vitals show her heart rate and respirations continuing to increase, with her blood pressure remaining high.
So it sounds like her condition is deteriorating.
Yeah.
The increasing heart and respiratory rates,
Yeah.
along with the persistent high blood pressure,
Mm-hmm.
suggest that her body is working harder and harder to compensate.
Right. They get a 12-lead EKG
Goody
to
good.
try to figure out what's going on.
Yeah, the 12 lead will be crucial in determining if
Okay.
she's having a heart attack
That-
or if something else is causing her symptoms.
Her medical history includes several medications
Mhm.
and a history of a myocardial infarction or heart attack in the past.
Oh, wow.
She also has hypertension, hyperlipidemia, and GERD.
That history definitely increases the likelihood
Okay.
of this being a cardiac event.
Right.
Her previous heart attack, combined with her current symptoms and vital signs, Makes this a very concerning situation.
Yeah. So the scenario mentions several actions that the EMTs take, including getting the 12-lead EKG before giving her nitro,
Right.
noting that she won't cooperate with a bag valve mask,
No.
holding off on CPAP because she's actively vomiting,
Right.
and giving her Gravel for the nausea and vomiting.
So it sounds like they're making some smart decisions
Okay.
based on her presentation.
Yeah.
Holding off on CPAP is really important
Yeah.
because forcing air into the lungs when someone is vomiting
Right.
increases the risk of aspiration,
Right.
which can be life-threatening.
Yeah.
And controlling the nausea and vomiting
Right.
will not only make her more comfortable,
Right.
but it could also help improve her breathing.
Yeah. So it's not just about following like a set protocol.
Exactly.
It's also about adapting
It's about-
to the individual patient's needs.
Using your knowledge
Right.
and your judgment
And circumstance.
to make the best possible decisions
Yeah.
for each patient.
Absolutely. And speaking of judgment,
Yes.
remember that motorcycle accident we talked about earlier?
The one with the 30-year-old male?
Yeah, the one with the 30-year-old male who got hit by a truck.
Oh, yeah.
Well, we're going to revisit that scenario now.
All right.
But this time,
Right.
we're going to focus on the actions of the EMTs,
Okay.
both the good and the bad.
Interesting.
This part of the scenario is almost like a training exercise.
I think it's fascinating
Yeah.
because it shows how even in a high-pressure situation like that,
Right.
there's still so much room for human error.
Right.
And learning from those errors
Yeah.
is such a crucial part
Yeah.
of becoming a better EMT.
So to recap, the scene is a motorcycle accident.
Okay.
He was wearing a helmet, thankfully.
Okay.
And his motorcycle is off to the side.
Okay.
He's lying on his back,
All right.
but his lower body is contorted.
So that contorted lower body immediately
Yeah.
raises concerns about a pelvic injury,
Okay.
which can be very serious
Right.
and often involves significant blood loss.
So he's alert.
Correct.
His airway is clear, and his
Sounds like-
breathing is only slightly labored.
Okay.
His skin is pale, cool, and clammy. But once they remove his helmet,
Yeah.
they don't see any scratches on his head.
Okay.
They find a palpable pulse in his right foot,
Right.
but the pulse in his left foot is thready.
So that difference in pulses between the feet is a red flag.
Yeah. What does that tell us?
It suggests a potential circulatory issue
Okay.
in the left leg,
Okay.
possibly due to a fracture or a vascular injury.
Oh, wow.
Yeah.
So his initial vitals show a thready but regular heart rate,
Okay.
shallow and slightly labored respirations,
Mm.
and slightly elevated blood pressure.
Okay.
He tells the EMTs that he switched lanes
All right.
and was sideswiped by a truck.
So getting that history is really important,
Yeah.
even if it's brief.
Right.
It helps the EMTs understand the mechanism of injury,
Okay.
which can give them clues about what to look for.
Right. Further assessment reveals an unstable pelvis
Okay.
and diminished or absent circulation distally in his left leg.
So an unstable pelvic fracture can be life-threatening
Right.
because of the potential for massive internal bleeding.
Wow.
And then the diminished circulation
Yeah.
confirms those concerns raised by the unequal foot pulses.
Right.
So this situation is evolving rapidly,
Yeah.
and every second counts.
At the 9-minute mark,
Oh.
he loses consciousness and
Yeah.
doesn't wake up.
Oh, no.
His heart rate drops significantly,
Okay.
though it's still thready and regular.
All right.
Now, this is where the scenario gets really interesting.
Okay.
It starts listing both positive actions
Yeah.
taken by the EMTs,
All right.
like activating the appropriate trauma code,
Okay.
managing his airway, analyzing his heart rhythm,
Right.
and preparing for defibrillation.
Okay.
And then it lists negative actions, like
Yeah.
giving an inappropriate directive,
Yeah.
improper airway management,
Yeah.
not confirming the effectiveness of the bag valve mask ventilation, missing a shockable rhythm,
Oh, wow.
not analyzing or shocking when needed,
Yeah.
and not rolling him to clear his airway.
It's like they're putting them side by side,
It is.
you know, the good and the bad.
It's like a side-by-side comparison
Yeah.
of what to do and what not to do.
I think it's a really powerful way
Yeah.
to illustrate the impact
Right.
of both good and bad decision-making
Right.
in a critical situation.
Yeah.
You know, missing a shockable rhythm or failing to manage the airway effectively
Right.
can have devastating consequences.
It's a sobering reminder that even experienced EMTs
Absolutely.
can make mistakes,
Yeah.
especially under pressure.
Especially under pressure.
And that's why
Yeah.
ongoing training
And simulation.
and simulation exercises are so important.
Yeah, it allows them to
Right.
practice their skills
Yeah.
and decision-making abilities
Yeah.
in a controlled environment.
Right.
where mistakes don't have real-life consequences.
And speaking of mistakes,
Yeah.
the scenario also lists
Yeah.
some anticipated errors.
Okay.
Things like delaying oxygen administration,
Mm.
not recognizing a potential intracranial hemorrhage,
Right.
not managing the airway and ventilations properly
Yeah.
once the patient's vital signs have dropped,
Yeah.
and not recognizing the return of spontaneous circulation, or ROSC,
ROSC.
at the third analysis. It's almost like
I think it's because they represent common pitfalls
they're trying to anticipate where students might trip up.
that students and even some experienced EMTs can fall into. Yeah. Delaying oxygen administration can worsen hypoxia,
Right,
which can lead to brain damage or even death.
right.
Failing to recognize an intracranial hemorrhage
Yeah,
could mean missing a critical intervention,
yeah,
such as surgery,
right.
to relieve pressure on the brain.
Okay.
Improper airway management in a critically ill patient can lead to respiratory arrest.
Right.
And not recognizing ROSC could result in unnecessary
Mm-hmm.
and potentially harmful
Yeah.
continued CPR.
So it's like they're giving us a glimpse into the
Yeah.
thought process
Absolutely.
of an experienced EMT.
It is.
Right.
It's about developing that clinical intuition,
Right.
the ability to see beyond the surface,
Right.
and anticipate those potential problems
Yeah.
before they arise.
So if we kind of step back and look at these scenarios as a whole,
Mm-hmm.
what are the key takeaways for you?
I think the most important takeaway is the importance of preparedness.
Okay.
You know, these scenarios really show us
Yeah.
that medical emergencies can happen anywhere,
Anywhere.
at any time,
At any time.
and to anyone.
To anyone, exactly.
They really highlight the need for quick thinking,
Right.
accurate assessment,
Right.
and decisive action.
Yeah. But I also think they show how much more there is
Absolutely.
to emergency medicine
Yeah.
than just knowing
It's about
the procedures and protocols.
having a deep understanding of the anatomy,
Right.
physiology,
Right.
pathophysiology,
Yeah.
knowing not just what to do,
Yeah.
but why you're doing it.
Exactly. It's about critical thinking,
It's about
problem solving
adapting
to the unique
everything-
circumstances of each.
circumstances of each situation. Yeah.
And let's not forget
Yeah.
the human element
Yes. That's so important.
of emergency medicine.
It's about compassion,
Right.
empathy,
Yeah.
and the ability to connect with patients and their families
Right.
during their most vulnerable moments.
Absolutely.
It's about providing not only medical care,
Mm-hmm.
but also emotional support
Right.
and reassurance.
These scenarios have given us a glimpse
Yeah,
into the world of emergency medicine,
for sure.
but they've also made me think about the role of bystanders
Yeah,
in these situations.
absolutely.
You know, we've talked a lot about what EMTs do, but what about the people who witness these events?
Yeah,
What can they do to help?
that's a great question.
You know?
Bystanders can actually play a crucial role
Okay.
in the chain of survival.
Right.
Even seemingly small actions like calling 911 immediately,
Right.
providing basic first aid if they're trained,
Right.
or simply comforting the patient and offering reassurance
Mm.
can make a huge difference.
Yeah, it's like we're all part of a larger system of care.
Right.
And even if we're not medical professionals, we can still
Contribute.
to a positive outcome.
Absolutely.
You know, it's empowering to think that we all have the potential
We do.
to make a difference
Yeah.
in an emergency.
Absolutely. And that's something
Yeah.
we should all strive for,
Right.
to be prepared, to
Yeah.
be aware,
Mm-hmm.
and to be willing to step up and help when needed.
So to our listeners out there,
Sure.
think about this.
Okay.
What would you do if you were faced with one of these situations?
That's a great question.
It's a question worth pondering
It is.
because a little knowledge
For sure.
and preparedness
Yeah,
can go a long way.
it really can.
Right, so we're going to take a quick break.
Okay.
And when we come back, we'll continue our exploration
More scenarios.
of these emergency medical scenarios.
I'm ready.
Okay, we're back
All right.
and ready to dive back into these scenarios.
Let's do it.
We've tackled a potential suicide.
Yep.
A heart attack during the Bachelor finale.
Mm-hmm.
A Christmas lights mishap.
Yeah.
And a shortness of breath call at an assisted living facility.
Quite a range of situations.
Yeah.
Each with its own unique challenges and learning points.
And now we're circling back to that motorcycle accident,
Okay.
scenario number 8.
All right.
But this time,
Yeah.
we're going to focus on the actions taken by the EMTs,
Oh.
specifically
Yeah.
the positive and negative actions. along with those anticipated errors that we mentioned.
Interesting.
So this is where we get to see the application of knowledge and skills
Right.
in real time.
It's like watching a high-stakes surgery
It is.
where every move matters.
Yeah. And just like in surgery,
Right.
there are right moves
Yes.
and wrong moves.
And wrong moves.
So let's start with the positives.
Okay.
The scenario mentions appropriate code activation,
Good.
airway management,
Mm-hmm.
rhythm analysis,
Right.
defibrillation,
Okay.
and safe movement of the patient.
Those are the cornerstones of effective emergency medical care.
Yeah.
Proper code activation ensures a coordinated and timely response from the entire medical team.
Right.
Airway management is absolutely critical
Yeah.
in maintaining oxygen flow to the brain and vital organs.
Right.
Rhythm analysis and defibrillation are crucial
Yeah.
for addressing life-threatening heart arrhythmias
Right.
and safe movement of the patient. Helps prevent further injury,
Right.
especially in trauma cases like this one.
Yeah, it's like a symphony of
Yes.
actions,
Yeah.
all playing a crucial role
A symphony of
in
actions.
the overall performance.
I like that.
But
But-
as we all know,
Right.
even the best orchestras can have off nights.
They can.
And so the scenario also lists several negative actions.
Good.
Things like giving an inappropriate directive,
Right.
improper airway management,
Uh-huh.
failing to confirm the effectiveness of the bag valve mask ventilation,
Right.
missing a shockable rhythm,
Okay.
not analyzing or shocking when necessary,
Yeah.
and not rolling the patient to clear the airway.
Those are all serious errors
Yeah.
that could significantly impact the patient's chances of survival.
Right.
An inappropriate directive can lead to confusion and delays in treatment. Improper airway management could compromise breathing,
Right.
leading to hypoxia,
Okay.
missing a shockable rhythm,
Yeah.
or failing to defibrillate promptly. Could mean the difference between life and death.
It's a stark reminder that even seemingly small oversights can have devastating consequences
Yeah,
in these time-sensitive situations.
for sure.
It really underscores the need for
Yes.
meticulous attention to detail
Absolutely.
and strict adherence to protocols.
And that's why simulation training is so invaluable for EMTs.
Right.
It allows them to practice their skills
Right.
and decision-making abilities in a controlled environment
Right.
where mistakes don't have real-life consequences.
Speaking of mistakes,
Yes.
the scenario also highlighted some anticipated errors
Okay.
that students might make,
Right.
like delaying oxygen administration,
Yeah.
not identifying a potential intracranial hemorrhage,
Right.
failing to manage the airway and ventilations properly
Okay.
once the patient is in a critically compromised state,
Right.
and not recognizing the return of spontaneous circulation,
ROC.
or ROSC,
Uh-huh.
at the third analysis.
Yeah. Why do you think they highlight these particular errors?
Yeah, it's like they're
I think it's
easy
because
to anticipate.
they represent those common pitfalls
Yeah,
that students and even some experienced EMTs
right,
can fall into.
right,
Delaying oxygen administration
right,
can worsen hypoxia,
right,
which can lead to brain damage or even death.
right.
Failing to recognize an intracranial hemorrhage
Yeah,
could mean missing a critical intervention,
right,
like surgery to relieve pressure on the brain,
right.
improper airway management in a critically ill patient
Mhm.
can lead to respiratory arrest.
Okay,
And not recognizing ROSC could result in unnecessary
right.
and potentially harmful continued CPR.
It's like they're giving us a glimpse
It is.
into the thought process
Yeah.
of an experienced EMT.
Absolutely.
Right.
It's about developing that clinical intuition,
Yeah.
that ability to see beyond the surface
Right.
and anticipate those potential problems
Right.
before they arise.
Right. So if we step back and look at these scenarios as a whole,
Yeah.
what are the key takeaways for you?
I think the most important takeaway is the importance of preparedness.
Yeah.
These scenarios show us that medical emergencies can happen anywhere,
Anywhere.
at any time,
At any time.
and to anyone.
Right.
They highlight the need for quick thinking,
Yeah.
accurate assessment,
Yeah.
and decisive action.
But I also think they show how much more there is to emergency medicine
Absolutely.
than just knowing the procedures and protocols.
Right. It's about having a deep understanding of
Right.
the anatomy,
Yeah.
physiology,
Yeah.
pathophysiology,
Yeah.
knowing not just what to do,
Right.
but why you're doing it.
Exactly. It's about
Also thinking,
critical thinking,
problem solving,
problem solving,
adapting to the unique circumstances
adapting. Yeah.
of each situation.
each situation.
And let's not forget the human element
Mhm.
of emergency medicine.
Yes, that's so important.
You know,
It's about compassion. Right.
empathy,
Right.
and the ability to connect with patients and their families
Yeah,
during their most vulnerable moments.
absolutely.
It's about providing not only medical care,
Right.
but also emotional support and reassurance.
These scenarios have given us a glimpse into the world of emergency medicine,
For sure.
but they've also made me think about the role of bystanders
Yeah,
in these situations.
absolutely. We've talked a lot about what EMTs do.
Right, but what about the people who witness these events? What can they do to help?
That's a great question.
Yeah.
Bystanders can actually play a really crucial role in the chain of survival.
Okay.
Even seemingly small actions,
Mm-hmm.
like calling 911 immediately,
Right.
providing basic first aid if they're trained,
Right.
or simply comforting the patient and offering reassurance,
Yeah.
can make a huge difference.
It's like we're all part of this larger system of care.
We are.
Even if we're not medical professionals,
Right.
we can still contribute to a positive outcome.
Absolutely, and I think that's something we should all strive for.
Yeah.
To be prepared,
To be prepared,
to be aware,
to be aware.
and to be willing to step up and help when needed.
So to our listeners out there, think about this. What would you do if you were faced with one of these situations?
That's a great question to think about.
It is. It's a question worth pondering.
It is.
A little knowledge and preparedness can go a long way.
It really can.
And on that note, I think we'll wrap up this deep dive.
Okay.
We've covered a lot of ground today,
We have
from the nitty-gritty details
to make
of emergency medical scenarios
Yes.
to the broader themes of preparedness, resilience, and the importance of continuous learning.
It's been a fascinating journey,
It has.
and I hope our listeners have come away with a deeper appreciation for the incredible work that EMTs do every day.
Absolutely. And remember, a little knowledge and preparedness can go a long way.
It really can.
Stay safe out there, and we'll catch you on the next deep dive.
All right, so we've got some pretty intense medical emergencies covered in this deep dive,
Yeah.
and we'll try to break them down, see if we can figure out what's really going on.
Yeah.
You know, we've got hangings, falls, someone punched through a glass window.
Sounds pretty intense.
Yeah. You know, we're going to take a close look at what's happening in each of these situations and what it means medically.
I'm ready.
Okay, great. So let's just jump right into it with scenario 4.
All right.
This one involves a 22-year-old male who was found hanging in his basement by his sister.
Oh.
She was unable to cut him down or start CPR,
Oh, my.
and emergency services were called to the scene.
Got it.
It's unclear how long he'd been hanging before she found him.
Hanging cases, they're always so time sensitive.
I can't even imagine what his sister must have been going through.
No, absolutely not.
So they find him unresponsive with blue lips and face. That's called cyanosis, right?
Yeah, cyanosis, it's a sign that there's not enough oxygen getting to the tissues.
He also has an abrasion on his neck from the rope.
Oh, geez.
No pulse, no breathing, and his pupils are fixed and dilated.
Okay, so those are all really serious signs.
And it gets even more complicated because this young man had a history of depression and a gambling addiction.
Oh, wow.
He had recently started taking antidepressants.
So that adds another layer to think about, right?
It does.
His mental state, his history,
Exactly.
could
Yeah.
play a role in what happened.
Now, the medical analysis in this case gets pretty interesting.
Okay.
Initially, they got a reading of VFib, which stands for ventricular fibrillation.
VFib, that's when the heart's just quivering. It's not beating effectively.
And that means that blood's not being pumped properly to the brain and other organs.
Exactly. Really life-threatening situation.
So they tried to shock him back into a normal rhythm.
Right. Defibrillation, that's the standard procedure.
But then they get a reading of PEA, pulseless electrical activity.
Okay.
I have to admit, I'm not really familiar with that term.
Yeah, PEA, it's kind of a weird one.
What does it mean?
Well, the heart's electrical system is still working. We see it on the monitor,
Okay.
but it's not actually pumping any blood.
So even though there's electrical activity,
It's not doing its job.
it's not actually pumping blood.
Yeah, think of it like a car engine revving, but the wheels aren't turning.
Wow, that's a really good analogy.
So, yeah, in this case, with everything else going on, the chances of survival are much lower.
Right, I can see how that would be a real... Absolutely, we got to think about head injuries, spinal trauma, all that.
Right, you never know what you're dealing with.
But here's where things get a little strange.
Okay.
His skin is described as cherry red and dry.
Cherry red, huh? That's a pretty specific detail.
It is.
And he has no pulse, no breathing, and his pupils aren't reacting to light.
Now that cherry red skin, that's a big clue, right?
It could be a sign of carbon monoxide poisoning.
Oh, wow.
Yeah, if he was working in the garage, maybe he left the car running or some equipment on.
So the fall itself may not have been fatal, but the carbon monoxide could have been what, ultimately?
It's a possibility.
It's a silent killer, huh?
That's right. Colorless, odorless, you don't even know it's there.
And to add to the tragedy, we learn this man also had a history of depression.
It's so sad.
His wife had left him a few months ago, and things had been getting worse for him.
It really makes you think, we never know what people are going through.
You're right. We should all try to be a little kinder, a little more understanding.
Couldn't agree more.
So the medical analysis on this one throws us a curveball right from the start.
Okay, I'm intrigued.
They get a reading of VTAC, ventricular tachycardia.
VTAC, that's when the heart's beating way too fast.
And that's bad because...
It can cause the blood pressure to drop.
Oh!
And in severe cases, yeah, it can be fatal.
So they shocked him to try and slow down that rapid heartbeat.
Right. The goal is to get the heart back to a normal rhythm.
And they were able to achieve ROSC, which stands for Return of Spontaneous Circulation.
ROSC. That means his heart started beating on its own again.
This got to be good news, right?
It's definitely what you want to see,
Okay.
but it's not always a guarantee of a good outcome.
Oh.
It just means the heart's beating,
Okay.
but there might still be some serious underlying issues.
And it seems like that was the case here.
What happened?
He had an irregular and weak pulse. His pupils were dilated and sluggish, and they noted sinus bradycardia with PVCs.
PVCs, those are premature ventricular contractions.
Right, extra abnormal heartbeats.
So even though the heart was beating, it wasn't functioning properly.
This next case, scenario 6, feels a bit like a repeat of our first one.
Okay, another hanging.
Yeah, we have another 22-year-old male who was found hanging in his basement,
Oh no, not again.
this time discovered by his sister.
Wow. These situations, they're more common than we think.
It's really sad.
It is.
And just like before, she couldn't get him down or start CPR.
Oh my goodness.
The findings are almost identical to the first case. Unresponsive blue discoloration on the lips and face, the abrasion on the neck, no pulse, no breathing, and fixed and dilated pupils.
It's like a terrible echo.
This young man also had a history of gambling addiction and depression and had recently started taking antidepressants.
It really makes you wonder about what leads to these situations.
It's heartbreaking.
It is.
And the medical analysis follows a similar path as well.
Really?
Initially, they find VFib,
Okay.
so they try to shock him back into a normal rhythm.
Hopefully they were able to get to him quicker this time.
You'd think so, but then they get PEA, just like in the first hanging case.
That's interesting.
Followed by refractory VFib.
Yeah.
It's like an unfortunate pattern repeating itself.
It really does make you think about the importance of understanding these conditions and how we can prevent them.
Yeah, absolutely.
But I'm curious, what makes this scenario different from the first hanging?
Well, the report specifically states that CPR couldn't be initiated.
Why that?
I'm guessing because he was still suspended.
Ah, that makes sense.
It's not possible to perform CPR effectively or even safely until someone's brought down.
Right, safety first.
But I can only imagine this sister's desperation, seeing him like that and being unable to help.
It's got to be incredibly traumatic for anyone who witnesses something like that.
Okay, now this next case, scenario 8, takes us in a completely different direction.
Okay, tell me more.
This time, we have an 18-year-old male who punched through a plate glass window at a bus terminal.
Punch through a window? That sounds like a recipe for serious injuries.
He was under the influence of alcohol at the time.
Alcohol and trauma, never a good mix.
No, not at all.
What kind of shape was he in?
Well, he was bleeding profusely from his arm, which is obviously a major concern.
No, that's not good.
They noted that he was pale, which makes sense given the blood loss.
Yeah, that tracks.
He had a weak radial pulse, but no palpable pulse in the injured arm.
Uh-oh. That could be an arterial bleed.
And those can be very serious, right?
Absolutely. Arteries carry oxygen-rich blood from the heart to the rest of the body.
So if they're damaged,
You can lose blood very quickly.
he was also reporting feeling dizzy and lightheaded.
That's probably a combination of the blood loss and the alcohol.
It makes sense.
Alcohol can actually make the effects of blood loss worse.
Oh, wow. I didn't know that.
Yeah, it's not a good situation.
And it gets even more complicated because this young man admitted to being drunk, having taken Ritalin.
Wait, Ritalin on top of the alcohol?
Yep, and then, punching through the window.
Mixing those two, that's a recipe for disaster.
So we're dealing with a major bleed, alcohol intoxication, And who knows what's happening with the Ritalin interaction.
Sounds like a real challenge for the first responders.
So what do they do?
Well, the first thing is to try to control the bleeding.
Makes sense.
Direct pressure is usually the first step.
Right, but with an arterial bleed, that might not be enough.
You're right, it might not be. You're right, it might not be enough.
That's exactly what they found.
Oh, no.
Applying pressure didn't seem to be slowing the bleeding at all.
Oh.
And to make matters worse, he was complaining of shooting pains up and down his arms.
Shooting pains, huh? That could be nerve damage.
So we've covered a lot of ground here with these cases.
Yeah, we have.
It's been pretty intense.
It's been a lot to take in.
But I think it's really helpful to break these scenarios down,
Yeah.
see how things can unfold in these emergency situations.
Absolutely. It helps us understand the complexities.
So what are some of the key takeaways for you that stand out?
I think the biggest one for me is just how quickly things can go downhill. You know, 1 minute everything's fine, and the
Yeah.
next someone's hanging from a rope or falling from a ladder or having a heart attack.
It's scary how fast it can happen.
It really is, and that's why early intervention is so crucial.
Yeah.
In a lot of these cases, minutes, even seconds, can make all the difference.
It really makes you realize that time is of the essence in these situations.
Couldn't agree more.
So looking back at these cases,
Yeah.
were there any particular details or aha moments that really stood out to you?
Well, a few things come to mind.
Okay.
For instance, in that first hanging case, the shift from VFib to PEA, that was really interesting.
Yeah, what was it about that?
It just highlights how complex the body is,
Right,
and
yeah.
how difficult it can be for medical professionals to manage these emergencies.
Yeah, it makes you appreciate their expertise.
Absolutely.
I have to admit, I was pretty surprised to learn that you could have electrical activity in the heart,
Yeah.
but no pulse.
Yeah, it's kind of weird, right?
It is.
But it just shows how important a proper diagnosis is
Right.
and really understanding what's going on.
Absolutely.
Another thing that really stuck with me was in the case with the fall from the ladder,
Okay.
the cherry red skin as a sign of carbon monoxide poisoning, I mean.
Yeah, I would never thought of that.
It's easy to miss, especially when there's a more obvious injury.
Right, like a fall.
Yeah, but it reminds us to consider all the possibilities.
It also makes you think about, potential dangers in everyday places.
Absolutely, like your garage.
Right.
We often don't think about those things.
Carbon monoxide, it's scary stuff.
Yeah, that's why awareness and prevention are so important.
We also can't ignore the fact that depression came up in several of these scenarios.
It's true.
It really adds another layer of sadness to these events.
It does, and it's a reminder that emergencies aren't just about physical injuries. There's
Mhm.
often mental health struggles, substance abuse, social factors that contribute to these situations.
Good point.
We need to remember to look at the whole picture.
Absolutely. Consider the person and their circumstances.
That's right, a more holistic approach to healthcare.
Thinking back to that second hanging case,
Yeah.
I'm still kind of struck by the fact that CPR couldn't be started.
Right, because he was still suspended.
It must have been so hard for his sister to see that and not be able to help.
It's a terrible situation.
It is.
But it highlights the importance of knowing what to do, of being prepared.
Absolutely. And prioritizing safety.
Exactly.
Then there was the case with the young man who punched through the glass.
Yeah,
That was a pretty clear example of the dangers of mixing substances.
it really was. Substance abuse is a complex issue.
It is.
It can affect judgment, inhibitions, lead to risky behavior.
And in this case, it could have lasting consequences, that nerve damage.
That's right, potentially lifelong effects.
So we've talked about how quickly these situations can escalate, the importance of early intervention, the link between physical and mental health.
Yeah, it's a lot to consider.
What does all this mean for our listener? Why is this information important for them?
That's a great question.
Yeah.
I think these scenarios, even though they're extreme, they offer some really valuable lessons for all of us.
Oh,
Being aware of potential dangers and knowing how to respond in an emergency, it can make a huge difference.
it does feel like a reality check.
It is, but it's also empowering, right?
Emergencies can happen to anyone, anytime.
It's true, but like I said, knowledge is power.
Okay, so how can someone, be more prepared for these situations?
Well, first off, be proactive about your health.
Yeah.
Get regular checkups, take care of any medical or mental health issues you have, know your family history.
It's all about being informed, right?
Right, knowing your risks so you can do something about them.
Okay.
I also strongly recommend, learning basic first aid and CPR.
Yeah, I've been meaning to take a CPR class.
It's a great idea. You never know when you might need it.
Could really make a difference.
It could literally save a life.
And what about mental health? We talked about how important that is.
Absolutely. If you're struggling, reach out for help.
Talk to someone.
Yeah, a friend, family member, therapist, anyone you trust.
It's okay to not be okay.
Exactly. Don't be afraid to ask for support.
Guys.
And lastly, just be observant of your surroundings.
Okay.
Pay attention to potential hazards, whether it's a rickety ladder or a room that's not well ventilated.
Or someone acting strangely.
Yeah, trust your gut.
If something doesn't feel right.
It's probably worth checking out.
This deep dive has been, well, intense at times.
Yeah, we covered some heavy stuff.
But I gotta say, it feels good to know more about these things.
I agree. Knowledge is the first step to taking action.
And those actions can save lives.
Absolutely.
Well, thank you so much for taking the time to walk us through these complex scenarios.
My pleasure. I'm glad we could shed some light on these situations.
It's been really eye-opening.
I hope our listener feels more prepared now, more empowered to take charge of their health and well-being.
That's what it's all about.
Exactly.
And to our listener, thanks for joining us on this deep dive.
We appreciate you being here.
We explored some pretty extreme situations today, but I think there are lessons here for everyone.
Everyday life, for sure.
So stay curious, stay informed, and stay safe out there.
That's the best advice we can give. Welcome back, everybody. Today, we're going deep into the world of emergency medical response.
Oh, yeah. It's going to be a wild ride.
Using a really cool set of training scenarios, actually. We're looking at numbers 7, 6, 5, 3, and 1.
So a good mix.
Yeah, each one's designed to, walk responders through these potential real-life situations.
Right.
To help them sharpen those split-second decision-making skills. It's not just about medical facts.
Yeah.
We're going to really see how these scenarios train responders to think on their feet, communicate clearly when the pressure's on, get ready for a football field injury, a mystery illness, even a dramatic jump from a window.
I think what's so fascinating about these scenarios is they really force you to go beyond just treatment,
Yeah.
Like it's about quickly assessing the situation, ensuring everyone's safety,
Right.
prioritizing actions
Right.
in a way that, it can really make a difference.
Absolutely.
Big time.
All right, let's jump right into scenario #7.
Okay.
Picture this. You're dispatched to a football field. Standard. Right. Okay.
24-year-old male, lower leg pain after a brutal tackle. Heard a cracking sound and another player landed right on top of him.
Oof. That cracking sound immediately makes you think fracture.
Right,
And when you add in the mechanism of injury there, it definitely raises a red flag.
Exactly. So you find him on the bench, leg extended, obviously in pain. He's alert, airways open.
Good.
But his pulse is racing. Skin's pale and clammy. Oh, and there's a visible deformity to the middle of his right lower leg. Vitals come back. Heart rate 116, strong and regular. Respiratory rate 24, full and regular. Blood pressure 128/86, GCS 15, and SpO2 of 100%.
So that rapid pulse and pale skin tell you his body might be compensating for shock.
Yeah.
Either due to blood loss or the trauma itself. Think of it as his body's trying to maintain blood flow to the vital organs.
So the responder needs to be super systematic here.
Absolutely. They're going to run through a full AEMCA assessment.
Right.
That scene's safety, for everybody ruling out spinal injury.
Getting a sample history.
Okay.
That's symptoms, allergies, medications,
Okay.
past medical history, last oral intake, and events leading to the incident.
Gotcha.
All while keeping a close eye on those vitals.
And of course, stabilizing that leg with proper splinting techniques. Right?
Yeah.
Getting him transported as quickly and safely as possible. 10 minutes later, you recheck his vitals. Heart rate's down to 106, still strong, and regular respiratory rate is 20, regular and full. And then blood pressure is 126/80.
Seems like he's stabilizing a little, right?
Yeah.
Good signs.
Yeah, it's a good sign, but you can't let your guard down. You know what would really concern you even with these improving vitals? The potential for hidden injuries.
Yeah.
That's why a focused secondary assessment is so important. You don't want to miss any subtle signs of, internal bleeding or other complications that could be masked by that initial trauma.
Good point. Okay. Shifting gears to scenario #6. It's a 911 call from a frantic granddaughter.
Oh, she's found her 82-year-old grandmother unresponsive in the bathroom. She's saying there's so much blood.
Whoa, that's concerning, right?
Yeah.
Unresponsive. Bathroom, lots of blood. I mean, your mind immediately goes to potential causes, like a severe GI bleed, right?
Absolutely.
And like that.
We don't have much to go on initially, but thankfully the granddaughter grabbed her grandmother's medical information.
Good.
And an overnight bag, so that could be helpful later on.
Absolutely, yeah.
Yeah.
That medical history could be vital in guiding treatment.
On scene, bathroom is safe. You find the patient on the floor. No pulse, airways open, but she's not breathing. Her skin is very pale, cool, dry, with delayed capillary refill,
Wow.
meaning the blood isn't circulating as efficiently as it should be.
Right.
There's also blood in the toilet.
That's a classic presentation of a patient in cardiac arrest.
Yeah,
No pulse, not breathing,
yeah.
pale and cool skin. I mean, you got to act fast.
Right away. The AED is on, and you get one of these results, VTACH,
Okay.
like PEA, or a systole.
Each one needs a different approach,
Yeah.
but the fundamentals are the same.
Okay.
High-quality CPR to manually pump the heart, airway management to ensure oxygen gets in, and getting her to a hospital ASAP.
Immediately. The granddaughter is understandably distraught, but while you're working, she mentions her grandmother's had random bleeding during bowel movements for weeks, and she was recently put on a blood thinner.
That's a game changer. Suddenly you have context.
Yeah.
I mean, that blood thinner could explain the severity of the bleeding. And if she's been having these issues for weeks, there could be an underlying condition, like a GI ulcer,
Uh-huh. Makes sense. All right, on to scenario #5.
Okay.
This one's intense.
Right.
The police call you in for a 22-year-old male who jumped from a second-story window.
High-energy trauma like this is always a concern.
Totally.
Not just the physical injuries from the fall, but, the reason behind the jump itself.
Right, yeah. He's laying on the lawn, conscious, airways clear, breathing fast, strong pulse. His skin is pale, cool, sweaty, but capillary refill is normal.
Okay.
You also find a mid-shaft right femur fracture. It's closed. Vitals are heart rate 120, strong and regular, respiratory rate 24, full and regular, blood pressure 112, 680, GCS 15, and SpO2 99%.
Okay. So that strong pulse with the rapid breathing, that's likely pain and anxiety.
Yeah.
But the normal capillary refill means shock, if present, isn't severe yet.
Good.
But the police tell you he jumped while they were trying to apprehend him.
Oh, wow.
He was yelling, seemed intoxicated, and if you ask him, he admits to using drugs and alcohol.
Oh, boy. So that adds a whole new dimension to the situation. The responder needs to assess not only the physical injuries, but also the potential for behavioral issues.
Absolutely. And scene safety becomes even more critical.
Yeah.
They need to confirm with the police that the scene is secure, check for weapons, and maintain that stay-in-play approach.
Okay.
That's treating immediate medical needs before moving him. This minimizes the risk of further injury, especially if there's a spinal issue.
So they're focused on that femur fracture, but also got to be mindful of potential spinal injuries from the fall.
Exactly. It's about seeing the bigger picture,
Yeah.
C-collar for the neck, traction for the femur, cleaning any abrasions. You're stabilizing him while gathering as much information as possible.
Yeah.
His OPQRST, for the leg pain, onset, was when he landed, any movement makes it worse. Throbbing pain in the right femur, shooting down his leg, a 10 out of 10 on the pain scale. Started about 10 minutes ago. And his 5 Ps, pain, pallor, pulse, paresthesia, and paralysis. You recheck those vitals. Heart rate's down to 104, strong and regular. Respiratory rate is 20, regular and full. Blood pressure remains at 2680, and his temperature is 36.9 degrees Celsius.
So those vitals trending down, that suggests his pain and anxiety might be easing, but you're still watching him like a hawk.
Of course, you're constantly reassessing,
Yeah.
looking for any changes that could signal a complication.
Yeah, for sure. All right, time for scenario #3. Picture this. It's 2:00 a.m. You're called to a dark road where a cyclist has been hit by a car.
Oh, man. Talk about a challenging scene. I
Yeah.
mean, limited visibility, potential for oncoming traffic, and you have no idea what you're walking into.
Right. Information is scarce.
Yeah.
Bystanders say he was thrown at least 15 feet, and they can't wake him up.
Wow.
Nobody knows if he was wearing a helmet.
The fact that he's unconscious is a major red flag.
Yeah.
And that unknown helmet status, you're immediately thinking potential head injury.
Right. So first things first, scene safety on that dark road has got to be paramount.
For sure.
You got to make sure the ambulance is positioned to block traffic.
Yeah.
Wear your reflective gear, make yourself visible to oncoming cars.
Absolutely. Your safety and the safety of everyone on scene is the top priority.
For sure. You get to the patient and he's not moving. Obvious multi-system trauma. Can't find a pulse. He's unresponsive. There's blood in his airway, and he's not breathing. Skin's pale, cool, clammy, with delayed capillary refill.
Oh,
There's a contusion on the right side of his head, deformity to the occipital region.
okay.
Find his neck, chest, abdomen, pelvis, and femurs to be unremarkable, except his femurs are unstable bilaterally.
So that suggests, you know, significant lower extremity injuries adding to the severity of the situation.
Totally. His back appears unremarkable as well, and he has abrasions on his arms, his vitals.
Mm.
No heart rate, no respiratory rate, no blood pressure, GCS of 3, pupils are fixed and dilated, and you can't get an SpO2 reading.
So it confirms what you already suspected.
Yeah.
I mean, this patient is in cardiac arrest.
You start CPR immediately, and the AED analysis shows PEA.
Good.
Now, I know PEA stands for pulseless electrical activity, but can you break that down for our listener?
Sure. So PEA means the heart's electrical system is still showing activity on the monitor,
Yeah.
but there's no effective pumping action. It's like the electrical signal is there, but the heart muscle isn't responding to it, so there's no pulse.
So no shock advised in this case.
Right.
You continue CPR, focusing on those high-quality compressions, airway management. But while you're working, bystanders mention he didn't seem to be wearing a helmet.
Oh, that's a tough reality. You can't say for sure, but a helmet might have lessened the severity of that head injury.
Right. Okay. Ready for a truly chaotic situation.
Oh boy, hit me.
Scenario #1. You're called to a busy roadway, 2-vehicle collision. Limited information about injuries, but one driver is trapped.
Multi-vehicle collisions always present a challenge.
Yeah.
You've got to be prepared for anything. And triage becomes your most important tool.
Right. Triage. So that's about quickly assessing everyone involved and
Yeah.
deciding who needs immediate attention. Right. Kind of like a battlefield medic prioritizing the most urgent cases.
Exactly. You need to identify the most critical patients
Yeah.
and get them the help they need as quickly as possible.
For sure. The initial triage paints a grim picture.
Okay.
Vehicle 1 driver, unconscious, no pulse, BLAC,
Oh, wow.
meaning deceased.
Right.
Vehicle 1 passenger, severe back pain with numbness, RED. Immediate attention needed.
Gotcha.
Vehicle 2 driver, neck pain, left shoulder pain, deformed left tibia-fibula, also RZ.
This is a perfect example of why rapid triage is so vital. You have one patient who's unfortunately passed away and 2 others who need help now.
Thankfully, another ambulance arrives within a minute.
Good.
Now you have a partner who can help with manual C-spine stabilization, allowing you to focus on a more detailed assessment. Let's zero in on that passenger from the first vehicle. She's conscious, alert, but extremely anxious. Her skin's pale, cool, and clammy. But below the injury, her lower extremities are flushed and dry. That difference in skin condition that's a concern, isn't it?
It definitely is. It could be a sign of spinal shock, where the nerves that control blood vessel dilation are disrupted.
Gotcha. Pulse is rapid and weak, but her breathing is full. She's also got severe pain and a step deformity in her lower back around the T10-12 vertebrae. Her vitals are heart rate 130, regular but weak, respiratory rate 24, regular and full, blood pressure 94/48,
Okay.
GCS 15, and SpO2 99%.
So that low blood pressure with the rapid heart rate, that's concerning.
Yeah.
It points towards her body trying to compensate for either blood loss or the shock from that spinal injury.
Right. Her husband, who is driving, says they swerved to avoid a red light runner slamming into the other vehicle's driver's side.
Oh, geez.
The passenger now has numbness and paralysis from the belly button down, neck and back pain, and she is incredibly anxious.
So this lines up with a possible spinal cord injury.
Yeah.
Every movement needs to be done with extreme care to avoid making things worse.
So for medical history, allergies, penicillin,
Okay.
medications, Arthrotec, risperidone, and importantly, ASA.
Oh, that ASA, which is aspirin, that's a key detail.
It can increase the risk of bleeding, especially with potential internal injury.
Right. Past medical history,
Yeah.
osteoarthritis. Last oral intake, lunch, about 2 hours ago. You ran through the OPQ-RST for her back pain. Started on impact.
Okay.
Nothing makes it better. Stabbing pain radiating from her lower T-spine, T10-12, across her back, 10 out of 10 on the pain scale. And it all began about 8 minutes ago.
Oh.
You recheck those vitals. Heart rate's now 140, strong and regular, respiratory rate's 26, full and regular, blood pressure is 92/86,
Okay.
GCS 15, and SpO2 98%.
That rising heart rate with a still low blood pressure is worrisome. It indicates her body's struggling to compensate.
Now on to the driver of the second vehicle.
Okay.
He's conscious, alert, very anxious, and breathing a little fast.
Okay.
He also has severe pain and a step deformity in his lower T-spine, the same T10-12 region. His vitals. Heart rate 130, regular and full.
Okay.
Respiratory rate 24, regular and full. Blood pressure 94/48, GCS 15, and SpO2 99%.
We're seeing that same pattern, right?
Low blood pressure and elevated heart rate,
Mm-hmm.
possibly indicating shock.
Right. His account of the crash is similar to the husband's.
Okay.
Both are clearly shaken and in a lot of pain.
It's crucial to acknowledge their emotional distress.
Absolutely.
I mean, these are incredibly traumatic experiences.
Mm.
Along with the medical care, the responder needs to offer reassurance
Wow.
and psychological support.
So we've got two patients with potential spinal injuries, both needing rapid transport and pain management.
Right.
What stands out to you about this scenario?
The fact that both have similar injuries with step deformities in the same spinal region, it tells a story.
Mm-hmm.
It suggests a high-energy impact right at that point of collision.
Yeah.
Likely when the first vehicle swerved into the driver's side of the second.
Right.
And that means careful spinal immobilization is absolutely essential.
Right. You can't risk any movement that could worsen their injuries.
Exactly.
Mhm.
It's a delicate balance between speed and safety.
Yeah.
And it really highlights the need for clear communication and coordinated care between all of the responders on scene.
It's amazing how much information you can glean from those initial assessments and how that guides your actions in those crucial first minutes.
It's easy to get lost in the procedures and protocols of these scenarios,
Yeah,
but we can't forget the human element.
that's true. Behind every injury, there's a person, right?
Yeah.
Experiencing fear, pain, anxiety. And then you add in the stress of, like, bystanders and family members
Oh, yeah.
witnessing this whole thing. It adds a whole other level of complexity for the responder.
Absolutely. That's why this kind of training is so crucial. It's not just about prepping for the medical challenges.
Yeah,
It's about equipping responders to handle the emotional and psychological demands of the job.
for sure. Thinking back to that football player,
Right.
even though his injuries seemed, less critical than some of the others, he was still in a lot of pain, probably pretty scared. How does a responder balance providing that medical care with that human element of reassurance and support?
I think communication is key.
Okay,
Clear, calm, and reassuring communication
right.
can really make all the difference. Imagine you're that responder, right?
Yeah.
You explain what you're doing, you answer any questions
Yeah.
the patient has,
Yeah.
and you provide emotional support throughout the process. It's about treating the whole person,
Mhm.
not just the injury.
That makes a lot of sense. And speaking of challenging situations, let's revisit that chaotic multi-vehicle collision.
Oh, yeah.
Two patients with potential spinal injuries, a deceased driver, a distraught husband.
Right.
It's a high-stress environment for everyone involved.
That scenario, I think, really highlights the importance of teamwork and coordination.
Yeah.
You've got multiple responders
Right.
with specific roles,
Mm.
working together to provide the best possible care for everyone. One responder might be focused on triage, another on immobilizing the spine, another on assessing injuries and prepping for transport.
And it's not just the medical teams. You've got police officers, firefighters, tow truck drivers.
Right.
Everyone needs to be on the same page, sharing information, coordinating their efforts.
Exactly. Effective communication across all of those agencies is absolutely crucial.
Absolutely. Let's talk more about those potential spinal injuries. They seem particularly high risk.
Yeah, you're right. Spinal injuries are always a major concern because of the potential for paralysis or other life-altering complications.
Yeah.
The responder has to be incredibly meticulous to avoid causing further damage.
In that scenario, you mentioned manual C-spine stabilization.
Right.
Can you explain why that's so important?
So imagine the spine like a delicate structure
Okay.
that's been compromised. Even the slightest movement could worsen the injury and lead to permanent disability. Manual stabilization ensures that the head and neck are kept in alignment,
Okay.
preventing any twisting or bending until the patient can be safely secured to a backboard.
So it's a continuous effort from the initial assessment all the way through transport.
Absolutely. Transporting a patient with a suspected spinal injury requires extra care. Every movement needs to be coordinated, precise, to avoid any unnecessary jostling. It really highlights the need for teamwork
Yeah.
and communication.
It's incredible how these responders have to be ready for anything. One minute they're on a football field, the next they're in a major car crash.
That's the nature of emergency medical response, right?
Right.
It's unpredictable, demanding, requires a diverse skill set.
For sure. Speaking of diverse skill sets, we've talked about communication in general terms,
Right.
but how does it specifically apply to these scenarios?
So think of communication as the glue that holds everything together.
Okay.
It's about clear and concise communication with the patient, explaining what you're doing
Uh-huh.
and why. It's that effective communication with your partner,
Right.
sharing observations, coordinating care.
Yeah.
It's about communicating with other responding agencies, ensuring everyone has the information they need.
And all of this is happening in a high-pressure, rapidly changing environment.
Exactly. And
Yeah.
and that's why responders are trained to communicate in a way that's calm, clear, and easy to understand.
Right.
It's about using plain language, avoiding medical jargon,
Yeah.
and actively listening to everyone involved.
It sounds like there's also a lot of importance placed on documentation.
Documentation is essential.
Yeah.
It ensures continuity of care by providing a detailed record of the patient's condition,
Uh-huh.
the treatment provided, and any changes in their status. It's like a story of the patient's journey,
Okay.
from the moment the responder arrived to the time they were handed over to the hospital staff.
So the receiving hospital has a complete picture of what happened.
Right. And good documentation also plays a crucial role in legal cases, providing a factual account of the care provided. Plus, it helps with quality improvement. By reviewing records, agencies can learn from each case and identify areas where they can improve their response.
It's amazing how much detail goes into these reports. It seems like everything matters, from the time of arrival to the specific medications the patient is taking.
You're absolutely right. Every piece of information can be vital in understanding the patient's overall condition and guiding their care.
Now, I remember in the scenario with the cyclist, the responder had to make some pretty critical decisions.
Yeah.
Without even knowing if the patient was wearing a helmet, how do they adapt to those unknowns?
That's where critical thinking and experience come in.
Yeah.
Responders are trained to assess the situation, gather as much information as possible, and make educated decisions based on what they know.
Right.
Sometimes, you have to go with your gut,
Right.
trusting your instincts
Right.
and your training.
So it's a balance between following protocols but being flexible when the situation demands it.
Exactly. No two emergencies are the same, so responders need to be able to think critically and adjust their approach on the fly. That's what makes this job so challenging and so rewarding.
These scenarios really paint a picture of how complex emergency medical response is.
Oh, yeah.
It's not just about bandages and medications.
It's about quick thinking, problem solving, teamwork, communication, and above all, a deep commitment to helping others in their time of need.
And it's about staying calm and focused in incredibly stressful situations.
Yeah.
These scenarios really give you a glimpse into the demands of this profession.
I agree. It's a testament to the dedication and skill of these responders.
Yeah.
They're out there on the front lines day in and day out, making a difference in people's lives.
Let's talk about that scene with the 22-year-old who jumped from the window.
Right.
There's a lot going on there.
Yeah.
The fall, potential drug and alcohol use,
Yeah.
police involvement. How does a responder prioritize their actions in such a complex situation?
It always comes back to the ABCs.
Yeah.
Airway, breathing, and circulation.
Right.
Those are your top priorities, the things that will keep the patient alive. Once those are stabilized,
Yeah.
you can move on to addressing other injuries and concerns.
So in this case, the responder would first make sure the patient's airway's open,
Right.
check his breathing, and assess for any signs of circulatory problems.
Exactly. And while doing that, they're gathering information, assessing the environment, communicating with the police to make sure the scene is safe for everyone.
How does the fact that he might be intoxicated affect the responder's approach?
Well, it adds an extra layer of unpredictability.
Yeah. Right.
The responder needs to be aware of the potential for aggression,
Right.
confusion, or withdrawal symptoms.
Uh-huh.
It's about maintaining a safe distance, avoiding any sudden movements,
Yeah.
and communicating in a way that's calm and reassuring.
And I imagine documenting that potential intoxication is really important.
Absolutely. The medical team at the hospital needs a clear picture of the patient's condition
Yeah.
and any factors that could complicate their treatment.
Let's go back to the unresponsive grandmother.
Okay.
we talked about how the granddaughter's information about her bleeding and the blood thinner changed the responder's assessment. Can you elaborate on why that medical history is so crucial?
So knowing a patient's medical history is like having a roadmap to their health.
Okay.
It can provide vital clues about the cause of their current condition
Right.
and guide treatment decisions. In this case, knowing about the blood thinner helps the responder understand the potential severity of the bleeding
Right.
and consider possible underlying conditions like, like a GI ulcer.
Mm-hmm.
That could be contributing to it.
And of course, you've got that added emotional layer of the granddaughter who's witnessing this medical emergency.
That's a crucial point. Responders aren't just dealing with physical injuries, you
Yeah.
know. They're dealing with people in crisis.
Right.
In that situation, you have to acknowledge the granddaughter's distress,
Yeah.
answer her questions honestly, and reassure her that you're doing everything you can to help her grandmother.
It's impressive how responders can process all this information and make decisions so quickly, especially when, lives are on the line.
Yeah, it takes a lot of training
Right.
and experience to develop that ability to think on your feet. Responders are constantly exposed to these, high-pressure scenarios, both in simulations like these and in real-life emergencies.
Yeah.
They learn to assess situations quickly,
Uh-huh.
identify potential problems, and develop a plan of action,
Yeah.
often with limited information and time.
So it's about applying their knowledge and experience in real time.
Right.
Adapting to the unique challenges of each situation.
Exactly. These scenarios help build that adaptability and critical thinking.
Yeah.
That's so essential in emergency medical response.
It's clear that these scenarios aren't just about testing medical knowledge.
Right.
They're about pushing responders to develop a comprehensive set of skills. Quick thinking, problem solving, communication, empathy, and the ability to remain calm under pressure.
You've summed it up perfectly. And those skills aren't just valuable in the field of emergency medicine. They're essential in any profession where you're dealing with complex situations.
Right.
And the well-being of others.
These scenarios have given us a real appreciation for the demands of this profession
Yeah.
and the dedication of the people who choose to do this work.
Absolutely. They're true heroes, putting their lives on the line every day to help others.
Well said. And that brings us to the end of part 2 of our deep dive into emergency response scenarios. Stay tuned for part 3, where we'll continue our exploration of these training tools and uncover even more insights into the world of emergency medicine. We've covered a lot of ground in these emergency response scenarios, from football fields to multi-vehicle collisions.
Right.
But one thing that really stands out to me is just how adaptable these responders have to be.
Yeah.
Every situation throws a curveball.
That's what makes this field so dynamic, right?
Totally.
You take that scenario with the young man who jumped from the window.
Uh-huh.
It wasn't just a broken leg, right? It was
No.
it was a complex mix of potential intoxication, psychological distress,
Yeah.
a scene involving law enforcement.
Right.
Each element added another layer of complexity for the responder.
Absolutely. It's like they're playing 4D chess, constantly analyzing, reassessing, and adjusting their approach based on whatever the situation throws at them.
You hit the nail on the head.
Yeah.
They have to think critically, make judgments based on incomplete information,
Right.
and improvise when necessary. And that's why those foundational skills, the communication, the teamwork, the scene safety, are so crucial.
Yeah.
They provide the structure for effective action,
Yeah.
even in the most unpredictable circumstances.
We talked about how crucial, clear communication was in that scenario with the unresponsive grandmother.
Right.
Not just, medical communication with your partner and other responders,
Right.
but that human connection with the granddaughter.
Absolutely. Imagine yourself in that situation.
Right?
You're treating a patient in a life or death scenario.
Yeah.
And you also have a distraught family member who needs reassurance and support. It's a delicate balance,
Yeah.
but it's a vital part of providing compassionate care.
Responders are essentially acting as medical professionals and crisis counselors simultaneously.
Exactly. And sometimes that human connection can be just as impactful as any medical intervention.
Totally.
It's about treating the whole person,
Yeah.
not just the illness or injury.
Let's shift gears for a moment and talk about something we've touched on throughout this whole deep dive: documentation.
Right.
Seems like something that could easily be overlooked in the heat of the moment, but these scenarios really emphasize how important it truly is.
Yeah, you're right. Documentation is more than just paperwork. It's a vital part of patient care.
Okay.
It creates a clear, concise record of the patient's condition, the treatment provided, and any changes in their status.
Right.
Think of it as a timeline
Okay.
that allows the receiving hospital to seamlessly pick up where the responder left off, ensuring continuity of care.
Because it's like passing a baton in a relay race,
Yeah,
making sure the patient doesn't miss a beat in their treatment. And good documentation can also be crucial in legal cases, right?
absolutely.
Yeah.
It provides an objective account of what transpired,
Yeah.
protecting both the patient and the responder. And don't underestimate the value of documentation for quality improvement.
Uh-huh.
By reviewing records, agencies can identify patterns, learn from mistakes, and continually improve their response protocols.
It's incredible how much detail goes into these reports.
It is.
Patient history, vital signs, medications, even like seemingly small observations.
It all contributes to painting a complete picture of the patient's condition and ensuring they receive the most appropriate care.
So these scenarios are teaching responders not only how to think and act in emergencies, but also how to document their actions effectively. It's like a holistic approach to emergency medical care.
Well said. It's about combining medical expertise with clear communication, thorough documentation, and a deep sense of compassion for the people they're helping.
As we wrap up our deep dive into these emergency response scenarios, what are some of the key takeaways you hope our listener will remember?
I think the most important takeaway is the realization that emergency medical response is far more complex than most people realize.
Yeah.
It's not just about ambulances and sirens. It's about a constant process of assessment, critical thinking, adaptation, and unwavering dedication.
It's a field that demands not only like a vast amount of knowledge, but also the ability to remain calm, make sound decisions, communicate effectively under immense pressure.
Exactly. These scenarios offer a glimpse into the reality of that world, a world where split-second decisions can have, life-altering consequences, where teamwork and communication are paramount, and where compassion is as vital as any medical tool.
I think we can all agree that the people who choose this profession are truly remarkable.
They are.
Their dedication, their skill, and their unwavering commitment to helping others in their most vulnerable moments deserves our deepest respect and gratitude.
Well said. We hope this deep dive has given you a new appreciation for the challenges and triumphs of emergency medical response, and perhaps even inspired you to learn more about this fascinating and vital field.
Thank you for joining us on this journey. Until next time, stay curious, stay informed, and stay safe.
Welcome to the Deep Dive. Today, we're going to be doing things a little differently. We're ditching the textbooks and diving headfirst into some intense emergency medical scenarios.
Yeah, think of it like we're giving you that behind-the-scenes look at how first responders think. Those amazing people who run towards danger when everyone else is running in the opposite direction.
Exactly. By the end of this deep dive, you'll be able to spot those critical details in a crisis. You'll understand why first responders do what they do, and you might even surprise yourself with how much you already know. So ready for scenario number 1.
Hit me with it.
All right, picture this. It's 11 p.m. You're dispatched to a hit and run. The caller is totally frantic. They're saying there's an unresponsive male lying in the road. Blood everywhere, no other cars, no witnesses around. Just a really bad situation.
Yeah, not exactly a walk in the park. Right away, you've got way more questions than answers. You arrive on scene, and you see a man who looks to be maybe in his 50s with multiple injuries.
And the initial assessment doesn't exactly paint a prettier picture. No pulse, delayed capillary refill. There's even a tire track across his chest.
Oh, that's never a good sign.
And it gets worse. Compound fractures in both legs, a major bleed from the back of his head.
And you shine a light in his eyes, and what do you see?
Uh-oh, don't tell me. Fixed and dilated pupils.
Bingo.
Yeah.
Not a good sign at all. For those who haven't been to med school, that suggests a serious brain injury, potentially impacting the part of the brain that controls things like consciousness and vital functions.
So the brain needs oxygen, just like any other organ, and if the blood supply is compromised, things go downhill fast.
Exactly.
Yeah.
You're absolutely right. And his other vitals are also painting a grim picture. No pulse, no breathing. This is looking less like first aid and more like, well,
Last aid.
yeah, unfortunately. In a situation like this, time is absolutely critical. You need to call for backup immediately. Fire department, advanced paramedics, everyone, you name it, you need them there. And then you jump into action, CIB circulation, airway, breathing. It's drilled into every first responder.
Even though you don't know what exactly led up to this, those initial actions are crucial. You're basically buying yourself time, right?
Exactly. You're stabilizing the patient as best as you can and preparing for rapid transport to a trauma center. Every second counts.
All right, let's move on to scenario number 2. This time, you're called to a house fire. Firefighters have already pulled the woman from the building. She's got burns on her face and hands. Understandably, she's really anxious.
The scene is secure, but you can see the evidence of the fire everywhere. There's soot around her mouth and nose, blisters are forming on her skin, and her pulse is just racing.
And here's where things take a turn for the unexpected. The woman explains that she was trying to light a cigarette on her couch.
Oh no, I can already see where this is going.
You got it. The couch catches fire and she tries to put it out, wait for it, with her bare hands.
Oh, wow. Talk about a series of unfortunate events. Initially, her vitals are just reflecting her anxiety and pain, but as the scenario unfolds, things get a lot more complicated.
So what starts is what seems like a pretty straightforward burns case becomes something a lot more serious.
Exactly. She starts having trouble breathing. She's becoming less responsive, and eventually she just passes out. Now you've got a whole new set of worries.
I'd imagine smoke inhalation is a major concern now, right?
Absolutely. Burns on the face and hands are one thing. But inhaling hot smoke, that can damage your airway. It can lead to swelling and make it incredibly difficult to breathe. In this situation, oxygen therapy becomes absolutely crucial, and you have to keep reassessing her vitals constantly.
This really shows how a situation can change in an instant, and those small details, those seemingly insignificant details, can actually make all the difference.
Couldn't have said it better myself. Sometimes the biggest challenge isn't just the initial injury, but that whole cascade of effects that follow. You've got to be thinking one step ahead.
Right, speaking of things escalating quickly, our next scenario throws us another curveball. You get a call about a gunshot wound, but you have practically zero information. You arrive at the house, and
Hold on. Before you even get out of your vehicle, a call like that should immediately set off alarm bells. Is the scene safe? Who has the gun? Are there other victims? You got to be thinking about all of that.
oh, and I forgot to mention there are kids in the house.
Yeah.
Talk about adding even more stress to an already incredibly stressful situation.
Yeah, that definitely changes things. Now you're not just worried about the patient. You're worried about everyone's safety, especially the little ones. The psychological impact of something like this can be absolutely huge.
So you walk in, and there's a man on the living room floor bleeding heavily from a gunshot wound to his groin and thigh.
All right, so his pulse is racing. He's breathing deeply, but he's conscious and alert. The good news is he can actually tell you what happened. The bad news, well, you'll see.
Okay, lay it on me.
Yeah.
What's the twist?
The man tells you his wife shot him, and not just once, twice. Once in the thigh, once in the groin. It seems she caught him cheating. Talk about a domestic dispute gone wrong.
Wow, okay, so now we're dealing with potential legal issues, emotional trauma. This is way more than just patching up a bullet hole.
You got it. And as if things weren't already tense enough, the wife walks back into the room. And she just starts screaming at the patient.
Uh-oh, I have a feeling this is about to get messy.
You could say that the patient who's already on edge starts mirroring his wife's behavior. He's becoming increasingly agitated, his breathing gets labored, and then boom, he passes out cold.
Okay, that's a bad sign, like really bad.
Losing consciousness like that?
Yeah.
Yeah, that's a major red flag. We're talking potential shock, internal bleeding. This is a life-threatening situation.
So what do? You've got a hostile scene, a patient who's crashing, and 2 terrified kids watching all of this unfold.
In that situation, the first priority is always scene safety. You have to get the situation with the wife under control, maybe even separate her from the patient. Then you focus on the patient. He's losing blood, he's probably in shock, and those gunshot wounds are in a very delicate area. You have to stabilize him quickly and get him transported as soon as possible.
So this is one of those scenarios where you have to be a medic, a counselor, and a security guard all at the same time.
Yeah, it's a delicate balancing act for sure. But those skills, those are the skills that can make the difference between a good outcome and a tragic one.
Okay, let's switch gears to a slightly less dramatic scenario, but one that's all too common. You get a call for an elderly woman, 82 years old, who's bleeding from her leg.
You arrive to find her sitting calmly in her living room, holding a dishcloth to her right calf. She seems pretty nonchalant about the whole thing. She tells you she just bumped her leg on the coffee table.
I'm sensing a but coming here.
You know it. When you actually examine the wound, it's a lot worse than she let on. We're talking a twisted vein, profuse bleeding, all those telltale signs of someone who's losing more blood than they realize.
So what are the clues here? What gives it away?
Well, her skin is cool and clammy. She's a little bit disoriented. Her breathing is slightly labored. They're subtle signs, but they scream internal bleeding, especially in someone her age.
I imagine her age makes this even more serious, right?
Absolutely. Elderly patients, they don't always present with those classic signs of shock like younger people do. Their bodies compensate differently, which can be misleading. You really have to pay attention to those subtle cues.
What about her vitals? What are they showing?
Rapid, weak pulse, low blood pressure, everything points to significant blood loss.
So even though she's acting like it's no big deal, you're treating this like a major bleed.
Absolutely. Direct pressure to the wound, elevate the leg, oxygen therapy. And because she's showing those signs of shock, you start an IV and get ready to give her fluids if she needs them. We can't afford to wait and see with a case like this.
This really highlights how those seemingly minor injuries can be incredibly deceptive, especially in older patients.
You've got that right. Never underestimate the power of a thorough assessment and a healthy dose of skepticism.
All right, let's wrap up this first part of our deep dive with a scenario that, unfortunately, we hear about all too often: a high-speed collision at a busy intersection.
And as you approach the scene, you just know the potential for serious injury is incredibly high.
You find a 46-year-old man in the driver's seat. His car is a complete mess, and he's clearly in distress. He's clutching his chest, gasping for air. It's a tough scene.
He tells you he was T-boned by another car that just ran a red light and took off. Didn't even stop.
His breathing is rapid and shallow, and he can barely take a full breath without wincing in pain.
That's a classic presentation for potential chest trauma. The impact of a T-bone collision, it can be devastating. It can cause anything from rib fractures to internal bleeding to damage to the lungs themselves.
What about a collapsed lung? That can happen with these kinds of accidents, right?
A collapsed lung, or what we call a pneumothorax, is definitely a serious concern in this situation. It happens when air leaks into that space between the lung and the chest wall, and it causes the lung to, collapse. And it can happen from blunt force trauma, like our driver experienced, or even from a fractured rib that punctures the lung. It's incredibly painful and makes breathing extremely difficult.
So when you're assessing his chest, what are you specifically looking for?
I'm looking for any signs of bruising, deformity, any areas that are tender to the touch. And I'm listening to his lungs with a stethoscope, making sure both sides are expanding equally and that there are no unusual sounds, like wheezing or crackling, which could indicate air leaking into that chest cavity. And of course, we're monitoring his vital signs very closely.
Speaking of vital signs, his skin is pale and clammy and his pulse is through the roof. What's that telling you?
Those are red flags for shock. His body is basically trying to compensate for either blood loss or that intense pain from his injuries.
So while he might seem okay at first glance, this could be a lot worse than it looks.
Absolutely. In a situation like this, you just can't take any chances.
So what are your priorities then? You've got a guy who's clearly in bad shape, and who knows what kind of internal damage he has.
The first thing, first and foremost, is addressing his breathing. We give him high-flow oxygen, that's a must. Then we immobilize his spine. That impact, it could have caused spinal injuries, so we absolutely can't risk moving him until he's properly stabilized. And we're constantly reassessing, looking for any changes in his condition.
So I'm guessing transport is happening ASAP.
Absolutely. A trauma center is where he needs to be. The faster we can get him there, the better his chances are.
This scenario is a perfect example of why that rapid assessment and those seemingly small details are so crucial in emergency medicine. Something that seems like a simple fender bender could actually be hiding some really serious, life-threatening injuries.
You said it. You have to think fast, act decisively, and always, always be prepared for the worst. All right, ready to dive back into these scenarios. We've got some more lined up that'll really put your emergency response skills to the test.
Bring them on.
Yeah.
Starting to feel like I could handle just about anything at this point. Oh, almost anything. What do we have next?
Okay, this one takes us to a, unfortunately, all too familiar scene. A motorcycle versus truck accident. And right off the bat, when that call comes in, you're dealing with a high energy impact, and the potential for serious trauma is, well, it's significant.
Yeah, motorcycles offer so little protection compared to cars. It doesn't take much to cause a really devastating injury.
Exactly. And this particular scenario, it plays out on a highway. So you've got those higher speeds, which usually mean more severe injuries. And then you've got the challenge of trying to secure a scene on a busy road with traffic whizzing by.
Okay, paint me a picture. What does the scene look like when you arrive?
You find a 30-year-old male lying on his back. He's wearing a helmet, thankfully, but it's got some serious cracks and scrapes, evidence of a pretty big impact. He's conscious, but he's disoriented and clearly struggling to breathe.
So even with the helmet, we're probably dealing with a head injury.
Mm.
What else are you seeing?
As you examine him, you notice his pelvis feels unstable, which is a major red flag for potential internal bleeding, maybe even fractures. And when you check his pulse in his right foot, it's weak and thready.
A weak pulse in the foot. That doesn't sound good. What does that indicate?
It could mean there's a problem with the blood flow to his lower extremities, possibly due to a vascular injury or maybe a pelvic fracture that's compressing the blood vessels. Either way, it's a serious concern that needs immediate attention.
He must be in a lot of pain.
He is. He tells you he swerved to try and avoid the truck but couldn't get out of the way in time. He's complaining of severe pain, particularly in his pelvis and legs.
So we've got a potential head injury, a possible pelvic fracture, he's having trouble breathing, and there's a weak pulse in his foot. Where do you even begin with something like this?
With a trauma situation like this, it all comes back to the ABCs: airway, breathing, and circulation. Those are your top priorities. You need to make sure his airway is open and clear, provide supplemental oxygen to help him breathe, and control any external bleeding.
And with a potential spinal injury, you have to be extra careful how you move him, right?
Absolutely. Spinal immobilization is critical. We use a backboard and a cervical collar to keep his spine stabilized and try to minimize the risk of any further injury. One wrong move could have really devastating consequences.
So you're working quickly but carefully, trying to address those life-threatening issues while also keeping his spine safe. What happens next?
So you're about 9 minutes into your assessment, and things take a turn for the worse. The patient, who was conscious and talking to you just moments ago, suddenly loses consciousness.
Wow, talk about a gut-wrenching moment. What goes through your mind when something like that happens?
Honestly, it's a mix of adrenaline and just pure focus. That the situation just became a whole lot more critical, and you have to act fast. Your priorities shift to stabilizing his airway, potentially needing to assist his breathing, and continuing to manage any bleeding.
And transport becomes even more urgent at this point, I imagine.
Absolutely. Every second counts. This patient needs to get to a trauma center as quickly and as safely as possible. That's where they'll have the resources and the expertise to really address those potentially life-threatening injuries.
Okay, that scenario was definitely intense. It really makes you realize just how much responsibility rests on the shoulders of first responders.
They face incredibly challenging situations, and they have to make those life or death decisions under immense pressure. But their training and their experience, that's what equips them to handle those situations with skill and composure.
It's pretty amazing to see how they can stay calm and focused in the middle of all that chaos. Speaking of chaos, let's switch gears to a scenario that involves a bit more of a volatile situation.
Oh, yeah, this one's a real doozy. It takes us back to that house where a man was shot by his wife after she discovered his infidelity.
Right, so we're already dealing with heightened emotions and potential danger. What makes this situation so challenging?
Well, when you arrive on the scene, you immediately find yourself in a very tense environment. The wife is extremely agitated and distraught, and her actions are pretty unpredictable. She's yelling, pacing back and forth, and generally making it really hard for you to focus on the patient.
Talk about a distraction. How do you even begin to assess the patient with all of that going on?
It's tough, that's for sure. The first thing you have to do is assess the scene for safety. Is the wife still armed? Is she a threat to you or to the patient? Your own safety is absolutely paramount in a situation like this.
And how do you handle the wife herself? I imagine trying to reason with someone who's that emotionally distraught could be pretty tricky.
Yeah, it takes a really delicate balance of empathy and assertiveness. You need to acknowledge her emotions and let her know you understand that she's going through something incredibly traumatic. But at the same time, you need to be clear and firm about the need to focus on the patient's medical care.
So you're trying to calm her down while simultaneously trying to assess the patient who's already been shot twice.
Exactly. It's multitasking on a whole other level.
Yeah.
You're constantly assessing both the patient's medical condition and the overall safety of the scene. You're looking for any signs that the situation may escalate, and you have to be ready to take action to protect yourself and the patient if it does.
I can only imagine how stressful that must be. What are some of the specific challenges you face when you're trying to assess the patient in an environment like that?
Well, for starters, it's really hard to get accurate information from him. He's in pain, he's scared, and he's probably not thinking very clearly. And with his wife yelling and interrupting, it's almost impossible to get a clear picture of what happened.
And I imagine you're also concerned about his emotional state. Being shot by your spouse, that's going to be a pretty traumatic experience.
Absolutely. He's likely experiencing a whole range of emotions: shock, fear, anger, betrayal. And those emotions, they can actually have a physiological impact, you
Oh.
know? They can elevate his heart rate and blood pressure, which makes it even harder to assess his true medical condition.
So you're dealing with a gunshot victim who's bleeding, in pain, emotionally distraught, and you've got this potentially hostile witness who's just making the whole situation even more volatile.
Exactly. And as if things weren't already bad enough, the patient's condition starts to deteriorate. His breathing becomes labored, his skin turns pale, and he starts to drift in and out of consciousness.
Uh-oh, it's not a good sign. What are you thinking at that point?
That's a critical moment. You have to make a judgment call. Do you stay on scene and try to stabilize him there? Or do you prioritize getting him to a hospital as quickly as possible? It's a tough decision.
What are some of the factors that influence that decision?
It depends on a lot of things: the severity of his injuries, his current vital signs, the availability of transport, the overall safety of the scene. It's a lot to consider. In a situation like this, you have to weigh the risks and benefits and make the best decision you can with the information you have.
It sounds like those judgment calls can be incredibly difficult. There's no easy answer, and the stakes are incredibly high.
You're absolutely right. But that's what makes the work of first responders so challenging and so rewarding. They're the ones who run towards danger when everyone else is running away. They're the ones who make those tough calls, and they do it all with the goal of saving lives.
It's a powerful reminder that we owe them a debt of gratitude for their service. Okay, let's move on to a scenario that might seem a little less dramatic at first glance, but it carries its own set of unique challenges. This one involves an 82-year-old woman who called 911 because she's bleeding from her leg.
You get to the scene, and you find her sitting calmly in her living room, just holding a dishcloth to her right calf. She downplays the injury, tells you she just bumped her leg on the coffee table.
I'm sensing a pattern here.
Yeah,
It seems like things are rarely as straightforward as they seem in these scenarios.
you got that right. In this case, the woman has a twisted vein, and the bleeding is, well, it's pretty significant. It's soaking right through that dishcloth she's holding against it.
So what are some of the challenges that are specific to treating an elderly patient in a situation like this?
Well, elderly patients, they often have underlying medical conditions that can complicate things. They might be on blood thinners, for example, which can make it harder to control the bleeding. And they might also have more fragile skin, making it easier to tear or bruise.
And as we've talked about before, their bodies don't always respond to trauma the same way younger people do.
Exactly. They might not show those classic signs of shock, like a rapid heart rate or low blood pressure, even when they're losing a significant amount of blood. So you have to be really careful and pay attention to those subtle clues, like changes in mental status, skin color, their breathing patterns.
So even though this woman is downplaying her injury, you're treating this as a serious medical emergency.
Absolutely.
Oh.
We can't afford to be complacent. We apply direct pressure to the wound, elevate her leg, give her oxygen, and get an IV line started just in case she needs fluids. And of course, we transport her to the hospital for further evaluation and treatment.
It's a good reminder that age can be a really significant factor in how we approach these situations. We can't always rely on those textbook signs and symptoms.
That's why experience and a thorough assessment are so crucial in emergency medicine. You have to be able to read between the lines, so to speak, and anticipate potential complications before they even arise.
All right, let's wrap up this part of our deep dive with one final scenario. It takes us back to that world of high-speed collisions, this time at a busy intersection.
So as you approach the scene, you see two vehicles that are pretty heavily damaged. One driver is already out of their car and walking around, looks like they're unharmed, but our focus is on the other driver, a 46-year-old male who's still trapped inside his vehicle.
I've heard that those initial moments after a crash can be deceptive. Just because someone seems okay doesn't necessarily mean they're not seriously injured.
That's exactly right. Adrenaline can mask pain and those initial symptoms, so it's really important to assess everyone involved, even those who seem fine. But in this scenario, our immediate priority has to be that trapped driver. He's conscious, but he's clearly in a lot of distress. He's clutching his chest, struggling to breathe.
Sounds like a classic presentation for chest trauma.
Yeah.
What are your immediate concerns?
My biggest concerns are potential rib fractures, internal bleeding, maybe even a collapsed lung. That impact was significant, and the fact that he's trapped, well, that suggests there could be crush injuries or internal bleeding. His difficulty breathing could be a collapsed lung, broken ribs, even damage to his heart. We just don't know yet.
So while you're trying to figure out what's going on inside his chest, you've also got the challenge of getting him out of that car safely.
Right. Extrication can be tricky, especially if there's a chance of a spinal injury. So we work closely with the fire department to stabilize the vehicle and carefully remove him using a backboard and cervical collar to protect his spine.
You're coordinating with multiple teams, assessing the patient's condition, and figuring out how to safely extricate him from the wreckage, all under a lot of pressure. What happens next?
Once we have him safely on that backboard, we continue our assessment. We listen to his lungs, check his pulse and blood pressure, and look for any signs of external bleeding. We'll ask him about his symptoms, try to get a better understanding of what he's feeling and the extent of his injuries.
I imagine you're also giving him oxygen and starting an IV.
Of course, oxygen is crucial to help him breathe, and the IV gives us a way to administer fluids and medications as needed. We're constantly monitoring his vital signs and watching for any changes that might tell us his condition is getting worse.
Now, I'm guessing transport is happening as soon as possible.
You bet. This patient needs a trauma center, and he needs it fast. That's where they have the specialized equipment and the surgical teams that can handle these kinds of complex injuries.
This scenario really highlights how important teamwork and communication are in emergency situations. You've got paramedics, firefighters, dispatchers, hospital staff, everyone working together to give the patient the best possible care.
You're absolutely right. It's a huge coordinated effort that needs clear communication and a shared understanding of the priorities. Every second counts, and everyone plays a crucial role in making sure the patient has the best possible chance.
Well, that wraps up this part of our deep dive into emergency medical scenarios. We've covered a lot today, from motorcycle accidents to gunshot wounds to the challenges of treating elderly patients. And it's clear that these first responders face incredible pressure and make those difficult decisions every single day.
It's been a really interesting journey, and I hope this has given everyone listening a better understanding of the amazing work these people do.
Welcome back to the deep dive. We're wrapping up our exploration of these emergency medical scenarios. And I got to say, after going through all these situations with you, I feel a lot more prepared for a crisis.
I like to hear that. Remember, it's not about turning everyone into a medical expert overnight. It's more about understanding those thought processes, those priorities that can make a real difference when things go south.
You've definitely done a great job explaining all those procedures and acronyms that used to sound, I don't know, kind of intimidating.
Well, I appreciate that. So are you ready for our final round of scenarios? I think we've got some good ones left.
Bring it on. I'm ready for anything at this point. What do we have up next?
Okay, this one's something a lot of us can relate to. An elderly fall. You get called to a house where an 82-year-old woman has reportedly fallen and injured her leg.
Okay, got it. Elderly fall. What happens next?
You arrive, and you find her sitting in her living room, holding a dishcloth to her right calf. She's surprisingly calm, almost like she's brushing it off, insisting she just bumped her leg on the coffee table.
I'm starting to recognize that too calm demeanor as a bit of a red flag. What are you thinking as you walk into that situation?
Yeah, whenever I encounter an elderly patient who's kind of downplaying their injuries, my mental alarm bells start going off. You see, their bodies, they don't always react to trauma as dramatically as younger folks do, so it's easy to miss those subtle signs.
So you're not letting her nonchalant attitude fool you.
Not a chance. As I take a closer look at her leg, I see that dishcloth is completely soaked with blood. She has a twisted vein, and the bleeding is pretty bad.
Yikes. That's a little more serious than a simple bump on the coffee table.
Yeah, just a bit. And to make matters worse, as we're getting her history, we learn she's on blood thinners. So that means controlling the bleeding is going to be even tougher.
Okay, so you've got a major bleed that's hard to stop, and you've got to factor in her age and medication. What do you do first? How do you prioritize things?
It's all about damage control. Direct pressure on that wound is key, and so is elevating her leg to try and slow down the blood flow. We give her oxygen to make sure her tissues are getting enough, and we start an IV line just in case she needs fluids.
And what about pain management? Imagine a fall like that, especially with a twisted vein, can be pretty painful, especially for someone her age.
You're right, pain management is a big consideration. We definitely want to make her as comfortable as possible, but we also have to be very careful with pain meds, especially for elderly patients. Some medications can interact with their other conditions or meds, so we have to choose carefully and watch their response really closely.
It sounds like treating elderly patients can be a balancing act. You have to juggle their specific needs with the urgency of the situation.
Yeah, exactly. It takes a gentle approach and a good understanding of how aging affects the body's response to trauma.
All right, let's move on to our last scenario for this deep dive.
Mm.
We're heading back to that busy intersection where another high-speed collision has just happened.
Okay, picture this. We arrive on scene and we see two vehicles, both with some pretty heavy damage. One driver is already out of their car, walking around, seems okay, but our focus is on the other driver, a 46-year-old male who's still trapped inside his vehicle.
I've heard those first few moments after a crash can be deceiving.
Mm-hmm.
Just because someone looks all right doesn't mean they're not hurt.
Exactly. Adrenaline is a powerful thing. It can mask pain and those early symptoms, so it's really important to check everyone involved, even those who seem fine. But like you said, in this scenario, our top priority is the driver who's trapped. He's conscious, which is good, but he's clearly in distress. He's clutching his chest and struggling to breathe.
Sounds like classic chest trauma. What are your initial concerns?
Right away, I'm thinking about the mechanism of the injury. That impact was strong, and the fact that he's trapped means there could be crush injuries or internal bleeding. The way he's struggling to breathe, it could be a collapsed lung, broken ribs, or even damage to his heart. There's a lot to consider.
So while you're trying to figure out what's going on inside his chest, you've also got to figure out how to safely get him out of that car.
Exactly. Extrication is a delicate procedure, especially with a potential spinal injury. We work closely with the fire department to stabilize the car and carefully remove him, using a backboard and a cervical collar to keep his spine protected.
So you're coordinating with multiple teams, assessing the patient, and working on extrication. Under a lot of pressure. What happens once you get him out?
Once he's safely on the backboard, we keep assessing. We listen to his lungs, check his pulse and blood pressure, and look for any bleeding. We'll also ask him about his symptoms, try to understand how he's feeling and how bad his injuries are.
And you're giving him oxygen and starting an IV, right?
Absolutely. Oxygen is so important to help him breathe, and that 5E line gives us a way to give him fluids or medication as needed. And we're always watching those vital signs, looking for any changes that might mean his condition is getting worse.
I imagine transport is happening as soon as you can get him ready.
You bet. He needs a trauma center, and he needs it fast. They have the specialized equipment and the surgical teams that can handle these complex injuries.
This scenario really shows how vital teamwork and communication are in emergencies. You've got paramedics, firefighters, dispatchers, hospital staff, all working together to give that patient the best possible care.
It's a huge team effort that relies on clear communication and a shared understanding of what needs to be done first. Every second matters, and everyone plays a crucial role in giving the patient the best possible outcome.
Well, that wraps up our deep dive into emergency medical scenarios. We've covered a lot of ground today, and it's been eye-opening to learn about the challenges, the quick thinking, and the life-saving decisions that first responders face every single day.
I agree. It's been a great discussion. And hopefully it's given our listeners a deeper appreciation for the incredible work these individuals do day in and day out.
I know I've learned a ton.
Yeah.
I feel like I have a better understanding of how to assess an emergency, figure out what to do first, and maybe even stay calmer under pressure.
That's what we like to hear. Remember, knowledge is power. The more you know about handling emergencies, the better prepared you'll be if you ever find yourself in a tough situation. Take a first aid class, learn some basic medical terms. Don't be afraid to ask questions. It could make all the difference.
That's great advice. Thanks for joining us for this amazing deep dive, everyone. We'll be back soon with another fascinating topic, so stay curious and stay tuned. All right, strap in, everyone, because today we are diving headfirst into the world of emergency medical scenarios.
Buckle up, because these cases are going to give you a glimpse into what it's actually like to be a first responder.
Think of it like a ride along, but from the comfort of, well, wherever you're listening from.
Yeah, no sirens, no flashing lights, just pure adrenaline-pumping medical mysteries.
We've got a whole stack of cases to get through, each one packed with those little details that make all the difference.
And those details, that's where the real challenge lies.
Exactly. You got to be able to connect the dots, think fast, and make life-saving decisions based on sometimes very limited information.
It's like being a detective, but with, people's lives on the line.
Okay, let's jump right in with scenario 6, the hit and run. It's 10:30 at night, dark road, a man lying unconscious in the middle of it, struck by a vehicle, and the driver nowhere to be found.
Classic hit and run.
We only have witness statement to go on. So where do we even begin in a situation like this?
First things first, scene safety. You absolutely have to make sure the area is secure, not just for yourself, but for anyone else around.
Right, because there could be all sorts of hazards lurking in the dark. Okay, so scene is secure, now we get to the patient. The scenario mentions tire tracks across his chest.
Oh, wow.
Yeah, not good.
Uh.
But what does that tell us specifically from a medical standpoint?
Well, that detail immediately screams serious mechanism of injury, and it raises the possibility of a cardiac tamponade.
Cardiac tamponade.
Oh.
Okay, for those of us who don't speak medical lingo.
So basically, imagine the force it takes to leave tire tracks on someone's chest. We're talking major compression.
Right.
And that compression likely caused blood to fill the sac around the heart, which restricts its ability to pump.
So we're not just dealing with a hit-and-run victim, we're dealing with a potential time bomb inside his chest.
Exactly. You gotta act fast.
Okay, let's shift gears to something a little different. Scenario 4, we're calling this one the persistent vomiter.
Sounds pleasant.
A 45-year-old man, severe flank pain, and he's been vomiting nonstop since last night. I can only imagine what his wife must be going through.
Yeah, that's a rough one.
So initial thoughts, it doesn't seem as, immediately intense as the hit and run, but
Don't let that fool you. Persistent vomiting, especially when combined with that severe flank pain, could be a sign of something serious brewing.
like what? Give us some examples.
We could be looking at anything from kidney stones to a potential abdominal aortic aneurysm.
Okay, so we got to assess quickly, but maybe with a different focus than the hit and run. Now, here's where things get really interesting. During transport, the patient suddenly grabs his abdomen and goes into VSA.
Wow, things just escalated.
VSA, for our listeners, that means vital signs absent.
Yeah, not a good sign.
Based on what we know so far, what could be happening here?
That kind of sudden decline, especially given his initial symptoms, well, it could indicate a ruptured aneurysm or maybe some other severe complication related to his original condition.
So we need to be ready to act, like right now.
Absolutely. Time is critical in these situations.
And I noticed that the source material specifically mentions that he goes into PEA, then asystole.
Mm-hmm.
Can you break those down for us? I know a lot of our listeners are familiar with those terms, but it never hurts to have a refresher.
Of course. So PEA, or pulseless electrical activity, basically means the heart's electrical system is still doing its thing, but there's no actual heartbeat.
Oh, I see.
It's like the engine's running, but the wheels aren't turning. You see electrical activity on the monitor, but there's no pulse. Asystole, on the other hand, that's the flat line.
Nothing at all.
Nothing. No electrical activity, which means the heart has completely stopped.
So both are serious, obviously, but they require different approaches, right?
You got it. Both PEA and asystole mean we got to jump into action immediately, but the specific steps we take will depend on what we think is causing the problem.
Man, this is why I find emergency medicine so fascinating. It's like this constant puzzle where you're analyzing clues, making decisions, and adjusting your approach on the fly.
It's definitely not for the faint of heart.
Okay, let's move on to a scenario that, while important, takes us in a bit of a different direction. Scenario 3, the unresponsive tenant. We arrive at a house, and the landlord has found his tenant unresponsive. Seems like he's been that way for days.
Oh, that's a tough one.
Yeah, this one feels a bit heavy, even just reading about it.
It is, because it brings up that sensitive topic of recognizing obvious death.
Right, and in a situation like this, it's not just about medical procedures, is it? You're also dealing with a grieving landlord, someone who's probably in shock.
Absolutely. You have to be able to communicate clearly and compassionately, address their concerns, explain what you're seeing, and offer support.
All while maintaining professionalism and following protocol.
Exactly. It's a delicate balance.
It must take a lot of emotional strength to handle these kinds of situations, knowing there's nothing you can do medically, but still needing to be there for the people involved.
It does. First responders see a lot of difficult things, and being able to compartmentalize and focus on the task at hand is essential.
All right, ready for one more before we move on?
Bring it on.
Scenario 2. We're calling this one the routine check gone wrong. I think a lot of people will be able to relate to this one. Imagine you check on your elderly father every day, and one day you find him unresponsive.
That's scary.
That's the situation here. A son finds his 85-year-old father unresponsive, and we're called to the scene. So what are our priorities in a case like this?
Well, we have an unresponsive patient, but we don't know why. Is it a stroke, a heart attack, a diabetic emergency? We need to figure that out fast.
And to make things even more complicated, this particular patient has a complex medical history.
Yeah, that's always a factor.
I'm thinking that knowing his background, his medications, his previous conditions, that's going to be crucial, right?
You bet. Understanding that medical history can give us vital clues about what might be causing his unresponsiveness, and it can help us make better decisions about his treatment.
So it's like having extra pieces of the puzzle, but you still have to figure out where they fit.
It's
Now, hold on to your hats, folks, because this scenario throws us a curveball. The patient initially responds to treatment, but then rearrests during transport.
Oh boy.
Talk about a roller coaster.
Yeah.
What does this tell us about the nature of emergency medicine?
It tells you that things can change in an instant. You think you've stabilized the situation, and then bam, you're dealing with a whole new set of challenges.
So you can never really let your guard down, can you?
Nope. You got to stay vigilant, anticipate complications, and be ready to adapt to whatever comes your way.
Wow, this is already so insightful. I'm starting to understand just how much goes into every decision a paramedic makes.
It's more than just procedures. It's about being a medical detective, a problem solver, and a compassionate caregiver all rolled into one.
This is incredible. We've covered so much already, from hit and runs to unresponsive patients, but we're just getting started. There is so much more to unpack, so stay tuned for part 2 of our deep dive into emergency scenarios, where we'll delve even deeper into the details and uncover the critical thinking skills that paramedics use every single day.
You know, it's really incredible just how quickly things can shift in an emergency situation. One minute you think you've got it all under control, the next you're dealing with a whole new set of challenges.
Yeah. That's what makes these scenarios so gripping. Okay, before we jump back into the individual cases, I wanted to touch on something I noticed in the source material. There's a lot of talk about communication, and not just with dispatch in the hospital, but with the people at the scene.
Right.
Why is clear communication so crucial in these situations?
That's a great point. Effective communication, it really is the backbone of emergency medicine. And it's not just about relaying medical information, it's about so much more.
Like what?
Well, first and foremost, it's about building trust with the patient and their family, especially when they're going through something as stressful as a medical emergency. Imagine being that worried wife in the persistent vomiter scenario. Clear, compassionate communication from the paramedics can make a world of difference in how she handles the situation.
It's like you're not just treating the patient's physical condition, you're also acknowledging their emotional state and the anxieties of everyone around them.
Exactly. It's about recognizing that everyone involved is a human being and treating them with dignity and respect even amidst all the chaos. And from a more practical standpoint, clear communication makes sure everyone is on the same page, working together towards the same goal. It can also help de-escalate any potential conflicts or misunderstandings and create a safer environment for everybody involved.
So in a way, good communication is almost like a safety net, right?
Exactly.
It helps prevent things from spiraling out of control. Okay, let's get back to those scenarios. In that hit and run case, there was a mention of something called trauma tour. I'll admit, that's a new one for me.
Yeah. TOR stands for Trauma Operating Room. It's basically a way for paramedics to give the hospital a heads up when they're bringing in a trauma patient with potentially life-threatening injuries.
So in that scenario, with the tire tracks and the possibility of cardiac tamponade, they would activate a trauma tour.
Absolutely. They're letting the hospital know, hey, we've got someone coming in who needs immediate surgical intervention. Get the OR prepped, assemble the team. We need all hands on deck.
Wow, so it's like a coordinated effort between the paramedics and the hospital.
Exactly. Time is of the essence in trauma cases, and having everything ready to go when the patient arrives can significantly increase their chances of survival.
It really is a team effort.
It is.
Okay, let's go back to scenario 4, the persistent vomiter. You mentioned earlier that getting a detailed history of his symptoms is crucial. What kind of questions would you be asking in this situation?
I'd want to know exactly how long he's been vomiting, the frequency, the volume, whether there's any blood or bile present, and of course we need details about the pain. Is it sharp, dull, constant, intermittent? Where exactly is it located? Getting those specifics can really help us narrow down the possibilities.
So those details can help you differentiate between, say, a simple case of food poisoning and something more serious like appendicitis.
Exactly. Even seemingly insignificant details can be super important. For example, if the vomit has a fecal odor, that could be a sign of a bowel obstruction, which is a surgical emergency.
Wow. It's amazing how you guys can piece all that information together like a medical puzzle.
It's all about pattern recognition and connecting the dots. And of course, we can't forget about constantly reassessing the patient throughout transport.
Right, because things can change so rapidly in these situations.
Absolutely. We're constantly monitoring their vital signs, watching for any changes in their condition, and adjusting our treatment plan as needed. In this particular case, the patient's sudden decline into VSA really highlights just how quickly things can go south.
And speaking of ESA, I remember there were a couple of specific cardiac rhythms mentioned, PEA and asystole. Earlier, you gave us a great explanation of what those rhythms mean, but I'm curious about the interventions. What steps would you take if a patient went into PEA versus asystole?
Well, both PEA and asystole are life-threatening rhythms that require us to start CPR and defibrillation immediately. But as you mentioned, there are some key differences in our approach. With PEA, we're also focused on identifying and treating any underlying reversible causes.
So you're not just trying to get the heart beating again, you're also looking for the root of the problem.
Exactly. We might need to address things like hypovolemia, hypoxia, or electrolyte imbalances, depending on the situation. With asystole, on the other hand, the focus is more on high-quality CPR and administering epinephrine to try and stimulate some kind of electrical activity in the heart.
So it's like two different strategies for two different types of cardiac arrest.
Exactly.
Okay, let's move on to scenario 3, the unresponsive tenant. We talked earlier about the sensitivity required when you're dealing with a deceased individual and a grieving family member. But from a purely medical standpoint, what are some of the specific signs that paramedics look for to confirm that someone has, in fact, passed away?
Good question. Paramedics are trained to recognize what we call obvious death criteria. These are signs that indicate a person has been deceased for some time. One of the most obvious is rigor mortis, which is the stiffening of the body after death. Another is dependent lividity, which is the pooling of blood in the lowest parts of the body due to gravity. And then there are other signs, like the absence of a pulse, breathing, and pupillary response.
So those signs are present, you know that resuscitation efforts would be futile.
That's right. In those cases, we shift our focus to confirming the death, preserving the scene, and notifying the appropriate authorities.
Okay, let's move on to scenario 2, the routine check gone wrong. This one involved an elderly patient with a complex medical history, and it mentioned that he has an enlarged prostate.
Right.
Why would that detail be included in the scenario? It seems kind of unrelated to the fact that he's unresponsive.
That's a great observation, and it highlights how seemingly unrelated medical conditions can actually have a big impact on how a patient presents in an emergency. An enlarged prostate can lead to urinary retention, which can cause a buildup of toxins in the body.
Oh, I see.
And those toxins can actually contribute to confusion or altered mental status, which could explain why the father was unresponsive in the first place.
Ah, that makes sense.
Yeah.
So it's not just about treating the immediate problem, it's about taking the whole patient into consideration, their entire medical history.
You got it. It's all about connecting the dots and understanding how different conditions can interact.
This is fascinating. It's like you guys have to be medical detectives, constantly piecing together clues to figure out what's going on.
That's a great way to put it.
Okay, so we've covered hit and runs, persistent vomiting, obvious death, and now a complex medical case involving an elderly patient.
Oh.
What are some key takeaways you want our listeners to remember from this deep dive into emergency scenarios?
I think the biggest takeaway is just how much skill, knowledge, and compassion goes into being a first responder. These men and women are dealing with life or death situations every day, making critical decisions under pressure, and providing care and comfort to people who are often experiencing the worst moments of their lives.
It's easy to forget that when you're watching a medical drama on TV, but these scenarios really bring it home.
They do. Another important takeaway is the importance of clear and effective communication. It's not just about spouting medical jargon. It's about explaining things in a way that people can understand, offering reassurance and validating their feelings.
Right, because in an emergency situation, clear communication can be just as important as any medical procedure.
Absolutely. It can help calm people down, build trust, and ultimately lead to better outcomes for everyone involved.
Okay, we've covered a lot of ground in this episode. From hit and runs to unresponsive patients, we've really gotten a glimpse into the world of emergency medicine. But we're not done yet. There's still some loose ends to tie up and some final thoughts to share, so be sure to join us for part 3 of our deep dive into emergency scenarios. Welcome back to the show. Everyone, I hope you've got your thinking caps on because we're about to wrap up our deep dive into emergency medical scenarios. And I have to say, I am blown away by the complexity and the nuance involved in this field.
It's definitely more than just meets the eye.
Right. It's not all about rushing to the scene with sirens blaring. There's so much critical thinking, decision-making, and compassion that goes into every single case.
It's a truly unique blend of skills.
Okay, before we get to the big picture takeaways, there's one more detail from the scenarios that I just have to bring up. It's something that might seem small, but it really got me thinking. In the case where the son finds his elderly father unresponsive, it mentioned that the patient had an enlarged prostate. Now, on the surface, That seems totally unrelated to the immediate emergency. But I'm guessing there's a reason that detail was included in the scenario.
You're absolutely right to question that. It's a perfect example of how what might seem like an unrelated medical condition can actually play a significant role in an emergency situation. An enlarged prostate can lead to urinary retention, which in turn can cause a buildup of toxins in the body.
Okay, I see where you're going with this.
And those toxins can actually contribute to things like confusion or altered mental status, which could explain why the father was unresponsive.
So it's not just about treating the immediate symptoms, it's about looking at the patient's overall health picture, their entire medical history.
Exactly. It's like putting together a puzzle where every piece, even something seemingly unrelated, can provide a crucial clue.
That's fascinating. It really highlights how observant and how knowledgeable paramedics have to be.
They do. It's one of the things that makes their job so challenging and rewarding.
Okay, so we've covered a lot of ground today. Hit and runs, persistent vomiting, obvious death, and complex medical cases. What are some of the biggest things you want our listeners to walk away with from this deep dive into emergency scenarios?
Well, first and foremost, I hope people come away with a deep appreciation for the incredible work that first responders do every single day. They're out there on the front lines dealing with life or death situations, making split-second decisions, and providing care and comfort to people in our most vulnerable moments. It's a demanding job, both physically and emotionally, and they deserve our utmost respect and gratitude.
Couldn't agree more. These scenarios have really opened my eye into the challenges they face.
And another thing I hope people take away from this is the importance of communication. In an emergency situation, clear, concise communication can truly be a lifesaver. It's about making sure everyone is on the same page, understanding the situation, and working together towards a common goal.
And it's not just about the technical medical stuff, right? It's also about communicating with compassion and empathy.
Absolutely. It's about putting people at ease, reassuring them, and helping them feel safe and cared for, even in the midst of a crisis.
Okay, we've explored some pretty intense scenarios today, and I have to say, I'm walking away with a whole new level of respect for the work paramedics do. They're not just first responders, they're medical detectives, problem solvers, and compassionate caregivers, all rolled into one.
Well said.
So to all the paramedics out there listening, thank you for everything you do. You are true heroes. And to our listeners, thank you for joining us on this deep dive into the world of emergency medicine. Until next time, stay safe and be prepared. All right, strap in, everyone. Today we're diving headfirst into the world of emergency response. You've given us Scenario Book version 8. It's the training manual they use to put EMTs through their paces. And let me tell you, these scenarios are intense. We're talking like hikers collapsing on trails, construction site chaos, even a concert venue plunged into pandemonium.
Yeah, it's a fascinating look into the high pressure world of first responders. What really strikes me is how these scenarios, they go beyond just, medical knowledge. They really force you to think on your feet,
Yeah.
make critical decisions under pressure.
Yeah, exactly. So today we're going to be your guides as we break down these situations. We're going to figure out what's crucial for quick thinking and effective action when every second counts. And trust me, we're going to uncover some surprising insights along the way.
Yeah, what's interesting is how each scenario presents this unique puzzle, with these subtle clues and vital signs telling a story. It's like we're playing detective, piecing together the information, trying to understand what went wrong and how to respond effectively.
Okay, so let's jump right into our first scenario, the unresponsive hiker. We've got a 56-year-old male found unconscious on a hiking trail, 3/4 of a kilometer from the entrance. A bystander called 911 but can't wake him or move him. Now, right off the bat, we see the bystander did the right thing calling for help. But there's a detail here that kind of makes me wonder. They rolled the hiker over. What if there's a spinal injury?
That's a great point. The scenario doesn't actually specify the hiker's position when they were found, but moving someone with a potential spinal injury, it can have some serious consequences.
So EMTs arrive. They assess the scene as safe and immediately request assistance from the fire department, likely for help with moving the patient given the location. But here's where the alarm bells start ringing. The hiker's unresponsive, no pulse, not breathing, and his skin is pale with that bluish discoloration cyanosis. Chest, abdomen, back, legs, arms.
Right. So cyanosis itself, it's not a diagnosis, but a sign. And in this case, with the widespread modeling and the lack of vital signs, it could point to a severe lack of oxygen, potentially from a cardiac event or a respiratory issue. The fact that it's affecting so many areas, that's particularly concerning.
And the bystander has no idea how long he was down. That unknown time frame, it adds another layer of complexity.
Absolutely. It makes it really difficult to determine the extent of the potential damage or what interventions might be most effective at this point. It really underscores the importance of those public awareness campaigns, about basic first aid and recognizing the signs of a serious medical emergency. Early intervention can make a world of difference.
Okay, so we've got this hiker down and in bad shape, but hold on. There's a second unresponsive hiker scenario in this training manual. Almost identical. Same age, same trail, same symptoms. Makes you wonder, is this just a coincidence? Or is there something more going on here?
Yeah, it's a fascinating question, isn't it? The scenarios themselves, they don't offer any information about environmental factors like extreme heat or toxic plant exposure, but those are certainly things EMTs should be considering. Sometimes the most obvious clues are the ones that are missing.
Yeah, it's like a real-life medical mystery, right?
Yeah.
Two seemingly healthy hikers collapsing on the same trail. Yeah. It definitely makes you think twice about the hidden dangers lurking out there.
It emphasizes the importance of situational awareness. For both hikers and first responders, EMTs need to be attuned to their surroundings, considering all potential factors, that could be contributing to a patient's condition.
All right, let's shift gears now to a scenario that hits closer to home. The unspoken goodbye. We're called to a house where an 87-year-old man has been found unresponsive in his hospital bed by his wife.
Okay, so the presence of a hospital bed in the home, it already suggests a pre-existing medical condition, right? And a certain level of ongoing care.
Yeah, and it's not just any medical condition. There's evidence of home dialysis equipment, which points to end-stage renal disease, meaning his kidneys are failing. The scene is safe, he's unresponsive, no pulse, not breathing. But there's a DNR available. Now, instead of simply defining DNR for our listeners who are already familiar with the term, let's talk about the implications. What are some of the challenges EMTs face when encountering a DNR in a situation like this?
It's a sensitive situation that goes beyond medical procedures. You have a grieving wife who's just lost her husband, and while the DNR is a legal document, it doesn't negate the emotional weight of the situation. EMTs need to navigate that very carefully, offering comfort and support while respecting the patient's wishes. It's a delicate balance.
His physical exam shows extreme pallor and cyanosis, particularly in his face.
Yeah.
His wife tells EMTs that her husband has been suffering from kidney failure for years and has been receiving palliative care for the past few months. It sounds like the situation is less about trying to save a life and more about ensuring a peaceful and dignified passing.
Absolutely. The focus shifts from medical intervention to emotional support and respecting the patient's autonomy. It really underscores the importance of having those difficult conversations about end-of-life care wishes. Before a crisis occurs, having a DNR in place, it can alleviate a lot of stress and uncertainty for both the patient and their loved ones.
Okay, now let's head to a construction site for scenario number 8, the construction site crisis. We've got a 59-year-old male about to climb scaffolding when he suddenly becomes weak, vomits, and starts pointing to his head. Difficulty breathing, pale, cool, and clammy skin. The foreman tells the EMTs that he's been having health issues and was recently put on blood thinners for a leaking heart valve.
Wow, so that history from the foreman, that changes everything. We've gone from like a vague scenario to a potential cardiac event, possibly complicated by the blood thinner.
And his vitals are all over the place. Heart rate 46 and weak and irregular. Respiratory rate 24 and erratic. Blood pressure through the roof at 150 over 110. This is a puzzle where every piece of information is critical.
Yeah, you're absolutely right. The scenario, it doesn't specify what type of blood thinners he's on, but some can have serious side effects. Combine that with his pre-existing heart condition and these symptoms, and you've got a situation that could deteriorate really rapidly.
It really highlights the importance of gathering a thorough history from bystanders. They might hold the key to unlocking the puzzle and guiding the EMTs towards the right treatment decisions. Yeah, these training scenarios, they really showcase how every detail, every piece of information gleaned from the scene or bystanders, it can just drastically shift the direction of treatment. Talk about pressure.
It's a constant reminder that that in emergency medicine, assumptions can be dangerous. You got to stay vigilant, adaptable, and ready for anything.
Speaking of adaptability, our next scenario takes us from a construction site
Hmm.
to a seemingly quieter office setting. But don't let that fool you. This one is titled The Silent Sufferer, and it's a stark reminder that
Sure.
that emergencies can strike anywhere.
Yeah, offices.
Like,
Well, generally considered safe environments.
yeah,
They can lull people into a false sense of security. The reality is medical emergencies, they don't discriminate based on location.
exactly. We're called to an office building where a 42-year-old woman has been found unresponsive at her desk. Her coworkers mentioned that she had complained of a headache earlier, but they didn't think much of it at the time. I think this highlights how we often dismiss seemingly minor symptoms, but they can be warning signs.
Yeah, it's a good point. Headaches are they're incredibly common, but they can also be a precursor to something more serious, especially if they come on suddenly or are accompanied by other symptoms. In this case, the fact that she became unresponsive, that's a huge red flag.
So EMTs arrived to find her slumped over her desk. No response, no breathing, and a weak, irregular pulse. Her skin is pale and clammy, pupils dilated. These aren't just isolated signs. They paint a picture of a body in distress.
You're reading the signs like a true EMT: pale, clammy skin, and dilated pupils. They can be indicative of shock or a neurological event like a stroke. The irregular pulse adds another layer of complexity, suggesting a possible cardiac issue as well.
They immediately start CPR and attach an AED. The AED analyzes her heart rhythm and advises a shock. This is where that rapid response is absolutely critical.
Absolutely. Sudden cardiac arrest, it can happen to anyone, anywhere. And those first few minutes are crucial. The fact that the AED advised a shock, it suggests her heart was in a shockable rhythm, which is a good thing. It means there's a chance of restoring a normal heartbeat.
They deliver the shock, resume CPR, and thankfully, her pulse returns. But she remains unresponsive. This must be a roller coaster of emotions for everyone involved.
Yeah,
Right.
it's a testament to the power
Yeah.
of early intervention, but the fact that she's still unresponsive, it indicates a serious neurological concern. You know, it's a reminder that surviving cardiac arrest is only half the battle. The brain can be significantly impacted by the lack of oxygen.
They quickly prepare her for transport, and now the focus shifts to getting her to the hospital for advanced care. This scenario really brings home the importance of having AEDs readily available in public spaces.
Couldn't agree more. AEDs are they're user friendly, and they can literally be the difference between life and death. I can't stress enough how crucial it is for everyone to learn CPR and familiarize themselves with AEDs.
All right, let's move on to a scenario that unfolds in the heart of a bustling city, the commuter crisis.
Picture this: rush hour in a crowded subway station, people rushing everywhere, and suddenly a man collapses on the platform.
Ah, the subway, a microcosm of city life. It's fascinating how these scenarios, they really capture the essence of their settings. High traffic areas like subways, they present unique challenges for EMTs.
It's not just the crowds, it's the noise, the limited space, the potential for panic. In this case, a 60-year-old man is down, unresponsive, no pulse, no breathing. They immediately start CPR and call for backup. But the AED analyzes his heart rhythm and advises no shock.
Okay, that's significant. It means his heart rhythm isn't shockable,
Yeah.
which could point to a different type of cardiac event or an underlying medical condition. A bystander tells them that the man clutched his chest before collapsing, which suggests a possible heart attack. While they continue CPR and prep him for transport, they're navigating a sea of people trying to get him to the ambulance. This scenario, it really emphasizes the logistical challenges of providing care, in a crowded public space.
Yeah, it's a testament to the training and composure of EMTs. They have to remain focused and efficient, delivering critical care while coordinating with other responders and navigating a chaotic environment.
Now, remember that rock concert venue from earlier, the one with the special effects mishap? Well, we're heading back there. Same venue, different event.
Yeah.
But this time the chaos is of a whole different kind. Get ready for the encore emergency.
So a recurring location. I'm intrigued. The venue itself might not be inherently dangerous, but it seems to attract its fair share of emergencies.
This time, it's a sold-out rock concert. The band is on stage for their encore. The crowd is going wild. And suddenly, a 25-year-old man near the front collapses. Security reaches him quickly and calls for medical assistance. But even getting to him through that crowd, it must be an ordeal.
Crowd dynamics are a fascinating aspect of emergency response. Large, excited crowds can be they can be unpredictable and challenging to manage, especially in a concert setting with loud music and limited visibility.
EMTs arise to find him unconscious. Rapid, weak pulse, shallow, irregular breathing, pale, sweaty skin. Classic signs of a medical emergency, but what's the cause?
That's the million-dollar question, right? It could
Yeah.
be anything from a heart condition to a seizure, dehydration, even a drug overdose, without any witnesses or a prior history. It's like trying to solve a puzzle with missing pieces.
They load him onto a stretcher and signal for the music to be stopped. That must be a surreal moment, the music cutting out, everyone realizing something serious is happening. As they reach the backstage area, he regains consciousness. Disoriented and confused, no memory of what happened, just that feeling of being hot, lightheaded, and then everything going black.
So that's consistent with syncope or fainting. It could be something as simple as dehydration or low blood sugar, but it could also be a sign of an underlying heart condition.
They load him into the ambulance and continue monitoring his vitals as they transport him to the hospital. This scenario, it highlights the importance of communication and coordination in a large-scale event.
Absolutely. EMTs have to communicate effectively with
She said,
venue staff, security personnel, and other responders, all while dealing with a potentially agitated crowd and a high-pressure situation.
okay, let's take a break from the chaos of that concert and head back to that hiking trail where we started. Remember those two unresponsive hikers? Well, this scenario, titled The Trail's Toll, it delves deeper into the mystery. And it turns out those hikers weren't alone.
Oh, a recurring theme with a twist. I'm all ears. It seems like this trail is becoming a hot spot for emergencies.
Yeah, it's a beautiful, popular trail. But lately, it's been plagued by a string of incidents. 3 hikers found unresponsive within a week, all exhibiting similar symptoms: weakness, confusion, difficulty breathing, and that telltale cyanosis. This time, the EMTs are on high alert, suspecting something more than just isolated incidents.
Right, that pattern. It's definitely cause for concern and suggests a possible environmental factor at play, something affecting multiple hikers on the same trail.
Yeah, the scenarios that they don't provide any specific details about the environment, which is frustrating. But it forces us to think like the EMTs on the scene. What would we be looking for? What questions would we be asking?
Right, so we'd be looking for any commonalities between the hikers. Did they all drink from the same water source? Were they exposed to any unusual plants or insects? Was there a recent pesticide spraying in the area? We'd also want to know about the weather conditions, particularly temperature and air quality.
It's like piecing together a giant puzzle.
Yeah.
Looking for that one missing piece that explains everything. And in this case, that missing piece, it could be the key to preventing future incidents.
Yeah, it highlights the importance of a thorough scene assessment, going beyond just the immediate patient care, and considering the broader context. Sometimes the most valuable information is found outside the ambulance.
Okay, let's move on to a scenario.
Yeah.
That takes us from the great outdoors to the confined space of an elevator. This one is titled The Elevator Plunge, and it's as terrifying as it sounds.
Elevators, they're generally safe, but when they malfunction, the consequences can be catastrophic. I'm bracing myself for this one.
We're called to a high-rise office building, where an elevator carrying 4 passengers plummeted several floors. Before coming to a jarring halt, the scene is chaotic, with panicked office workers and the piercing sound of alarm.
Yeah, the sudden deceleration of an elevator can cause a variety of injuries, from sprains and fractures to internal bleeding and head trauma. The psychological impact, that can be just as severe, with passengers experiencing intense fear and anxiety.
EMTs arrive to find the elevator doors jammed shut, the passengers trapped inside. Communication is limited, but they can hear cries for help and the sounds of distress. They immediately request assistance from the fire department for extrication, knowing that time is of the essence.
Right. So in a situation like this, the EMTs, they're working against the clock. They need to assess the situation, stabilize the scene, provide immediate care, while coordinating with the fire department to safely extricate the passenger.
The fire department arrives and begins the arduous task of prying open the elevator doors, while EMTs prepare for the worst. setting up a triage area and requesting additional ambulances. The tension is palpable as they wait for access to the trapped passengers.
Yeah, this is a prime example of how different emergency services they have to work together seamlessly in a high stakes situation. Clear communication, coordination, and a shared understanding of the priorities. Those are essential.
Finally, after what feels like an eternity, the doors are open,
Mm.
and the EMPs get their first glimpse inside. The scene is grim. The passengers are battered and bruised, their faces pale with fear and pain.
This is where this is where the EMT's training and experience truly come into play. They have to quickly assess the situation, identify the most critical injuries, and prioritize care in a confined and challenging environment.
Patient 1 is a 40-year-old woman, conscious but clearly in shock. She's complaining of severe back pain and difficulty breathing.
Okay, so back pain and difficulty breathing. That could indicate a spinal injury or internal bleeding, both potentially life-threatening conditions. She needs to be immobilized and transported to the hospital ASAP.
Patient 2 is a 50-year-old man with a visible deformity to his left leg and a deep laceration on his forehead.
Right, a leg deformity suggests a possible fracture, while the laceration on his forehead could be a sign of head injury. He needs to be stabilized, his bleeding controlled, and his spine immobilized before transport.
Patient 3 is a 20-year-old woman who appears to be in the best condition, conscious and alert, but complaining of a sore neck and a tingling sensation in her fingers.
So even though her injuries seem less severe, the tingling sensation in her fingers, that's concerning. It could be a sign of a nerve injury or a spinal cord compression. She needs a thorough neurological assessment and careful monitoring.
And lastly, patient 4, a 60-year-old man is unconscious and unresponsive.
Unconsciousness is always a red flag, indicating a serious medical condition. He needs immediate attention and advanced life support measures.
The EMTs work quickly and efficiently, triaging the patients, providing basic life support, and preparing them for extrication. It's a delicate operation, moving injured patients from the confined space of the elevator to the waiting ambulances.
This scenario is a powerful reminder of the importance of emergency preparedness, both on an individual and a societal level. Having a plan in place for unexpected events, knowing basic first aid, and being aware of your surroundings, it can make a world of difference.
Absolutely, emergencies can happen anywhere, anytime, and it's up to us to be prepared to face them. It's incredible how these scenarios, they really drive home the point that danger can lurk anywhere. From the serene beauty of a hiking trail to the everyday convenience of an elevator, it really makes you appreciate the constant vigilance required of first responder.
It's a reminder that we often take safety for granted, until something goes wrong. These scenarios force us to confront those vulnerabilities and think about how we would react in a crisis.
Okay, so let's switch gears again and dive into a scenario that's unfortunately become all too familiar in today's world.
The concert chaos. Now, we've already explored the impact of the special effects mishap at this venue, but this time the chaos takes on a much darker and more deliberate form.
Yeah, concert venues with their large crowds and often heightened emotions, they can sadly become targets for violence. It's a sobering reminder of the world we live in.
We're called to the scene of a reported explosion at a concert venue.
Yeah.
And as EMTs arrive, they're met with absolute pandemonium. Police and security are struggling to contain a panicked crowd. Sirens are wailing, and the air is thick with smoke and the smell of fear. It's a sensory overload that can be overwhelming, even for seasoned first responders. The key is to fall back on their training. Block out the noise and focus on the task at hand.
They quickly learned that there was indeed an explosion, not a pyrotechnics mishap this time, but a deliberate act. The initial assessment reveals multiple casualties with a range of injuries, some minor, some clearly life-threatening. This is where those mass casualty incident protocols they kick in.
Absolutely, triage becomes paramount in a situation like this. EMTs have to make rapid decisions, prioritizing patients based on the severity of their injuries and the limited resources available.
They identify 4 patients in urgent need of care. Patient 1 is unconscious, no breathing, but has a palpable pulse, a large laceration on their head, and a deformed lower leg. They paint a grim picture.
That's a red triage, no question. The head injury and potential leg fracture, they suggest significant trauma, and the lack of breathing
Right.
requires immediate intervention.
Patient 2 is conscious, but struggling to breathe. Their chest wall moving erratically. They have multiple rib fractures, creating that paradoxical chest movement known as flail chest, a contusion on their face and blood trickling from their nose. They add to the picture. Another red triage. Flail chest can severely compromise breathing, and the facial injuries suggest a possible head injury as well. Patient 3 is conscious, but their leg is bent at an unnatural angle, the bone clearly protruding through the skin. A compound femur fracture, no pulse in their foot, and a profusely bleeding laceration on their forearm.
So that's a critical situation. The compound fracture and the lack of pulse in the foot.
Yeah.
They suggest significant vascular damage, potentially limb-threatening, another red triage, requiring immediate intervention to control bleeding and stabilize the fracture.
And lastly, patient 4 is conscious, clutching their chest, breathing rapidly and shallowly. They have a possible clavicle fracture and are showing signs of respiratory distress.
Okay, so this patient, while injured, appears to be the most stable of the 4. The clavicle fracture is likely painful, but not life-threatening. And the respiratory distress could be due to pain and anxiety. This would be a yellow triage, meaning they need care. It can be delayed while the more critical patients are treated.
It's a horrific scene, a stark reminder of the fragility of life and the devastating impact of violence. The concert venue, once a place of joy and music,
now echoes with the cries of the injured and the frantic efforts of first responders.
This scenario really underscores the need for comprehensive security measures at large public gatherings. It also highlights the importance of public awareness campaigns, about what to do in an active shooter or bombing situation. Those first few minutes can be crucial for survival. It's a sobering thought. But as we've seen throughout these scenarios, preparedness is key. Knowing what to do in an emergency, having a plan, and being able to think clearly under pressure can truly make a difference.
It's not about living in fear, but about empowering ourselves to face the unexpected. These scenarios, while intense and often disturbing, they serve as valuable reminders of the importance of vigilance, preparedness, and the
incredible courage.
And the incredible courage of those who respond to these crises.
Well said. And as we wrap up this deep dive into the world of emergency response, I think it's important to acknowledge the toll these situations take on the first responders themselves. Imagine witnessing this level of trauma day in and day out. It's going to leave a mark.
Yeah, it's an aspect we often overlook. First responders are exposed to a level of human suffering that most of us can't even fathom. The emotional and psychological impact. It can be significant.
They're the ones running towards danger, putting their own lives on the line to save others. It's a level of selflessness and dedication that deserves our utmost respect and gratitude.
Absolutely. They're the silent guardians, the everyday heroes who walk among us, ready to answer the call no matter how challenging, how dangerous, how heartbreaking the situation may be.
So to all the first responders out there, thank you. Your courage, your compassion, and your unwavering commitment to helping others, it inspires us all. And to our listeners.
Yeah.
We hope this deep dive has provided you with a
valuable insights, a renewed appreciation for the complexities of emergency response, and perhaps even a spark of inspiration to learn more about how you can be prepared to face the unexpected. Until next time, stay safe, stay informed, and keep exploring.
All right, so get ready, because today we're diving deep, really deep, into some pretty intense emergency medical scenarios.
Oh, yeah.
We're not talking your typical textbook stuff here.
Yeah.
This is like choose your own adventure, but for, paramedics.
Right.
We've got a potential heart emergency after a car crash, a mystery illness that, it leaves the patient vomiting and barely conscious.
Yeah.
And then how about this? A scenario with a gambling addict found hanging in a basement. Pretty intense stuff, right?
Definitely.
But that's not all. We've also got these expected actions sections. You can test your own decision-making in these situations. See how you'd handle the pressure.
It's fascinating, really. They aren't just medical puzzles, these scenarios. No. They give you a glimpse into how first responders have to think on their feet, making those big decisions with, often very limited information.
Absolutely.
Okay,
let's jump right in, shall we?
Let's do it.
Scenario number 6 starts with a 22-year-old male found hanging in a basement, found by his sister. Police and fire are already on scene, so you know it's serious. The patient's unresponsive, no pulse, not breathing, and his skin has that bluish tint. Cyanosis, right.
Right.
There's blood pooling in his face. Don't know how long he's been there. Grim situation. Just imagine what his sister must be going through, finding him like that.
It's a tough one for sure. And in a potential suicide like this, well, scene safety is absolutely paramount. Could be other hazards present. Responders need to be so careful even before approaching the patient. And the signs you mentioned, the cyanosis, the blood pooling, well, it's not a good sign.
No. And to add to this, we learned that he had a history of gambling addiction and depression. He recently started on antidepressants, but we don't know for how long. Could that be a factor?
It's impossible to say for sure from just the scenario, but any recent medication changes, there are always red flags for EMTs. They'd want to dig into that. The scenario also mentions a systole. No heartbeat for 3 analyses. They've got trauma or access, meaning they can go straight to the operating room if needed. But, well, in a situation like this, with such clear signs of death, it's a complex decision, whether to initiate CPR or not.
It's a heavy decision, that's for sure. Okay, let's switch gears a bit. Scenario number 2. We're in a park, it's freezing, and there's an elderly man on a bench. Confused, disoriented.
Uh-oh. Right away, that cold weather, it's a huge red flag, especially for someone elderly, and he's in pajamas and slippers, so clearly not dressed for the elements, could have been exposed for a while, and that's where the danger of hypothermia comes in. People think it's only in blizzards, but it can happen even when it's not that cold, really.
And his vitals are already showing signs. Low heart rate, low blood pressure, skin is pale and like ice cold.
Yeah.
Like his body's shutting down. No idea how long he's been out there or if he has any other medical conditions.
So the question is, what do you do? The expected actions for this one, they really highlight rapid rewarming. Get those wet clothes off, wrap him in blankets, even warm IV fluids if needed. It may sound simple, but it's crucial to get that body temperature back up.
There's even a note about taking off his gloves before using the pulse oximeter because cold fingers can mess up the reading.
That's right.
It's these little things that can make all the difference. Get ready for a total change of scene.
Hit me.
Scenario 5 takes us to a single vehicle crash. 1 in the morning. A small car slammed into a parked truck. We've got a 20-year-old male driver, unconscious behind the wheel.
1 in the morning. Tells you a lot, just that time. And fluids leaking from the car, and a needle found on the passenger seat. Lots of unknowns right off the bat.
It's like a medical mystery, trying to piece together those clues.
It is.
Driver has a weak pulse, breathing's irregular, and that bluish tint to the skin again. Cyanosis.
Cyanosis, yeah. In this case, combined with the type of crash, you start to worry about chest trauma, how that might be affecting his breathing.
5 minutes in, things take a turn. He goes into PEA arrest. And the notes mention something called Beck's triad. Can you break that down for me? Like I'm right there with the patient.
Okay, so imagine you're listening to his heart and the sounds are distant, muffled, almost like it's underwater. That plus the low blood pressure and maybe some bruising on his chest. That's Beck's triad. 3 signs that could mean cardiac tamponade.
Cardiac tamponade. Okay, I'm going to need a little more on that.
It basically means blood or fluid is filling the sac around the heart, squeezing it so it can't pump effectively.
So if they suspect tamponade, what can they even do at this point?
Well, this would be a traumatic arrest, so the treatment is pericardiocentesis. They use a needle to drain the fluid from around the heart, relieve that pressure. It can be a real lifesaver.
Wow. Intense. Things can escalate so quickly. Okay, let's move on to scenario number 10. This one, the 55-year-old woman complaining of severe abdominal pain and heart palpitations.
Right away, you can tell she's in distress. Restless, clutching her stomach, pale, sweating profusely, must be in a lot of pain.
And she has a history of anxiety. Plus, she's on medication for hypothyroidism and high cholesterol, so there's already a lot to consider.
Absolutely. Knowing her medical history is vital. It helps them understand what's happening now and any underlying factors.
10 minutes into this scenario, things get worse. Her level of consciousness drops, and she starts vomiting. Seems like a big shift.
It is. Could be that whatever's causing the abdominal pain is getting worse, or a whole new problem entirely.
Her airway is compromised, pulse is racing. What happens next? What's going through the EMT's mind?
When a patient's condition changes like that, you have to reassess. Airway, breathing, circulation, Making sure she has a clear airway becomes priority number one.
And they also need to figure out the vomiting, the rapid heart rate, right?
Exactly. Could be the pain, could be something else entirely. Have to consider everything.
It says her breathing is really fast, too. They have to coach her to control it. There's even a note about potential tension if she refuses.
That's a tough one, a very real challenge. Patients have the right to refuse treatment, even when they're in distress. But the EMTs have to act in their best interest. It takes clear communication and empathy, all while making sure the patient understands, can make informed decisions.
Okay, final scenario for this part of the deep dive. We're going back to scenario number 2, but with a twist.
A twist. Okay, I'm listening.
Still on that dark roadway, 11 at night, but instead of the elderly man, we've got a man who's been hit by a car.
Oh, that's different. Nighttime scene on a roadway, right away you're thinking about safety for the patient and for the responders.
All we know is there's a lot of blood. Ominous.
Definitely suggests a serious injury.
He's unresponsive, no pulse, and this is chilling large tire tracks across his chest.
Wow. That's a powerful visual. And, right away, high energy impact, very serious, likely life-threatening injuries.
The scenario mentions trauma TOR criteria. Remind us what that means.
TR stands for trauma operating room. If the patient meets certain criteria, indicating a critical injury, the EMTs can bypass the ER, go straight to the OR.
So in this case, with the tire tracks, no pulse, unresponsive, he'd probably qualify for immediate transport to the OR.
Most likely, yeah. The goal is to get him into surgery. Now, every second counts.
It's incredible, isn't it? Even though they're fictional, these scenarios show you those split-second decisions, the pressure EMTs are under. It's like being a detective, a medical MacGyver, and a therapist all in one.
You got it. Resourceful, adaptable, compassionate, all in this high-stress environment where every second matters. That's what makes this deep dive so compelling, I think.
Absolutely.
Welcome back.
It's amazing how different each of these situations is. It really throws a curveball at those EMTs, makes them think on their feet.
It really does. Shows you just how much they need to know, all the skills they have to have.
I'm telling you, being an EMT is like being some kind of medical MacGyver.
Ooh, I like that.
They have to be so resourceful, improvise, think outside the box.
You're right, they do. Make the most of what they've got.
So scenario 5. This one, well, it's a bit of a detective story, wouldn't you say?
You're right, it is. The unconscious driver, the fluids, that needle, it's a real puzzle.
Not a lot to go on. They have to use their assessment skills, their knowledge, to figure out what to do.
Yeah. Limited information makes it so much tougher. Makes it even more important to be systematic, think things through.
So the leaking fluids, the needle, the time of day, it's all a clue.
Every little thing. And then you add in how the patient's presenting, unconscious, weak pulse, irregular breathing. It starts to build a picture.
The scenario mentions how important it is to do a full scene assessment. Why is that so critical?
Well, think about it. Any emergency, but especially one like this where there are so many unknowns, that scene assessment can be crucial. Observe everything, the environment, the vehicle, the patient's position, anything that could help them figure out what happened.
They also talk about considering the potential mechanisms of injury. What would that be in this particular crash?
Well, it's a single vehicle collision, right? Small car into a parked truck.
Hmm.
They'd be looking for blunt force trauma to the chest, the head especially.
Would they also consider if, I don't know, maybe some underlying medical condition might have caused the crash?
Of course.
Yeah.
Did the driver have a seizure, a heart attack, something that made him lose control? It's all on the table.
Now, the expected actions. Talk about rapid extrication. What does that even mean?
Get the patient out of the car, fast but safely. It's essential when you think there are serious injuries, especially if they're trapped or the car's not stable.
In this scenario, he's slumped over the wheel, airbags deployed.
Yeah.
That sounds tricky.
It's a challenge for sure. You have to be so careful, use the right techniques so you don't make things worse while you're getting him out.
They mentioned applying a C-collar. What is that?
C-collar or cervical collar. It's a device that stabilizes the neck, prevents movement in case of a spinal injury.
Protecting the spine while they get him out. Makes sense.
Exactly. You always immobilize the spine in trauma cases until you can rule out an injury.
So once they get him out, what happens next?
Rapid primary assessment. Airway, breathing, circulation, the ABCs, looking for anything that's an immediate threat to life.
Well, he's unconscious, weak pulse, irregular breathing, and that cyanosis. Those are pretty serious, aren't they?
They are. Show you that the respiratory system's compromised, maybe circulation too.
There's also mention of JVD and sternal bruising. Break those down for me.
JVD is jugular vein distension. You'd see it as bulging veins in the neck. Means the veins are having trouble getting blood back to the heart. And sternal bruising, well, that's trauma to the chest.
Right. So those signs, plus the muffled heart sounds, the low blood pressure, it all fits that possible cardiac tamponade, right?
It all points in that direction, yeah.
So now you've got this potentially life-threatening condition on top of everything else from the crash.
Exactly. It's critical.
Then 5 minutes in, he goes into PEA arrest.
It raises the stakes, doesn't it?
What do they do? What are the expected actions here?
Start CPR right away. Try to get that circulation back. Keep monitoring the vitals closely. Look for any changes.
Would they use a defibrillator for PEA?
Not usually, no. With PEA, the heart's electrical rhythm is there. It's just not pumping strong enough. Defibrillation doesn't really help with that.
So it's all about the CPR.
It is. And while they're doing that, they'd be addressing any other injuries too. Chest trauma, internal bleeding, stabilize him for transport.
This one really shows you how fast things can change.
You have to be watching constantly, reassessing, adapting to the situation. Every second matters. That's why the training, the preparation, it's so important.
Okay, let's move on to scenario 10. The 55-year-old woman with the severe abdominal pain and the heart palpitations.
Right. Start off with her in acute distress and a lot of unknowns.
She's restless, pale, sweating, and she's got the pain and the rapid heart rate on top of that.
A lot going on.
It says they should coach her to control her breathing because she's hyperventilating. Why is that so important?
Hyperventilation can actually make anxiety worse, lead to other issues like dizziness, tingling. Coaching her breathing helps calm her down, hopefully relieve some of that.
A simple thing, but it can make a difference.
It can, but there's a note that she might resist the coaching, so how do they deal with that?
That's a tough one. You have to walk that line between giving advice and respecting her autonomy. Explain why it's important, try to get her cooperation.
A balancing act for sure.
About 10 minutes in, she starts to lose consciousness and vomits. That's not good, is it?
It's a big change. Could mean the abdominal pain is getting worse, or it's a new problem entirely. Could be serious.
Her airway's compromised, pulse is rapid, they have to act fast.
Absolutely. Things have escalated. Reassess the ABCs. Make sure she's got a clear airway. That's the priority now.
The scenario mentions suctioning the airway.
Right. If she's vomited and is blocking the airway, you got to clear it, get that airflow back.
They also say get a full set of vitals and a sample history. What's that?
Sample E. It's an acronym that helps them get information. Stands for signs and symptoms, allergies, medications, past medical history, last oral intake, and events prior.
So a snapshot of her condition and her medical background.
Exactly. It helps them figure out what's happening, what might be contributing to it.
She's taking medication for hypothyroidism and high cholesterol. Is that relevant?
Very relevant. Knowing what medications a patient is on is crucial. Could be interactions, side effects, could point to other medical conditions that affect treatment. Plus, it's important information for the hospital.
They mentioned considering rapid transport. Why is that?
Her condition's getting worse. She needs to get to the hospital fast, get more definitive care. EMTs have done what they can, but she needs more than that.
Okay, we've covered a lot, haven't we? Each scenario has its own challenges. Figuring things out with limited information, dealing with patients who are getting worse by the minute.
It really highlights the complexity of emergency care, all the nuances.
I'm starting to really appreciate what these EMTs do. They have to be ready for anything.
You're telling me quick thinking, adaptability, understanding how the body works, how it reacts to trauma and illness. It's a lot.
Let's take a quick break. When we come back, we'll dive into some of the bigger themes, the insights we've gotten from these scenarios. And we're back. I gotta say, my respect for EMTs has just skyrocketed after going through these scenarios. The way they handle this kind of pressure.
It's something else, isn't it?
It is. Okay, back to our last scenario. Scenario 2, remember, but, well, it takes a dark turn this time.
Yeah, the pedestrian hit by a car on that dark road, and right away you're thinking scene safety.
It's their first priority, right? Making sure the scene's safe for them and for the patient.
Absolutely. You're on a road at night, limited visibility, huge risk of another accident. Got to secure the area, make it safe for everyone.
So they position the ambulance to block traffic, I guess. Warn oncoming cars.
Exactly. And they have to be visible, too. Reflective vests, flashlights, anything to make sure they're seen in the dark.
The scenario also mentions identifying hazards. What would they be looking for in this case?
Well, besides the traffic, you've got leaking fluids, broken glass, maybe even down power lines, anything that could be dangerous.
It's a chaotic scene. potentially really dangerous.
That's emergency response for you. You never know what you're walking into. Got to be ready for anything.
And remember, it says there's a lot of blood. Pretty intense description. Makes you realize it's serious.
Yeah, it does. Suggests a major injury. Need to assess and intervene quickly.
Patient's unresponsive, no pulse, and, well, this is the part that gets me, tire tracks across his chest.
Chilling, isn't it? You can just picture that impact. High energy impact. Severe injuries.
The expected actions say do a primary assessment before you even move him. Why is that so important?
Trauma like this, you always worry about the spine. Moving him could make things worse. Stabilize him first, see what you're dealing with, then move him carefully.
So they check his airway, breathing, circulation, all while he's still on the ground.
That's right. Looking for any immediate life threats. Got to address those first.
It mentions using a modified jaw thrust to open the airway. Why not the regular head tilt chin lift?
Well, with a potential spinal injury, you don't want to move the head and neck. Modified jaw thrust lets you open the airway without doing that.
Always protecting the spine.
Always.
Okay, so he meets the criteria for trauma TOR. We talked about it before, but just remind us what that is.
Trauma operating room means they bypass the ER, take him straight to the OR for the most critical patients, the ones who need surgery right away.
So, given everything we know, they'd activate trauma TOR, get him to surgery ASAP.
Sounds about right. Every minute counts in a situation like this.
This one really shows how important it is to communicate clearly with the hospital.
Absolutely. Give them a detailed report. What's his condition? What happened? What have they done so far?
So the hospital's ready when he arrives.
Exactly. Smooth transition of care. That's what gives him the best chance.
Well, that's it for our deep dive into these emergency medical scenarios. I don't know about you, but I feel like I've been through EMT school myself.
Me too. It's been eye-opening, hasn't it? Seeing the world through their eyes, the decisions they make, the pressure they're under.
It makes you realize how skilled they are, how much they know. They're out there literally saving lives.
It's amazing, calm and focused in these crazy situations.
So to all our listeners, we hope you have a newfound appreciation for EMTs. Their dedication, their skill, they're truly heroes.
They are, and maybe this deep dive has inspired some of you. Maybe you'll think about joining their ranks.
That's right. The world always needs more heroes.
It does.
And that's a wrap for today. Thanks for listening. Welcome to our deep dive. You guys ready to unpack some wild EMS training scenarios?
Buckle up, it's gonna be a ride.
Okay, so scenario number 4 jumps right into the action. A 30-year-old woman at home, active labor.
Oh yeah, that's what we call precipitous labor.
Her water broke 2 hours ago. Contractions are coming fast and furious. No way she's making it to the hospital.
It's one thing to read about it, but just imagine being that EMS responder in that situation.
I know, right? Talk about pressure.
You've got limited resources, time is ticking, and you've got to ensure safe delivery.
No kidding. Those details paint a pretty intense picture. She's flush sweaty. Her heart rate's 130. Blood pressure is 140/86.
Classic signs of labor, but definitely amplified in this case.
And the scenario throws in another curveball. She had a healthy pregnancy before.
Right, that's important to know, but each labor is its own unique beast.
Speaking of the baby, they even give us the APGAR score as a 3 at 1 minute, jumping up to a 7 at 5 minutes.
Yeah, that's the APGR score. It stands for Appearance, Post-Grimace Activity, and Respiration.
Oh, wow. Okay, makes sense.
Each one gets a score of 0, 1, or 2, and then you total them up.
So that initial 3 means the baby needed help.
Most likely with breathing, but the 7 at 5 minutes shows improvement, which is great, but still something to watch.
Definitely highlights how crucial those first few minutes are.
Absolutely. Every second counts in these situations.
Okay, let's switch gears to scenario number 2.
Hmm.
This one takes us to a soccer field where a 6-year-old boy is struggling to breathe.
Oh, pediatric respiratory emergencies. Those are always tough.
Yeah, kids are resilient. They compensate for so long that by the time they're visibly struggling, it's often already serious.
Exactly. We got to be extra careful with those little ones.
The scenario really paints a vivid picture. You can practically hear the wheezing. He's using those accessory muscles. Heart rate's a sky-high 140 and oxygen saturation's down to 84%.
That's a big red flag. Low oxygen saturation like that is a serious issue.
Thankfully, the mom tells us he has asthma and uses a blue inhaler. So right away, the responders are thinking salbutamol.
Yeah, that's a common bronchodilator, helps to open up those airways.
They give him a dose, and thankfully it seems to work. His breathing eases up a bit. But then comes the twist. During transport, he becomes unresponsive.
Oh, wow. Talk about a roller coaster of emotions.
1 minute you think he's improving, the next he's unresponsive. It's terrifying.
It's a stark reminder that with kids, improvement can be fleeting. They can crash quickly.
Makes you realize how important it is to anticipate those changes and react quickly.
That second dose of salbutamol is crucial, and depending on the protocol, the epinephrine might even be necessary.
Okay, let's step away from the medical details for a moment.
Mm.
I'm curious, you've been in these situations countless times. What goes through your mind when a call like this comes in?
Honestly, it's a mix of adrenaline and focus. Your training kicks in, but there's also this heightened awareness knowing a child's life is on the line.
Must be an incredible rush and a huge responsibility all at the same time.
It definitely is. You rely on your instincts, but you also have to stay calm and collected under pressure.
I can only imagine now. Get ready for a scenario that throws a real curveball. Scenario number 7. We're dispatched to a house after reports of a gunshot, and that's all we get. No additional information.
Ah, the unknown. That's when the real mental prep begins.
It's like walking into a pitch-black room not knowing what's waiting for you.
Scene safety becomes absolutely paramount in these situations.
You have no idea what you're walking into. Could be an accidental discharge, could be an active shooter.
It forces you to be ready for anything.
Upon arrival, we discovered the victim is a man in his mid-30s. He's on the living room floor, pool of blood around him, conscious but clearly in a bad way.
And then to add to the stress, the scenario mentions his wife is frantic, their children are present.
Talk about a recipe for chaos.
It's textbook knowledge meets real-world human emotion.
Hmm.
You're dealing with a life-threatening injury, potential shock, but there's also this entire family in crisis.
Kids who need reassurance protection, it's a lot to handle.
The scenario really throws in the gritty details too. Gunshot wounds to the groin and thigh-heavy bleeding. It doesn't hold back.
I imagine that's intentional, right? Forces you to confront the harsh realities of these situations.
Exactly. And it's not just about the physical injuries we have to manage that chaotic scene too.
The wife's distress, the children's fear, it's a whole other layer of complexity.
It really highlights that EMS work is about so much more than just medical procedures. It's about being a calming presence in the midst of chaos. It's about being a source of comfort and support.
Okay, ready for another dose of high-stakes obstetrics.
Always up for a challenge. Hit me with it.
Scenario number 3 takes us to a 40-year-old pregnant woman who's unresponsive. Her husband says she's been in pain, and there's, quote, a lot of blood, unquote. Even I felt a chill when I read that.
Yeah, those are trigger words for any EMS responder, especially late in pregnancy. Pain and significant bleeding could be a hemorrhage.
The scene upon arrival is just as worrying. She's pale, clammy, blood pressure's dangerously low at 86, over 44, heart rate's 88, and her breathing is shallow.
That's not just labor pains. We're talking about a potentially life-threatening situation.
And then they discover something that changes everything, an umbilical cord prolapse.
Oh, wow. That's a true emergency. That cord is compressed, cutting off oxygen to the baby.
So now we're not just dealing with a potential hemorrhage, but a life-threatening situation for the baby as well.
Immediate action is critical in this scenario. Every second counts.
You must take incredible training to prepare for something like that.
It's a combination of knowledge, instinct, and a whole lot of adrenaline. You have to act fast, relieve the pressure on the cord, stabilize the mom, and get her to a hospital equipped for a complex delivery.
I'm sensing a theme here. These scenarios aren't just about medical knowledge. They're about making split-second decisions under immense pressure.
You hit the nail on the head. It's that critical thinking combined with technical skills that makes EMS work so demanding and so rewarding.
Well, we've definitely covered a lot of ground, and the adrenaline's definitely pumping. Let's take a quick break to catch our breath before we dive into the next set of scenarios. I have a feeling they're going to be just as intense.
Those are some intense scenarios we just went through.
I know, right? Each one really highlights the need for quick thinking and decisive action in EMS.
Absolutely no time to hesitate when lives are on the line.
I'm ready to keep exploring these scenarios, though. What do we have next?
Let's dive into scenario number 7. This one really puts the spotlight on scene. Safety were called to a house after reports of a gunshot, but the details are sparse.
Oh, that's never a good sign when you're heading into a situation blind like that.
It really tests your ability to think on your feet and adapt your approach as you gather more information.
Upon arriving at the scene, we find out that a wife has reportedly shot her husband. The police are already there, and the husband is lying on the living room floor, conscious but in distress, with a pool of blood around him.
And just to add another layer of complexity to the situation, their children are present.
Oh, wow. Talk about a volatile situation. The responders have to deal with a potentially life-threatening injury, manage the emotional trauma of everyone involved, and ensure the safety of those children.
Absolutely. It's a lot to process and prioritize all at once.
The scenario describes the husband as being in his mid-30s, pale, cool, and clammy. His breathing is rapid and shallow, and his pulse is weak. He has gunshot wounds to his groin and thigh, and it's clear he's lost a lot of blood.
Definitely sounds like hemorrhagic shock is a major concern.
Controlling the bleeding and getting him to a trauma center quickly is going to be crucial.
And let's not forget about the psychological impact of this event on everyone involved, especially the children witnessing something like that can have long-lasting effects.
The scenario mentions that the wife is agitated and yelling at the victim, which further escalates the tension on scene.
That's a good reminder that every call has a human element, and sometimes that human element can be just as challenging as the medical aspects of the situation.
It's easy to get caught up in the technical details of treating injuries, but we can't forget about the emotional and psychological needs of the patients and their families.
Exactly. EMS professionals are often called upon to be more than just medical providers. They have to be counselors, mediators, and peacekeepers all rolled into one.
All right, ready to delve into another challenging scenario.
Always bring it on.
Let's move on to scenario number 3. This one takes us back into the world of obstetrics, but with a twist.
Obstetrics always keeps us on our toes. What do we have this time?
In this scenario, we're called to assist a 40-year-old pregnant woman who is unresponsive. Her husband found her in their bedroom, and he reports a lot of blood on the bed.
Oh, that phrase, a lot of blood, is never a good sign, especially in a pregnant woman.
He also mentions that she's been having pain throughout the day, so there were warning signs. But it's unclear what actions were taken before calling EMS.
Sometimes those details can be crucial in determining the best course of treatment.
Upon arrival, the responders find her pale and diaphoretic. Her pulse is weak and thready, breathing shallow and labored, and she's only responding to physical stimuli.
That paints a pretty concerning picture. She's definitely in a critical condition.
And then upon examination, they discover something that changes everything, an umbilical cord prolapse.
Whoa, that's a serious complication. It means the umbilical cord has slipped down into the vagina and is being compressed, which cuts off the baby's oxygen supply.
So now we have a life-threatening situation for both the mother and the baby.
This is where the training and expertise of EMS professionals really come into play. They have to act quickly and decisively to manage the prolapsed cord, stabilize the mother, and get her to a hospital as soon as possible.
It's a delicate balance of addressing both the immediate medical needs and the logistical challenges of transporting a high-risk patient.
Absolutely, and it highlights the importance of clear communication and teamwork among the responders. Everyone has to be on the same page and working together seamlessly.
It's amazing to see how EMS personnel handle those high-pressure situations with such skill and composure.
It's a testament to their dedication and professionalism. They train rigorously to be prepared for any eventuality.
All right, let's move on to scenario number 2. This one brings us to a soccer field where a 6-year-old boy is experiencing shortness of breath.
Ugh, pediatric emergencies. Those can be tricky. Kids often present differently than adults, and their conditions can change rapidly.
The scenario describes the boy as sitting on the bench, visibly struggling to breathe. His breathing is labored, and there's audible wheezing.
Those visual cues are crucial for EMS personnel. They provide immediate insight into the severity of the situation.
His mother is understandably frantic and tells the responders that he has a history of asthma.
That's valuable information. It helps them narrow down the possible causes and tailor their treatment accordingly.
They check his vital signs and find that his heart rate is 140 beats per minute. His respiratory rate is 40 breaths per minute, and his oxygen saturation is only 84% on room air.
Those vital signs are definitely cause for concern, especially that low oxygen saturation.
They immediately administer salbutamol through an inhaler and provide supplemental oxygen.
Salbutamol is a good first-line treatment for asthma. It helps to relax and open up the airways.
And while the initial treatment is successful, the scenario highlights the importance of ongoing monitoring because asthma can be unpredictable.
Exactly what might seem like an improvement can be temporary, so it's crucial to keep a close eye on the patient's condition.
And that's exactly what happens in this case during transport. The boy's condition deteriorates.
It's a good reminder that we can't let our guard down even when a patient initially responds well.
His vital signs become even more concerning. His heart rate slows to 64 beats per minute, his respiratory rate decreases to 10 breaths per minute, and his oxygen saturation drops to 96% despite supplemental oxygen.
Those changes indicate a significant decline and suggest that he may be progressing towards respiratory failure.
It's a critical moment that demands immediate action.
The scenario emphasizes the importance of recognizing those signs of deterioration and being prepared to escalate treatment.
And of course, there's the emotional component to consider as well. The boy's mother is likely terrified and looking to the responders for reassurance.
Managing the anxiety of family members is a crucial part of EMS work. It's about providing compassionate care and support while simultaneously focusing on the medical tasks at hand.
It's impressive how EMS personnel manage to handle all of that, the medical aspects, the logistical challenges, and the emotional weight of these situations.
It's a demanding job, both physically and emotionally, but it's also incredibly rewarding to know that you're making a difference in people's lives.
All right, bring on the next scenario. I'm ready for it.
Get ready for another obstetrics case scenario number 4. We're responding to a 30-year-old woman in active labor.
Another childbirth scenario. Interesting. Let's hear the details.
This one involves what we call precipitous labor, which means things are moving much faster than usual.
The scenario mentions her water broke 2 hours ago, and her contractions are already super close together. She's at home, and there's no way she's making it to the hospital.
Exactly. It's a classic case of babies coming ready or not.
The scenario describes her as being on the couch, flushed and sweaty breathing rapidly. Sounds like she's in distress.
Definitely, those are all signs of advanced labor.
And to make matters even more urgent, the scenario notes that there's evidence of crowning.
Oh, wow. Crowning, that means the baby's head is starting to emerge. Delivery is imminent.
Talk about a high-pressure situation. Those responders need to be ready to act fast.
Absolutely. Every second counts in a situation like this.
The scenario doesn't hold back on the drama either. It mentions that the baby is born in distress with a low APGR score at 1 minute.
A low APGR score is definitely concerning. It means the baby needs immediate attention.
Can you remind us again what the APGR score measures?
Sure, it stands for appearance, pulse, grimace, activity, and respiration. Each of those categories is scored from 0 to 2, with a total score ranging from 0 to 10.
Okay, so a low score like the one mentioned in the scenario indicates that the baby isn't doing well and needs help.
Exactly. It's a system that helps us quickly assess the newborn's condition and guide our interventions.
The scenario goes on to describe the steps taken to resuscitate the newborn, things like providing stimulation, clearing the airway, and administering oxygen.
It's a reminder that even after a successful delivery, the work isn't over. Those first few minutes are critical for the baby's health.
Thankfully, the interventions are successful. The baby's color improves, breathing becomes more regular, and his APGR score jumps up significantly by 5 minutes.
That's always a relief to see when a newborn starts to recover. It's a testament to the skill and dedication of those responders.
It must be incredibly rewarding to be a part of those moments.
Absolutely. It's one of the things that makes this job so special.
The scenario wraps up by outlining the steps involved in caring for both the mother and the newborn, controlling bleeding, delivering the placenta, and preparing for transport to the hospital.
It's a comprehensive overview of the challenges and rewards of pre-hospital delivery management.
Well, we've covered a lot of ground in this deep dive, exploring a wide range of emergency scenarios, from childbirth to gunshot wounds to pediatric emergencies and everything in between.
It's been fascinating to delve into the complexities of EMS work and see how those responders handle such high-pressure situations with skill, compassion, and unwavering dedication.
I have to say I'm walking away with a newfound appreciation for everything that EMS professionals do. They are truly the unsung heroes of our communities.
I couldn't agree more. They're on the front lines day in and day out, saving lives and making a difference in countless ways.
And to our listeners, thank you for joining us on this journey into the world of emergency medicine. We hope you found it informative and insightful, and that you will take a moment to acknowledge the incredible work that EMS professionals do each and every day. Welcome to another deep dive. Buckle up, because today we're going behind the scenes with EMTs.
Emergency medical technicians.
The very same. We're going to break down 3 real-life training scenarios, kind of like those simulations they use to prep for the unexpected.
Oh, I like this. So like getting inside the heads of first responders.
Exactly. Seeing how they assess a scene, what clues catch their eye, and how they make those split-second decisions that can literally mean the difference between life or death.
I'm in. Let's do it.
All right, so picture this. A raging inferno. An abandoned house engulfed in flames. Now, imagine a firefighter falls through the 2nd floor during a search and rescue.
Oh, wow. That's intense. Talk about a high-pressure situation.
It doesn't get much more intense than that. Yeah. And to make matters worse, other firefighters are working desperately to get him out, all while the fire's still burning.
I can't even imagine. So where do our EMTs come in?
They arrive on scene and find the firefighter conscious, alert, but obviously in a lot of pain.
Okay, that's a good sign at least.
It is, but there's a lot more to consider. He's breathing rapidly, has a strong pulse, but his skin is pale.
Pale skin. Could that indicate shock?
It could be, or it could be something else. They also notice ash marks on his face and soot around his nose and mouth.
Ah, that's a red flag right there. Smoke inhalation, even if he's not showing obvious distress, that can have some pretty serious consequences later on.
Exactly. They got to think about all those possibilities. And then they discover a closed mid-shaft femur fracture.
A broken thigh bone. Yikes. And he's reporting pain in his lumbar spine, too.
Yep, the lower back. So much to process already, right?
Right, and you know what they'll also be asking?
What's that?
They're going to want to know if he lost consciousness, even for a brief moment.
But why? If he's alert and talking now, does it really matter?
Absolutely. It could be a sign of a head injury, even if there are no other obvious symptoms.
So they're piecing together the puzzle with every little detail.
Exactly. It's like detective work. And of course, they'll be taking his vitals. Heart rate, respiratory rate, blood pressure, all those numbers help paint a clearer picture of what's going on inside.
Okay, let's hear those numbers. What are they working with?
His heart rate is 118 beats per minute, respiration's 24, and blood pressure is 130/88.
All right, so they've got that initial assessment. What happens next?
Now they move into a more detailed secondary assessment. Think of it as digging deeper, looking for those hidden clues.
So like Sherlock Holmes with a stethoscope?
Huh. Pretty much. And in this case, the firefighter's saying the pain in his right femur is getting worse, and now they're shooting pain down his leg.
Oof, not good. Do they recheck those vitals?
Absolutely. They're constantly reassessing, looking for any changes that might indicate things are improving or getting worse.
Okay, and what do those new vitals look like?
This time they get a heart rate of 114, respirations are 20, and blood pressure is 126/78.
Interesting. So some subtle shifts. What kind of actions are they taking based on all this?
Well, first, they're going to go through their AEMCA. That stands for airway, breathing, circulation, and mental status check, making sure they're not missing anything major.
That makes sense. And they'll also need to figure out if that smoke inhalation happened before they got those initial vitals because, that could have affected the readings.
Precisely. Now, in terms of actually treating his injuries, what do you think they're going to do?
Well, high concentration oxygen seems like a given, right?
You got it. Oxygen's crucial, especially with potential smoke inhalation. And then they got to stabilize his neck with a properly sized C-collar.
Always got to be mindful of that potential spinal injury.
Right. Can't take any chances there. And of course, that femur fracture needs attention. Likely going to use manual traction with a partner to help stabilize the leg before they move him.
I can only imagine how difficult it must be to work on a broken leg like that, especially amidst all the chaos of a fire scene.
It takes serious skill and coordination for sure.
Hmm.
And then there's the matter of getting him out of there safely. Enter the scoop stretcher.
That's that special kind of stretcher, right?
Yep. It splits in two so they can slide it under the patient without having to move him too much, minimizing the risk of further injury.
Smart. Okay, so let's shift gears completely. Scenario number 2. We're on a football field now.
Football. Oh, this should be interesting.
Very different scene, but just as high stakes in its own way. We've got a 24-year-old male player on the sidelines, experiencing some serious pain in his lower leg.
All right, what else are we looking at here?
He's conscious, alert, sitting on the bench, definitely distressed.
But he's conscious. That's good.
Yep. He says he didn't lose consciousness. His right leg is extended out in front of him, and just like the firefighter, his skin is pale.
Pale skin again. Gotta pay attention to that. Could be shock, especially with a potential fracture.
And there's more. He says he heard a cracking sound when he was tackled, and then another player fell on his leg. Ouch.
Oh, man. Yeah, that cracking sound is never a good sign. Almost always points to a fracture.
His vitals are showing a heart rate of 116, respirations 24, blood pressure 128/86. What's next for the EMTs?
They got to rule out a spinal injury first and foremost. That means careful questioning and a thorough assessment because you absolutely do not want to move him unnecessarily until you're sure his spine's stable.
Right, safety first. Then they'll move on to examining that leg more closely.
You got it. Looking for any deformities, asking him to describe the pain, all those things help him figure out what kind of damage they might be dealing with.
I remember reading about something called a sample history and OPQRST. Is that something they'd be using here?
Absolutely. SAMPLE stands for signs, symptoms, allergies, medications, pertinent past history, last oral intake, and events leading up to the injury.
Wow, that's a lot to remember.
It is, but it helps them gather a lot of crucial info quickly. And then there's OPQRST, which focuses on the pain, onset, provocation, quality, region, severity, and time.
Okay, so they've ruled out a spinal injury, gotten a good understanding of his pain. What comes next?
splinting that leg before they even think about moving him. Got to stabilize the injury and prevent further damage. And here's where teamwork really shines.
You mean like a well-coordinated dam?
Kind of. They'll delegate tasks efficiently. One EMT might be gathering info, another prepping the splint, all while communicating clearly and calmly.
It's amazing how they work together so seamlessly.
It is. All right, ready for our final scenario.
Hit me with it.
Let's go inside a house this time. A call comes in for an 82-year-old female found unresponsive on the bathroom floor. Her granddaughter found her and reports a lot of blood in the toilet.
Oh, that sounds serious.
Definitely raises the alarm bells. An unresponsive patient always bumps things to the highest level of urgency.
So what's the scene look like when the EMTs arrive?
Not good. She's unresponsive, no pulse, no breathing. She's very pale and diaphoretic, which means she's sweating profusely.
Wow. What are their immediate actions?
No time to waste. They initiate CPR immediately and get those defibrillator pads on her chest. They're literally fighting for her life at this point.
CPR and defibrillation.
Yeah.
Those are the big guns, right?
They are. And while that's happening, they'll also be gathering as much information as they can, trying to understand what might have led to this.
And in this case, the granddaughter is probably their best source of information.
Exactly. They'll be asking her about the grandmother's medical history, any medications she's on, recent health issues, anything that could help shed light on what happened.
So like trying to solve a medical mystery.
You got it. And the granddaughter tells them her grandmother has a recent history of GI bleeding.
GI bleeding meaning?
Bleeding in the digestive system. And get this, she just stopped taking blood thinners because of the frequent bleeding. Big red flag there.
Oh, wow. Why is that so concerning?
It means she could be bleeding internally, and it might be very difficult to control.
So they're piecing together this puzzle with limited information, and every little detail matters.
Absolutely. The granddaughter also mentions her grandmother's medications, metoprolol, atorvastatin, Arthrotec, and ASA.
I've heard of some of those. What are they typically for?
Well, metoprolol's for high blood pressure, atorvastatin's for cholesterol, Arthrotec's for arthritis, and ASA is just aspirin. But here's the key. Her past medical history includes hypertension, hyperlipidemia, arthritis, and atrial fibrillation.
Okay, that's a lot to take in. But what about the AED? What does that tell them?
Oh, those AED analyses are crucial. The first one shows ventricular tachycardia, or VTach for short.
VTach? That doesn't sound good.
It's not. It's a rapid, irregular heartbeat, can be deadly. And the AED advises a shock.
So they deliver the shock, hoping to reset her heart rhythm. And then what?
The second analysis shows pulseless electrical activity, or PEA.
Pulseless electrical activity. What does that even mean?
It means her heart is showing some electrical activity, but it's not translating into a real heartbeat.
So she still doesn't have a pulse?
Unfortunately, no. And the AED doesn't advise a shock in this case. But they don't give up. They continue CPR, doing everything they can to manually circulate her blood and keep her oxygenated.
Wow, those chest compressions and rescue breaths. It's amazing how they can keep going like that.
It's hard work. Now, what about the third and fourth analyses?
Let's hear it.
Both show a systole. No electrical activity in her heart at all.
Oh, that doesn't sound good.
It's not good, but they don't stop fighting. They continue CPR, and they're getting her to the hospital ASAP. With PEA, time is absolutely everything.
It's like every second counts.
Yeah.
So even though they're following the AED's guidance, they're also thinking about other possibilities, right? Like why this might be happening in the first place.
You bet. They're considering things like hypovolemia, which is low blood volume from blood loss, and hypoxia, meaning lack of oxygen.
So it's like they're solving a mystery while simultaneously trying to keep her alive.
Exactly. They're incredible. They're like medical detectives with the skills to back it up. It's incredible, isn't it? Just the sheer amount of stuff happening at once and how they have to juggle all these different factors.
It really makes you appreciate what EMTs do. I mean, it's so much more than just driving an ambulance.
Yeah. Oh, yeah. Way more. It's a highly skilled profession. They got to be able to think critically, make decisions under pressure, all while having this deep understanding of the human body.
It's like being part doctor, part detective, part athlete, all rolled into one.
Exactly. And let's not forget the mental and emotional strength it takes to deal with, some pretty heavy stuff.
So true. But let's take a step back for a sec. What are some of the big picture takeaways from these scenarios? Like, what can we all learn from this?
Well, first off, a thorough assessment is absolutely key. In each scenario, the EMTs had to gather information quickly, prioritize potential threats, and come up with a plan of action. sometimes with very limited information.
It's like solving a puzzle where the pieces are constantly changing.
You got it. And sometimes half the pieces are missing. Communication is also huge. They got to communicate effectively with each other, with other first responders, and of course with the patient whenever possible.
Teamwork makes the dream work, right?
Exactly. Everyone playing their part to make sure the patient gets the best possible care. And we can't forget about staying calm under pressure. I mean, these are high stress situations, but they got to stay focused, make sound judgments. Their ability to stay calm can actually help the patient too.
Oh, yeah, for sure. Like if they're freaking out, the patient's going to freak out even more.
Right. So yeah, calmness is key. Okay, but let's go back to that first scenario with the firefighter. What were some of those specific details that the EMTs really honed in on, those little clues that someone like me might have missed?
Well, those ash marks and soot around his face were a big one. Even though he seemed to be breathing okay at that moment, they knew that smoke inhalation could cause problems later on.
Yeah, it's about thinking ahead, anticipating potential problems.
And what about the possibility of a head injury? Even though he was conscious and talking, that brief loss of consciousness, if it happened, could mean something much more serious was going on.
Exactly. They're not just treating what they see right in front of them. They're thinking about all the possible consequences down the line. It's like they're playing medical chess, always thinking a few moves ahead.
That's a great way to put it. Okay, now on to the football player. What were some of the red flags that jumped out at you in that scenario?
Oh, that cracking sound was a pretty obvious clue, right? And then seeing the deformity and pain in his lower leg, yeah, that pretty much sealed the deal that there was a fracture.
A broken bone, definitely not something you want to mess around with.
Nope. And that's why immobilizing that leg before moving him was so important. Got to prevent further damage. And of course, ruling out a spinal injury was top priority. Can't be too careful with those high-impact injuries.
Better safe than sorry, as they say.
Exactly. All right, but scenario number 3, that one was definitely the most intense. What'd you think about how the EMTs handled that unresponsive patient?
I was just blown away by how quickly they had to make decisions. I mean, when someone's in cardiac arrest, every second counts, right?
Oh, absolutely. Speed and efficiency are everything in that situation. Starting CPR and getting that AED on her right away, that gave her the best possible chance of survival. But it wasn't just about the mechanics of CPR and defibrillation. They also had to consider the bigger picture.
You mean like what might have caused her to go into cardiac arrest in the first place?
Exactly. And her history of GI bleeding and the fact that she'd recently stopped taking blood thinners, that was a huge clue.
Right. It suggested that maybe she was bleeding internally and it was really hard to control.
Exactly. And her other medications, the ones for high blood pressure, cholesterol, arthritis, those gave him some insight into her overall health, too.
It's like each medication is another piece of the puzzle, and they got to figure out how it all fits together.
That's a great way to put it. They got to be master puzzle solvers, using all the available clues to make the best decisions for their patient.
Yeah.
And sometimes they got to do all of this with very limited time and resources, but they always manage to rise to the challenge.
They really do. This deep dive has definitely given me a whole new level of respect for what EMTs do. It takes a really unique combination of skills, knowledge, and compassion.
I agree. It's not an easy job. But what's really interesting to me? We've talked a lot about the technical stuff, but what about the emotional side of things? I mean, they deal with life and death situations every day. That's got to take a toll, right?
Yeah, absolutely. How do they cope with all that stress and trauma? I mean, seeing all that suffering, it can't be easy.
It's not, and it's something that we often overlook when we talk about first responders. We tend to focus on the physical challenges, but the emotional challenges are just as real, if not more so.
It makes you realize that these are just ordinary people doing extraordinary things.
They really are. They're heroes walking among us, and we owe them a debt of gratitude for the sacrifices they make every day. But, going back to the scenarios, I think there are still some interesting things we haven't touched on yet.
Oh, I agree. There are a few things that really got me thinking, especially when we were looking at the firefighter's vitals.
Oh, yeah. What stood out to you?
Well, his heart rate was initially elevated, which makes sense given the pain and stress he was in. But then as they continued to assess him, his heart rate actually stabilized, even though his pain wasn't necessarily getting any better. I thought that was pretty interesting.
That is interesting. It just goes to show how important it is to track those vital signs over time. One set of vitals is just a snapshot, but seeing how they change, That tells you so much more.
It's like watching the whole story unfold instead of just reading one chapter.
Exactly. And it might even suggest a need for changes in treatment. It's a dynamic process, always changing as the patient's condition changes. What about the football player's pain? Did anything about that stand out to you?
Well, I remember him describing it as throbbing and shooting.
Hmm.
I'm curious, are those words that EMTs actually pay attention to?
Oh, absolutely. The words patients use to describe their pain can be really telling. They can give clues about what's causing the pain and how serious it might be.
So what were those words telling us in this case?
Well, throbbing often suggests inflammation, while shooting can indicate nerve involvement. So those two words together painted a pretty clear picture of a fracture that was affecting not just the bone, but possibly the surrounding nerves as well.
Wow, it's like the body's trying to tell us what's wrong, and it's up to the EMTs to figure out what it's saying.
Exactly. And the better they understand that language, the better they can respond to those cries for help. Before we move on, though, I'm curious to hear your thoughts on the unresponsive woman's medications. What were your takeaways there?
You know, the thing that really stuck with me was the fact that she'd recently stopped taking blood thinners because of all that GI bleeding. It just seemed like such a crucial piece of information.
It was a major red flag, wasn't it? It suggested that her internal bleeding could be quite severe and much harder to control. And then her other medications, they gave us a glimpse into her overall health, right? High blood pressure, high cholesterol, arthritis. These details might seem kind of mundane, but in an emergency, every bit of information helps paint the bigger picture.
It's like each medication is a clue, and the EMTs have to figure out how they all fit into the mystery.
Exactly. They have to be master puzzle solvers, using all the available clues to make the best possible decisions for their patient. And sometimes they have to do all of this with very limited time and resources, but they always manage to rise to the challenge. It's really quite remarkable.
It is. This deep dive has definitely given me a newfound respect for what EMTs do. They need a unique combination of skills, knowledge, and compassion to do what they do, and I feel like we've only just scratched the surface.
I agree. There's always more to learn. But for now, I think we've covered a lot of ground today. We've explored 3 very different emergency scenarios, and we've seen how EMTs approach assessment, decision-making, and taking action. We've also seen how they analyze vital signs, interpret those descriptions of pain, and piece together medical histories to get a clear picture of what's happening with their patient.
And we've seen how they stay calm and focused in those high-pressure situations, working quickly and efficiently to deliver that life-saving care. It's truly remarkable work.
It really is. And you know what? You don't have to be an EMT to make a difference in an emergency. Just knowing basic first aid and CPR can equip you to be a vital link in that chain of survival.
That's so true. Those skills can empower anyone to step up and help when it matters most.
Exactly. You never know when you might find yourself in a situation where those skills could save a life.
Well, before we wrap things up completely, I want to leave our listener with something to really think about. We've talked a lot about quick thinking and decisive action, but what about the emotional toll all this takes on EMTs? How do they cope with all that stress, the trauma, the constant exposure to suffering?
That's a really important question, and it's one that we don't talk about enough. The mental and emotional well-being of our first responders is crucial, and it's something that we often overlook.
It's easy to get caught up in the physical demands of the job, but the emotional demands are just as real, and they can have a lasting impact.
You're absolutely right, and it's something we should all be more aware of, something we can explore further in future deep dives.
Looking forward to that. But for now, I hope this deep dive is giving you, our listener, a new appreciation for the incredible work that EMTs do every day. They are truly heroes walking among us, and we're all safer because of their dedication and their sacrifices.
Well said. And on that note, I think it's time to wrap up this deep dive.
It's been a pleasure exploring these scenarios with you.
Likewise. And to our listener, thank you for joining us on this journey into the world of emergency medical care. We hope you found it insightful and perhaps even inspiring.
Until next time, stay curious, stay informed, and stay safe.
It really is. It's like they have this superpower, to stay calm in the middle of chaos. It's incredible.
It really is. And I think it's easy to forget that calmness, it's not just for their own benefit, it actually helps the patient too.
Oh, absolutely. Think about it. When you're facing a medical emergency, things are scary, right? You panic.
Yeah.
But when you have someone there who's trained to stay cool, collected, it makes all the difference.
It's like they're an anchor in the storm. They bring a sense of control to a situation that feels completely out of control.
Exactly. And you know what? That level of professionalism, that composure, it's something we can all learn from, not just for medical emergencies, but for any high-stress situation.
That's such a good point. So as we wrap up this deep dive, what's the one thing you hope our listeners take away from this?
I hope they walk away with a deeper appreciation for how complex emergency medical care really is. But also, I hope they feel empowered, knowing that they can play a role too, you know, even if they're not an EMT.
Absolutely.
Hmm.
Because knowing basic first aid, CPR, those skills can be life-saving.
Exactly. You just never know when you might need to use them.
That's so true.
Hmm.
Well, I think it's time to wrap up this deep dive into the world of EMTs.
It's been a privilege sharing these insights with you and our listeners.
The pleasure was all ours.
Yeah.
And to our listeners, thanks for joining us on this journey. We hope you found it informative and maybe even a little inspiring.
Until next time, stay curious and stay safe.
All right, strap in, everybody. We're going deep today. Diving headfirst into emergency medicine. We're using real training scenarios. You know, the kind paramedics use to practice. It's like getting a backstage pass to those crazy intense moments, thankfully without the sirens and flashing lights this time.
You know, even if you're not like a doctor or anything, these scenarios are packed with lessons anyone can use. It's all about observation, thinking on your feet, and staying cool when things get hectic.
Exactly. And today we've got two cases that couldn't be more different, at least on the surface. We'll start with an older gentleman found unresponsive at home, and then we'll switch gears completely to a young woman found unconscious in her bed. Both situations are full of these little clues and medical mysteries, and we're going to unravel them together.
What's really interesting is how paramedics can take just a few pieces of information and start building a whole picture. You know, using just their initial observations and the patient's history.
Okay, so let's get right into it. Our first scenario. Early morning, paramedics get a call. 80-year-old man, unresponsive. They arrive and find him on the basement floor, not moving. And his wife, obviously, is frantic. I can only imagine how much that adds to the stress of the situation.
Yeah, absolutely. Right away, paramedics are trained to do a rapid assessment, checking for responsiveness, breathing, and a pulse, the essentials. They're also looking at things like skin color, temperature. That gives them clues about what's happening inside the body. In this case, they see his skin is pale, cool, and dry. Could be a circulation problem.
And thankfully, his wife is able to give them some background. He's got a history of heart problems, hasn't been feeling well lately, even mentioned having trouble waking up. Those details start to create a picture, right?
Oh, for sure. Those bits of information, they're like puzzle pieces. And his medical history adds even more to the picture. COPD, that's a chronic lung disease. He's also got stents, meaning he's had blocked arteries before, and hypertension, among other things. All this helps paramedics form a working theory.
And of course, we can't forget his medications: Nitro, Plavix, Lasix, and Norvasc. I'm guessing these aren't just random pills.
No, not at all. Each one tells a story. He's on Nitro, which is often used for angina, and Lasix, a diuretic. It's like getting clues about his heart health. Might explain why he was feeling weak. They even noted his dinner: chicken, rice, and kombucha. You never know what detail might be important, you know?
So with all this swirling around, what's the next step? It seems like a lot to process under pressure.
Oh, it definitely is. That's where their training comes in. First, they confirm CPR is happening. Then they apply defibrillator pads to check his heart rhythm. And in this case, the defibrillator shows a systole.
The systole, and that's a word I've heard before. It's basically a flat line, right? Like in those dramatic hospital scenes.
Yep, exactly. And unfortunately, it's as serious as it sounds. The paramedics start trying to revive him, but the scenario also mentions the wife's distress, you know? She's really upset.
It's got to be tough on the paramedics. It's not just a medical textbook. It's real people in a real crisis.
Absolutely. They have to balance their efforts to save his life with keeping the wife calm, addressing her worries. High pressure in every sense of the word.
Now, there's this interesting detail. Possible drug use. Something about King LT. It's not clear what that means, but it hints that things might be more complicated than they first seemed.
Yeah, that's the thing about these emergencies. They rarely fit neatly into a box. There are always layers and factors that can change everything. It brings us to a really important point. Even something that seems like a simple case can turn complex fast.
Okay, so we've gone from heart trouble to potential drug use. It's like one of those medical dramas with a surprise twist.
Yeah.
And speaking of twists, our next scenario takes us to a completely different setting. A young woman found unconscious in her bed by her roommate.
And this one really shows how crucial it is to be a good observer and detective when you don't have much information to go on.
I'm already hooked. Let's set the scene. 25-year-old woman, unconscious in her bed. Her roommate hadn't seen her all day. No signs of injury or drug use. What would a paramedic be thinking in that situation?
First thing, scene safety. Especially when they're walking into the unknown, they need to make sure everyone's safe, themselves included. Then it's all about gathering information quickly.
So they find her in bed, not moving. Strong pulse, but her breathing is shallow. Her skin is pale, cool, and dry. Just like the first scenario, I'm starting to see those observation skills in action.
You got it. But here's something that jumps out at them. She has trismus, which is basically lockjaw.
Trismus.
Yeah.
You and your fancy medical terms. I'm guessing it's not just someone clenching their jaw from stress.
Nope. It's when the jaw muscles spasm, you can't open your mouth. And this isn't just a random thing. Trismus can be a sign of a few different things, like seizures, tetanus, even some drug reactions. It gives them a direction to start investigating.
Like a signpost pointing them down a specific path. Speaking of paths, we learned she has a history of epilepsy, and she just changed her medication. She's on Dilantin and valproic acid. Pretty common for managing seizures, right?
Yeah, that's right. And her roommate adds another piece to the puzzle. Says she's been having trouble controlling her seizures lately.
Okay, now things are clicking into place. History of seizures, trouble managing them. Now she's unresponsive with lockjaw. I bet the paramedics are thinking, oh, this could be serious.
Definitely. And then, to make things even more worrying, right after they put her on the stretcher, she has a seizure. Lasts for a whole minute.
Wow, that escalated quickly. It really shows how fast things can change. And the pressure those paramedics are under, what happens next? What are their top priorities in that moment?
I mean, right then, with the seizure happening, training kicks in. They'd focus on protecting her from getting hurt during the seizure, maybe gently guiding her movements, making sure she doesn't hit anything. Basic safety stuff in a crazy situation.
It makes you think, would you freeze up? But they're trained to focus on those ABCs we talked about. Even while all this is going on. Practice makes perfect, I guess.
Exactly. They've been through so many simulations, real-life situations. They've got a protocol for these kinds of things. But it's not just going through the motions. They're also trying to figure out what caused the seizure in the first place.
Right, because knowing the cause can change how they treat it. It's like a medical mystery, isn't it?
Absolutely. In this case, they'd look at a few things. She recently changed her medication, so they'd investigate that. But also other things that can trigger seizures. Lack of sleep, stress, even flashing lights for some people.
It's like being a detective. But instead of clues at a crime scene, it's medical details and symptoms. Speaking of clues, let's go back to that first scenario for a second. The 80-year-old man. That King LT thing really got me curious. Did you find out what that was all about?
Well, I did some digging. Turns out King LT is slang for a really strong synthetic marijuana.
Wow, that's a surprise I never would have guessed. So what seemed like a small detail could actually be a big deal in his case.
It could. But we can't jump to conclusions. Just because it's mentioned doesn't mean it caused his condition. We have to consider everything.
That's a good point. Even in these high-stakes situations, staying objective is key. Got to get all the facts before making assumptions. It's easy to get caught up in the drama.
Yeah, for sure. That's one reason these scenarios are so useful for training. They make you think critically and evaluate the evidence before jumping to conclusions.
So let's talk about those critical decisions. In both scenarios, paramedics have to make some serious choices. Life or death stuff. How do they even decide what to do first?
Well, there's a systematic approach they follow. It's called the ABCs: airway, breathing, and circulation. They make sure the airway is clear, the patient's breathing okay, and that their heart's pumping, blood's flowing.
The fundamentals. Got to get those right first. Makes sense.
Exactly. Once those are stable, they can move on to other things, like checking blood sugar, giving meds, getting ready for transport. It's a whole chain of actions after those first steps.
It's amazing how much they had to do in such a short time. And stay calm under pressure. They're like medical superheroes.
It really is remarkable, and what's even more impressive is how they adapt their approach to each situation. No two cases are the same, so they have to be ready for anything.
Thinking on your feet, right?
Yeah.
Making adjustments as you go with the clock ticking.
That's it. For example, think about the young woman with trismus. Remember, her jaw muscles are locked up. That's a problem for managing her airway.
Right, they can't just open her mouth and put it in a breathing tube.
Exactly. They might have to try other techniques, like a nasal airway, or, in extreme cases, even a cricothyrotomy.
Cricothyrotomy. Sounds intense. Not an everyday thing, I'm guessing.
Definitely a last resort. It's where they make a small cut in the neck to get to the trachea, the windpipe,
Yeah.
so they can ventilate the patient. but it shows how important it is to be resourceful, to adapt in emergencies.
I'm realizing this is so much more than just knowing procedures. It's problem solving, thinking critically, making split-second decisions.
You got it. That's why these scenarios are so valuable, not just for paramedics, but for anyone who wants to sharpen those skills.
So even if we're not facing life or death situations all the time, what are some key takeaways we can use in our own lives?
Well, think about what we've seen. Observation, gathering information, clear communication, being adaptable. Those are important everywhere, not just in medicine.
I can see that. Being more observant, asking the right questions, staying calm. Those are helpful no matter what you do.
Absolutely. And don't forget about clear communication. Being able to explain your thoughts and concerns clearly makes a huge difference in any interaction.
Before we move on, I want to touch on something you mentioned earlier about not jumping to conclusions. It's easy to get caught up in the drama and make assumptions.
You're right. It's something first responders are always fighting against. They have to get as much information as possible, but also be aware of their own biases.
Can you give us an example of how that might happen in a scenario?
Let's go back to the young woman found unconscious. Remember, her roommate said she was having trouble with seizures.
Yeah, and she'd recently changed her medication. Seemed like a pretty clear case.
It did, right. But there could be other things going on. What if she hit her head earlier and has a concussion? What if there's another medical condition causing these episodes? Something besides epilepsy.
I hadn't even thought of that. Easy to get tunnel vision when you think you have the answer.
Exactly. That's why it's crucial to keep an open mind. Get all the information before deciding anything for sure. Sometimes the most obvious answer isn't the right one.
So be thorough, methodical, and don't assume. Get the facts.
Exactly. And remember, these scenarios are designed to challenge us, to make us question our assumptions and see things from a fresh perspective.
It's amazing what we can learn from these simulations, even if we're not medical professionals.
And that's the best part. They give us a look into a world most of us will never experience firsthand. But they also teach us valuable lessons we can use in our own lives.
I feel like I'm seeing the world differently already. Paying more attention, asking more questions. It's like these scenarios opened up a new way of thinking.
That's great. That's exactly what we were hoping for with this deep dive, to spark your curiosity and get you thinking critically.
Speaking of curiosity, there's one scenario we haven't talked about yet. The one with the gunshot wound. Ready to tackle that one?
Absolutely. Let's do it.
Buckle up, everyone. Things are about to get intense. Okay, so this last scenario definitely takes things up a notch. We're talking about a gunshot wound, which means those scene safety procedures become super important.
Yeah, and when you add in potential violence and kids being present, the emotional stakes get even higher for everyone involved.
So let's break it down. What are the paramedics walking into here?
Picture this. Paramedics get dispatched to a house. Someone recorded a gunshot. They arrive. It's a chaotic scene. Police are already there. 2 young kids are there too. And their mother is on the living room floor in a pool of blood. Her husband, the suspected shooter, is also on the floor. Looks like he's dead.
Wow, that's just awful. Those poor kids. Seeing something like that, I can't even imagine.
It's tough. And for the paramedics, it's a balancing act, providing immediate medical care, but also making sure everyone is safe, including themselves.
Right, because at first, they don't know if it's actually safe or if there's still a threat.
Exactly. Their initial assessment focuses on a few key things. First, confirming the scene is safe to enter, then quickly checking the woman's condition, and finally making sure the kids aren't hurt or in danger.
So assuming it is safe, what do they find when they reach the woman?
She's conscious, but obviously in a lot of pain and in shock. She's got a gunshot wound to her groin and upper thigh, bleeding a lot. Her skin's pale, cool, and clammy. Her heart is racing.
I bet her vitals are all over the place.
They are. Blood pressure's low, breathing's fast and shallow, pulse is weak. Classic signs of shock, which can be really dangerous if they don't treat it right away.
So controlling the bleeding has to be the top priority.
Absolutely. They'd apply direct pressure to the wounds, using whatever they have to stop the bleeding as fast as possible. Every second counts.
It's amazing how they can focus on that, even with all the chaos and trauma around them.
It's their training. They learn to compartmentalize, focus on the patient's needs, even in the toughest situations.
While they're doing that, are they also trying to figure out what happened?
They'd be gathering information from the scene, but their main focus is stabilizing her and getting her to the hospital. Figuring out the details of the shooting comes later.
So those first few minutes are all about action, reacting. What about the kids? What happens to them?
Ideally, the police would take care of them, make sure they're safe and away from the scene. But even with the police there, the paramedics would still be concerned. They'd want to check if the kids were physically hurt and do what they could to, help them emotionally.
It's a good reminder that these aren't just medical emergencies, they're human tragedies. And the impact goes way beyond the immediate victims.
Very true. And for the first responders who deal with this all the time, it can take a huge emotional toll. They see so much suffering. We should all be thankful for what they do.
They really are heroes, putting themselves out there to help others in their worst moments.
Couldn't agree more. So as we wrap up our deep dive into these scenarios, I want you to think about this. We've explored the challenges, the tough stuff, the emotional side of this work, but we've also seen the incredible skills, the compassion, the dedication of the people who do it.
It's been eye-opening, for sure. I think we've all learned something from these scenarios about staying calm, thinking quickly, being adaptable, and the importance of compassion when things are tough.
Well said. Even though we're not all paramedics, we can all try to live by those principles.
Thanks for joining us on this deep dive. Until next time, stay curious, stay informed, and stay safe. All right, so you've handed us quite the stack of medical scenarios today, each one a potential emergency.
Oh, it looks like someone's prepping for some pretty intense training.
That's right, and luckily for us, we love a challenge. You've really gone all out with
Yeah,
these.
it's got detailed patient notes, vitals, even some images.
4 distinct cases in total, so let's jump right into the action.
Sounds good to me.
We'll start with this high-voltage fall.
Ah, yes. The 46-year-old male, 30 feet up on a hydro pole.
A sudden plunge sparks flying coworkers, witnessing the whole thing.
Talk about high stakes right from the start.
And his initial presentation is concerning conscious but confused,
Right.
pale and cool to the touch,
Uh-huh.
plus a rapid irregular pulse.
All classic signs of shock.
But given the nature of this incident, we have to consider the possibility of electrical burns too.
Absolutely. Those burns can complicate things significantly.
His GCS is only a 3.
Wow, that's alarmingly low.
What are your immediate concerns based on that initial assessment?
Well, a GCS of 3 means he's barely responsive.
So even if he seems somewhat alert at first,
Yeah, things could change really fast.
and that raises concerns about potential internal injuries, spinal damage, and of course the extent of those electrical burns.
Exactly. It's a worrisome combination.
And it sounds like his condition deteriorates rapidly from there.
Oh,
The scenario notes say his pulse becomes weak and thready breathing shallow,
okay.
and his pupils are even sluggish,
Not good. That definitely paints a picture of a patient in serious trouble.
with potential internal bleeding, possible spinal trauma, and those electrical burns.
Rapid transport becomes absolutely critical in a situation like this. Every minute counts.
Now, we also have some images that show severe burns on his hand and foot.
Oh, okay.
But I have to say what I find really intriguing is that they've included a 12-lead ECG.
Oh, interesting. What kind of information could that reveal in a case like this?
Yeah, that's what I was wondering.
Well, that ECG could be incredibly valuable. It could show signs of cardiac arrhythmias, irregular heartbeats caused by that electrical current passing through his body.
So we're not just thinking about the immediate danger of the shock.
No, we're also thinking about the potential long-term effects on his heart.
Okay, so let's move on to our next scenario.
All right.
And I have to warn you, this was pretty graphic.
Okay.
We're in a factory setting, and the scene is, well, let's just say it's bloody.
A 32-year-old male arm trapped in machinery with the collar reporting blood everywhere.
This immediately makes you think of hemorrhage control.
Oh, yeah, absolutely top priority in a case like this.
And the scenario information confirms that we're dealing with a traumatic amputation below the elbow.
Wow, that's a life-threatening injury for sure.
What kind of immediate actions are crucial when you're faced with something like this?
Well, we're talking about life-saving interventions, direct pressure on the wound to try and slow that bleeding down,
Okay.
rapid application of a tourniquet above the injury to completely stop blood flow to the limb.
And I imagine aggressive treatment for shock as well.
Oh, absolutely.
Yeah.
Every single second counts when you're dealing with this kind of massive blood loss.
10 minutes into this scenario, he becomes unresponsive even to painful stimuli.
Oh, that's a bad sign.
What did that tell us about his physiological state?
It's a sign that his body is shutting down.
With severe blood loss, the heart struggles to pump enough blood to those vital organs.
Right, and that leads to a whole cascade of problems. The falling heart rate, weak and thready pulse, the dilated pupils. Those are all signs of a body in crisis.
And I have to say, the image they included in this scenario really drives home the severity of this injury.
Yeah, Definitely not for the faint of heart.
All right, let's shift gears to something a little different now. A case of altered mental status at a busy downtown bus stop.
Okay.
Picture this. A young woman, slumped over unresponsive, with this strong, unidentified odor in the air.
So we've got a woman in her mid-20s, found on the ground, pale and clammy skin, shallow breathing.
But she does respond to painful stimuli.
Right, so there's a lot of possibilities to consider here.
Could be an overdose,
Yeah, could be.
a diabetic emergency, even a stroke.
Possibly. And that strong odor you mentioned. That could be a clue as to what we're dealing with.
Things take a dramatic turn after she's given oxygen.
Oh.
Suddenly, she becomes agitated and confused, fighting off the responders.
Wow. How do you even begin to make sense of a sudden change like that?
It really makes you think, did the oxygen itself trigger this reaction?
Or was her mental state already deteriorating and this was just the tipping point?
And this is where having limited information becomes a real challenge.
Yeah, you're working with pieces of the puzzle trying to figure out the bigger picture.
And then, to make matters even more complicated, she mentions a leg wound,
Okay.
but refuses to answer any questions about it.
That definitely raises a lot of questions.
Is she experiencing drug-induced paranoia?
Could be.
Is there a reason she's afraid of medical attention?
It's possible.
Or is there something she's actively trying to hide?
Yeah, you never know.
It becomes a complex situation.
You have to balance respecting her wishes with making sure she gets the care she needs.
And even though her vitals improve, she remains adamant about refusing transport to the hospital,
That's a tough one. How do you navigate a situation like that?
especially when you're genuinely concerned about her well-being.
You have to try to build trust. Explain your concerns clearly and calmly. Offer her options, let her know that you're there to help, not to judge.
All right, our last scenario for this part of the deep dive hits close to home for many.
Okay.
You arrive at a house to find a frantic mother who can't wake her 5-year-old daughter.
Anytime you're dealing with a child,
Nah.
the stakes are just incredibly high.
Difficulty breathing unresponsive.
It demands quick thinking, decisive action, and that ability to stay calm amidst a parent's understandable fear.
Her skin is flushed.
Uh,
She's breathing shallow, and she has a rapid pulse.
okay.
Sounds like a possible fever, but what else could be at play here?
Well, a fever is certainly possible.
Right.
Maybe pointing to a common infection.
Like what?
It could be something like an ear infection or a urinary tract infection, something fairly common in kids that age. But we can't rule out something more serious, like meningitis or even a metabolic disorder.
To make matters more complicated, the mother mentions that she gave her daughter an unspecified medication before things took a turn for the worse.
Oh, that's a red flag.
Knowing exactly what that medication was is crucial.
It could be a potential overdose,
Right.
a previously unknown allergy.
Or even a medication that's masking the true nature of her illness.
Exactly. Thorough history taking is so important in a situation like this.
And here's where the scenario throws a curveball.
Oh.
It turns out that the medication was hydrocortisone,
That's interesting.
but shortly after its administration, her vitals plummeted.
So what could be the connection there?
It's a bit of a mystery, isn't it?
It is. Hydrocortisone is a steroid typically used to reduce inflammation, and it's generally considered safe.
But in this case, it seems to have had an adverse effect.
Yeah, that suggests there might be an underlying medical condition that made her react so dramatically to the medication.
So what are some conditions that we should be considering?
Well, one possibility is adrenal insufficiency, also known as Addison's disease.
Okay.
It's a rare condition where the adrenal glands don't produce enough cortisol.
Cortisol helps regulate blood pressure.
Right. And the body's stress response.
So giving hydrocortisone to someone with adrenal insufficiency could actually worsen their condition.
Exactly. It's counterintuitive, but that's what makes these cases so challenging.
Are there any other possibilities that come to mind?
Another possibility, although less likely, is a severe allergic reaction to the hydrocortisone itself.
Okay.
Or perhaps she has an underlying heart condition that was exacerbated by the medication.
So many possibilities to consider.
It really highlights the importance of digging deeper, looking for those subtle clues that can point us in the right direction.
It seems like these first 3 scenarios are already packed with so many lessons.
Yeah, they really are.
What are some key takeaways that you'd want our listener to absorb?
I think what stands out to me is the importance of rapid assessment and decisive action. In each of these cases, we see how crucial it is to identify the problem quickly and initiate treatment without delay.
Those first few minutes can truly make all the difference.
They really can.
And we've also seen how crucial it is to be adaptable.
Oh, absolutely.
These scenarios threw some curveballs our way.
They did.
A bariatric patient altered mental status, unknown medications.
You can't always predict what you're going to encounter in the field.
Exactly. So how do you prepare for that kind of unpredictability?
You're right. You can study protocols and practice your skills, but in the real world, you can never fully anticipate what you'll encounter.
So it's not just about book smarts.
It's about being able to think critically and adapt your approach on the fly.
Another key takeaway for me is the importance of communication,
Oh, absolutely.
not just with your partner or the responders, but also with the patient and their families.
Communication is at the heart of everything we do in emergency medicine. It starts with gathering information from dispatch, bystanders, family members.
Right.
And it continues with clear and concise communication within your team and with medical control.
And especially when you're dealing with a patient who is agitated, confused, or uncooperative.
Yeah, those communication skills become even more vital.
De-escalating the situation, building rapport, earning their trust.
Those can be just as important as any medical intervention we perform.
So what does all of this mean for our listener as they prepare for their own emergency training?
It means that knowledge is power. The more you understand about different medical conditions, treatment modalities, and potential complications, the better equipped you'll be to handle whatever comes your way.
But it's not just about book smarts, right?
No, it's about putting that knowledge into practice.
These scenarios give you a taste of what you might face in the real world.
So take advantage of every opportunity to hone your skills, whether it's through simulations, ride-alongs, or continuing education courses.
Because ultimately your goal is to be the best emergency responder you can be.
And that's a journey that never really ends.
Well, we've tackled 3 of our 4 scenarios so far, and I'm already sensing some common threads emerging.
Yeah, me too.
But before we get to those and dive into our final scenario,
Okay.
let's take a quick break. Stay with us. We'll be right back to unpack even more crucial insights.
Sounds good. Welcome back. I'm eager to dig into our final scenario.
This one's got some unique challenges right from the initial 911 call.
Ooh.
It involves a 46-year-old female who collapsed while walking on a path,
Okay.
and the family members who called for help stated that she was too heavy to move.
Oh, so right away we're thinking about a potential bariatric patient.
Exactly, and that adds another layer of complexity.
Yeah, it does. It affects everything from assessment and treatment to transport, even extrication.
So let's dive into the details of her presentation.
Right.
The scenario notes say she's unresponsive,
Okay.
no significant vomiting, but she appears to be extremely obese.
And there's cyanosis noted,
Right, that bluish discoloration of the skin.
a clear sign that she's not getting enough oxygen.
So combined with her unresponsiveness.
Yeah, it's a very worrisome picture. Establishing an airway and assessing her breathing, those become top priorities.
And it looks like the bystanders initiated CPR,
Oh,
with the AED applied as well.
okay.
The first analysis shows asystole,
No shock advised.
so no electrical activity in the heart.
Asystole or flatline means the heart's not pumping.
It's a life-threatening rhythm.
Absolutely. And while no shock is indicated, high-quality CPR has to continue.
They were able to clear her airway using suction and secure it with an oral airway,
Okay, good.
but she remains in apnea. So bag valve masked ventilation is required.
Apnea, the absence of breathing, really highlights how critical this situation is,
Right, that BVM ventilation is crucial to get oxygen to her vital organs.
especially her brain.
The family member who was with her mentioned that they were walking on the path when she started getting short of breath,
Okay.
and then she collapsed.
Did they say anything else?
Yeah, they said that the patient had told her to walk ahead because she was having stomach pain and couldn't keep up.
So shortness of breath and abdominal pain before collapsing, that raises some important questions.
Was this a sudden cardiac event?
Possibly. We also have to consider things like a pulmonary embolism, a blood clot in the lungs.
Or maybe a gastrointestinal issue?
Could be. We need more information to narrow it down.
Well, her past medical history includes obesity,
Okay.
type 1 diabetes, and a DVT 3 years ago.
That history is crucial. It increases her risk for a lot of serious medical conditions.
So we need to keep a broad differential in mind.
Absolutely, and work quickly to rule out those possibilities.
The second, third, and fourth AED analysis all continue to show asystole.
Still no shock advised.
Right, but then they apply a BPH patch,
A BPH patch, huh?
which I understand is for medical termination of resuscitation.
Yeah.
And it seems like this decision was made early after only 4 analyses
Wow.
due to her obesity and the anticipated difficulty with extrication.
This really highlights the difficult decisions that pre-hospital providers sometimes have to make.
Yeah, the decision to terminate resuscitation.
It's never taken lightly.
No, it's based on a lot of factors. The patient's condition, the length of time they've been in cardiac arrest,
Right.
and in this case, those logistical considerations.
So her obesity and the challenges of getting her out of that location played a significant role in that decision.
That's right.
It's a good reminder that we operate within the constraints of our environment and our resources.
Sometimes, despite our best efforts,
Yeah.
the situation dictates a difficult outcome.
I think this final scenario brings up a lot of thought-provoking points.
It does.
But if we take a step back and look at all four of the scenarios we've discussed today, what are some of the common threads that you see running through them?
Well, one of the most striking things to me is that rapid assessment and decisive action.
Oh, yeah.
In each of these cases,
It was so crucial to identify the problem quickly and start treatment without delay. Those first few minutes can really make all the difference.
we also saw the need for flexibility and adaptability.
Right. You can't always predict what you're going to find when you arrive on scene.
These scenarios threw us some curveballs.
They did.
That bariatric patient,
Huh?
the altered mental status,
Mm.
the unknown medications.
So how do you prepare for that level of unpredictability?
You can study all the protocols you want.
Yeah.
Practice your skills in a controlled environment.
But it's different out in the field.
Exactly.
Yeah.
In the real world, you have to think critically and be able to adjust your approach on the fly.
Couldn't agree more.
Another key takeaway from me is that communication,
Communication is so important.
not just between responders,
Right.
but also with the patients and their families.
Effective communication is at the heart of good emergency care.
It starts with gathering information from dispatch,
Bystanders.
family members,
Yeah.
and it continues with that clear and concise communication within your team.
And with medical control.
And we saw how important those communication skills are when you're dealing with a patient who is agitated,
Confused.
uncooperative,
Being able to de-escalate the situation.
build rapport.
Earn their trust.
Those things can be just as important as any medical intervention.
You're absolutely right.
So as our listener prepares for their own emergency training,
What does it all boil down to?
what are the key things they should keep in mind?
I'd say never stop learning, never stop questioning, and never underestimate the power of preparation.
The more you know, the more you practice.
The better equipped you'll be to handle whatever challenges come your way.
And in the world of emergency medicine, that knowledge and preparedness.
It can literally mean the difference between life and death.
Well said. Remember, every scenario, every patient encounter,
Yeah.
it's an opportunity to grow and refine your skills.
Embrace those challenges.
And you'll become a more confident and competent emergency responder.
Until next time, stay curious, stay safe, and keep diving deep.
Okay, so we've covered a lot of ground with these scenarios, but
Yeah.
I always want to dig a little deeper.
Always more to learn, right?
Let's rewind back to that high voltage fall.
Okay.
You mentioned the 12-lead ECG could reveal a lot about the impact on his heart.
Right.
What specifically were you looking for?
Well, electrical injuries, they can cause a wide range of heart rhythm problems.
Like what?
Some might be relatively benign, like premature ventricular contractions, where the heart just skips a beat.
Okay.
But others, like ventricular fibrillation, are life-threatening.
Ventricular fibrillation.
Yeah, that's where the heart's lower chambers, they just quiver ineffectively instead of pumping blood.
So the type of arrhythmia that develops
Yeah.
depends on a lot of different factors.
Absolutely. The voltage of the current, the
Yeah.
path it took through the body, even the duration of exposure, all of those things play a role.
So it's not just about the immediate shock then,
No.
but also the potential long-term effects on the heart.
Exactly. We could stabilize him now, get his heart rhythm back to normal, but there could still be lasting damage to the heart muscle itself.
Leading to problems down the road.
Right, it could lead to chronic heart problems later on.
So careful monitoring and long-term cardiac care are really essential.
Absolutely. We can't just treat the immediate problem and assume everything will be fine later on.
Now let's go back to that industrial amputation scenario.
Okay,
We talked about hemorrhage control.
top priority.
But what are some of the specific techniques that can be used to control bleeding in a situation like that?
Well, the first step is always direct pressure.
Applying firm pressure to the wound.
To try to help slow that bleeding down, buy us some time.
Okay, but if direct pressure isn't enough,
Then we need to escalate our intervention. A tourniquet should be applied above the injury, tightening it down to completely stop blood flow to the limb.
and a tourniquet can be a life-saving measure.
Absolutely, especially when you're dealing with this kind of massive bleeding.
We saw that in the scenario, the patient eventually became unresponsive.
Right.
What's happening inside the body when someone experiences that level of blood loss?
As the blood volume decreases, the body goes into shock.
Okay.
The heart can't pump enough blood to the vital organs. And that leads to a cascade of problems. Organs start shutting down, and if we don't intervene quickly, it can be fatal.
It's a chilling reminder of how fragile we are,
Yeah.
how quickly things can go downhill.
It really underscores the importance of those first few minutes in a traumatic injury.
Okay, let's talk about the ethical considerations that were woven through that altered mental status case.
At the bus stop.
Yeah.
Okay.
It seems like there's always this delicate balance
Mm-hmm.
between respecting patient autonomy and the need to provide care.
Especially when someone's refusing transport.
It's a tough situation.
Yeah.
How do you navigate that gray area?
Well, first and foremost, it's about building rapport. Approaching the patient with empathy, explaining our concerns in a calm, non-judgmental way, and really listening to their perspective,
Okay.
trying to understand where they're coming from.
But if, despite your best efforts,
Yeah.
they still refuse transport,
Then thorough documentation becomes incredibly important. We need to meticulously note their mental status, their capacity to make decisions, and any risks or concerns that we've outlined.
so it's all about covering yourself legally.
No, it's not just about that. It's about painting a clear picture of the situation so that if anything happens down the road, there's a record of what transpired.
But even then, there's always that lingering worry.
Of course there is. And ultimately, we have to trust our gut. If we have any doubts about their safety, it's always better to err on the side of caution and transport them to the hospital.
Great advice. Now, finally, let's revisit that unresponsive child case and that unexpected reaction to hydrocortisone.
Okay.
You mentioned adrenal insufficiency as one possible explanation.
Right. Addison's disease.
Yeah, there are other conditions that could explain such a severe response?
Well, one possibility is congenital adrenal hyperplasia, or CAH.
CAH.
Yeah, it's a genetic disorder that affects the adrenal glands. And if it's not managed properly, it can lead to an adrenal crisis, which is a life-threatening situation.
So a medication like hydrocortisone,
Yeah,
which we often think of as being relatively benign,
right.
can actually have really unexpected
One even dangerous.
consequences for certain patients.
That's why it's so crucial to get a thorough medical history.
Okay.
Consider any underlying conditions and always be prepared for the unexpected.
It seems like that's a theme that runs through all of these scenarios.
She really does.
What's the one message you want to leave our listeners with today?
I'd say it's this. Never stop learning, never stop questioning, and never underestimate the power of preparation. In emergency medicine, knowledge and preparedness can truly make all the difference.
Well said, and remember, the learning never stops. Each scenario, each patient encounter is an opportunity to grow and refine your skills. Embrace those challenges, and you'll become a more confident and competent emergency responder.
Until next time, stay curious and keep diving deep.